Hello everyone. Today we are to discuss the subject that is human anatomy. It will be indeed a pleasure of me to teach you human anatomy in the best possible way using 3D animations, annotations on PDF and everything, even the notes. Okay, so the first and foremost thing is to introduce you to this anatomy subject, and then we will discuss some of the important anatomical terms. If you attend this class and understand this good, trust me, you will not face any single problem in the entire course of your MBBS. Okay, I will try to include as many as clinical terms possible, as many as anatomical related words which you can hear and read in your entire life. So let's start without any further delay. To introduce the topic first, as you know, this human anatomy is a branch of science that deals with the study of structure and organization of human body. Okay, so this human anatomy word is actually derived from the Greek word that is anatome. Okay, and if we break this anatome into two words, so ana, that is through, okay, tome, to cut open, or you can say to dissect. Okay, we will go on for that also, don't worry. So this word anatomy, so you can pronounce as anatomy or anatomy or anything. I prefer anatomy. Okay, so this word is coined by Aristotle, okay, 2300 years back. Okay, so you will also hear a word that is the, you can say, part and parcel of anatomy, that is, the word is cadaver. So what is a cadaver? It is a deceased body of a human being that is used for educational, medical or scientific purposes. It is preserved using formalin solution. Okay, and then you will often hear a word that is dissection. Okay, the process of carefully cutting and separating the various structures of the human body and to study the anatomical structures and its organization. Trust me, it's a beautiful machinery which is working day and night for you, and you don't even know about the so many structures there are in the human body. And trust me, consider yourself lucky that whatever you're going to read in this subject is present inside your body. So it's nothing you're wasting your time, you're reading more about yourself. Okay, so it's the best knowledge in the entire world which you can gather. So have that spirit always inside yourself. Okay, then we come on to the subdivisions of anatomy. So to study anatomy, we can divide it into various types, okay, based on the method of study. Number one, that is the gross anatomy, which will be the main course during your MBBS first year syllabus. Okay, so this is basically cadaveric, or you can say topographical anatomy. It is a study of the human cadavers by dissection. On gross, what you are seeing the structures, that is gross anatomy, and it can be divided further into two types. Okay, one is the regional anatomy. That will be the main syllabus through which we will also be going and making you read all these topics. So regional anatomy, a study of the human body in parts. Okay, so what are these parts? Head and neck region, this will all be the extremities or the regions which we will study. Then including inside the head and neck, we will have brain, or you can say neuroanatomy. Okay, neuroanatomy, right? Then we have thoracic region, thorax. Then just below the diaphragm we have the abdomen, and then further we have the pelvis and the limbs. Okay, so the upper limb and the lower limb. Okay, so we have the limbs, right? Then understanding this, so you can remember there are 6 different parts which we will be studying in the entire year. Okay, and in the course of the division, we can also read the entire anatomy in the form of systemic anatomy, that is a study of the human body forming a particular system. So I think this you have already studied in the biology classes in your 11th and 12th, where you heard the system wise anatomy. Okay, so what are those systems? The one is the integumentary system, okay, the skin basically, which we'll discuss today also. Okay, skeletal system consisting of bones. Arthrology, these words are very important. Arthrology is the study of the joints specifically. Muscular system, muscles. Nerves, nervous system. Cardiovascular system will include all the arteries and veins and capillaries and all those structures we will take up separately. Lymphatic system we will discuss. Then endocrine, digestive, respiratory, reproductive and urinary system. So I will give you an overview of the last few categories of systems which we will discuss separately in a separate class. To give you an overview, most of the things are known to you, but there will be something which will be really helpful during your course of classes. Okay, then we move further. As I told you, one is the gross anatomy. Then we have the microscopic anatomy, that is a histology, and this will be the most important nightmare of your first year. Okay, and this will form the basis of the subject pathology, which will be in your second year MBBS. Okay, so again, this microscopic anatomy histology is very important, and that is nothing but study of the structure using microscope. A very important question which you should focus upon, and many of the students commit this mistake. Whenever there is a short note in your exams, in your university exams, theory exams, whenever they ask you to write the microanatomy, okay, microanatomy of thyroid gland, or suppose any structure, microanatomy, so that means they are asking you the histology. So do not start writing the gross anatomy, you will not get marks. If you out of 5 you will get 0 marks if you only write the gross. So you need to draw histological diagrams using the H&E pencils, and that will only fetch you marks whenever you read this word microscopic anatomy or microanatomy. So never forget this. This is a very important exam pro tip which you should remember. Then surface anatomy, there will be a separate viva for you in the main university exam for the surface anatomy, and I will also cover the surface anatomy topic wise wherever it's required. So that is nothing but to study the relationship of the deeper structures of the body. For example, we are palpating the radial artery. Okay, so there are certain important things to remember for bony landmarks, soft tissue landmarks, and certain arteries, vessels, and nerves, and even the internal organs. The surface anatomy is very important. Okay, then living anatomy, that will be again very important in the further course of years of your MBBS, in which you will understand the inspection, palpation, percussion, auscultation will form the 4 pillars of your examination findings. Okay, so these things you can do with various aspects like bronchoscope, gastroscope, cystoscope, and other imaging techniques also can be used. Okay, so you can pick up the word broncho, means we are talking about something related to the respiratory system. Okay, then gastro means for the gastrointestinal system, GIT. Okay, cystoscope is an instrument which can be visualized into any other internal organ. Suppose if you are looking into the urinary bladder, okay, so we are using cystoscopy. So there can be any kind of areas where you can looking through a instrument, so that is all these scopies. Okay, clinical or applied anatomy, which will again be the bread and butter of your anatomy classes. Trust me, if you write and become masters of this clinical or applied anatomy for each and every topic, you will do wonders in your main exams. Okay, even the viva, you will ace your exams. So even if it is asked or not asked, study everything related to clinical or applied anatomy. It is extremely important not only for exams, for your entire life as a doctor also. So it's an application of the anatomical knowledge for diagnosing and treating various diseases and surgeries. Okay, then you know something about the radiological anatomy, so study of the bones and its structures using radiology. So this also I will take up a separate class in general anatomy for the principles of radiology, which you will understand further important aspects which will be useful for your examinations like ultrasonography, CT scan and MRI, and what or other things can be there. Okay, then there are other things like experimental anatomy, which includes the study of the factors that determine the form, structure and function of different parts of the body. Then again, a very important entity which will not leave your soul in the entire first year, that is the embryology. Okay, and you will be haunted by this embryology. So if you don't study properly, embryology is developmental anatomy. So you will study all the important structures and its developmental aspects in an individual or an embryo. Okay, then genetics, which you will study in bits and pieces. At some places you will hear some questions, those will be in your viva, in your spotting exams. So you can do selective study for this genetics topic for your MBBS course with respect to anatomy. Then comparative anatomy is to compare the different structures with respect to different animals and human body. It's important for museum kind of stuff, but not for your entire course. You will not be able to study so much, and it's not required as per your curriculum to discuss everything compared to an animal. Okay, but yes, this is very important because during research this plays a very crucial importance when, suppose if you are going to AIIMS Delhi or some higher centers for research purposes. So you can see, you can use this anatomical knowledge of the animals to try to inculcate some of the diseases in those animals, and you can prepare a model of that animal model of that disease to check for any treatment therapeutic indications. So it plays a very important role in the research. Okay, then physical anthropology, study of external features and measurements of different races and groups of people. This will again play an important role during research. Okay, when you will study something, if you do out of your curiosity, if you do something with respect to different races, different ethnicity, if you are studying a disease in different kind of group of population, so that will play a very important role to understand the differences. Then something about the history of anatomy. See, trust me, I personally also hate the history of anatomy, but there's no other option, because this information which I am going to project in history of anatomy, it's not going to be very boring or dull. Trust me, the only important statements I have put in the subject of history of anatomy. So I am very choosy to what to tell you in this topic, even for the entire anatomy syllabus. So stick to that. There are other things in the textbooks, but if you stick to this, you can do wonders in your MCQs, in your theory exams, viva. You can study a lot extra, but this much will also do. Okay, so there are some contributions, okay, by certain important scientists or physicists or any important personnel. So you should know the names and for what they are known. Okay, so that's it. There is nothing too much to learn about them, and most of them you should already have heard maybe. Okay, number one is the Hippocrates. Okay, you know the Hippocratic oath also, right? You will be taking once you complete your MBBS. So that Hippocrates is known as the father of medicine. MCQ. Okay, these are all your one-liner MCQs which you should remember. Then the Herophilus is known as the teacher of anatomy in Egypt, as he was the first one to dissect the human body. Again, extremely important, and he is known as the father of anatomy. Okay, again an MCQ. Please remember, I will tell you another father of anatomy. Then there is Leonardo da Vinci. I think you have already heard of this name in movies and all. So he was an Italian genius artist and anatomist. He is known as founder of modern anatomy. Okay, not father, founder. So please remember, this is again an MCQ. All of you remember the artistic work of Leonardo da Vinci, that was Mona Lisa's famous painting. All of you have seen in various movies, it has been shown. Then a very important name which you should always and always remember, never forget this, that is the German anatomist name. He is known as the reformer of anatomy, again an MCQ often asked. And then he is also known as the father of modern anatomy, again an MCQ which has been asked. Okay. So then an important entity, that Andreas Vesalius, he has also written a book, that is De Humanae Corporis Fabrica. Okay, you can go through and Google this name and you will understand the artistic work of this person. And he actually showed how beautiful the God's creation is, that is the human body. Okay, don't trust Google for any other information. Whatever I have given here, you can trust me. Okay, and I have fetched it from good sources of textbooks. Okay, Google may give some other information wrong, because there is always a contradiction regarding the history of anatomy, who did what. Okay, but these are certain names which you should remember. Okay, so then you might have heard of the name William Harvey, again extremely important name, you cannot forget this. This actually important for the blood circulation, so this name always link it with the blood circulation. So who established? So this is the William Harvey's name which you should remember. Okay, then Antony van Leeuwenhoek, a very important famous name which you will hear, as he discovered the microscope itself. So histological anatomy which you are studying, that has not been possible if he was not there, obviously. Okay, so discovered a microscope, again that is an MCQ which you should remember, who discovered it. Okay, they will give you the match of the following kind of questions where you should be able to guess the names and its relation, what he did actually. Again Malpighi, Marcello Malpighi name linked to the father of histology, again an MCQ which has been asked previously, so please remember. Then you will hear the name of William Hunter. Okay, who did the modern embalming techniques. Okay, so obviously you won't be doing any embalming, but there is a body preservation and method, that is embalming, okay, through which you are able to get the cadavers to dissect. So he invented this modern embalming techniques. And then John Hunter, the most important name, John Hunter, he is a famous surgeon, and this name you will hear again in the lower limb when we will discuss, that is the Hunter's canal or adductor's canal. Okay, again extremely important canal, short note, frequently asked in the examinations, so this we will study there. Okay, then we go on for the next name, that is again you might have heard somewhere, Roentgen. Okay, the von Roentgen, that is he discovered the X-rays. Okay, so again the discovered X-rays is very important, who was the one, that is the Roentgen. Okay, then Gregor Mendel, I think all of you have heard this name, Gregor Mendel. He is known as the father of genetics. Okay, you have already studied this name in biology classes in 11th-12th. Then there was someone known as Kocher. Okay, Theodor Kocher, you can remember Kocher itself, and he was Nobel awardee for thyroid surgery, and we will study thyroid gland separately in a class where you will hear the name Kocher's vein. Okay, so therefore this name is important with relation to thyroid. Okay, then there are some names like Golgi and Kajal or Kajal, whatever you can say. He was awarded Nobel Prize for the work on nervous system. So there are certain structures which we will see in the neuroanatomy. Okay, some nucleuses, some cells which you will hear these names, the Golgi and the Kajal. Okay, so hence these are important names in with respect to the neuroanatomy. Then there is another name, that is Ernst Rusk and Max Knoll, who developed the electron microscope. Again very important, this is an advanced microscope, all of you have known this, we will study again in histology separately. Then the very famous person which you have heard in again 12th, that is Watson and Crick model, okay, of DNA. So these two people actually discovered the DNA structure of the 3D structure of DNA. Okay, so again this is important, and even this 1948 year for this Watson and Crick is again important, has been asked separately in the MCQs, so you should be aware of this. Okay, so that's it about the history of anatomy. Before we jump to the next, just want to tell you few things. Okay, so that is the next thing is the anatomical terminology. Okay, so before we begin this anatomical terminology, let me tell you a few important facts to remember. The largest region of the human body, that is the abdomen. Okay, abdomen has a lot of things we will discuss separately. The largest bony cavity of body, that is the cranial cavity. Okay, then longest bony canal of the body, that is known as vertebral canal. Okay, in which between the vertebrae you have a canal, we will study separately. Then largest serous cavity of the body, that is again the peritoneal cavity. Okay, we will study again in detail. Hardest tissue of the entire human body, that I hope you all know, that is the enamel of the tooth. Okay, then what is the first organ of the body which starts functioning? That is the heart. Okay, so with this introduction and some important interesting points, let us begin with the anatomical terminology. Okay, so there are certain important points to remember for each of these things which I am going to project, and most of them you will hear and during the entire course region wise repetitively, but some things are important for examination point of view, so pay more attention. Anatomical position extremely important for theory as well as viva. Okay, so please remember this for sure, don't forget it. Now anatomical position, this is defined as the body is erect. You can see this image. Okay, I cannot right now project everything as per my understanding in my body, but you can visualize this image and remember the important key points. So the body is erect, number one. Okay, that is very important feature. Okay, eyes are directed forwards and looking straight. Okay, again very important point. Upper limbs, they are hanging by the side of the body with the palms of the hand facing forwards and fingers pointing straight downwards. Okay, just like it is shown in this image. All of these important points are your viva question. Okay, so you will be asked to stand in anatomical position in front of the examiner and you have to tell all these points. Very important point to remember, the lower limb are parallel to each other. Okay, then this one, okay, palms, eyes. So these are certain important points which you cannot skip. Okay, then feet flat and close together, toes pointing forwards. So these are certain key important points which you cannot afford to miss while describing this. Okay, you can miss few things which I have not marked. Okay, most of them I have already marked, but these few things you should always remember. So what is the importance of this anatomical position? Okay, in the medical field, all the body structures are described in anatomical position. The descriptions of all these structures in anatomical position, they are very essential. Suppose for standardization of all the descriptions, like irrespective of the position of the patient or specimen, place, time or anything. And also very important to precisely describe something. Suppose I have to teach you some structure, so it will be better if I have a standardized anatomical position to describe, so that it's common for everyone in this entire world and it will avoid any confusion if I use any word medial or lateral or anything. We will talk about clinical assessment and surgical planning also will be important when using surface anatomy. So this will also utilize your anatomical position knowledge. Radiological imaging and its comparison with the living anatomy, again that will involve anatomical position. And also very important, communication with the patient. If someone has some fracture or a disease, So you can discuss the anatomical position and explain to him how he is having a disfigured limb or something. Okay, so very important anatomical position in all spheres of life. Then describing anatomical position doesn't make it complete, so there are other certain positions of the body, okay, which you should remember. Now please remember, before I begin all these positions one by one, you should know these are all positions, not anatomical positions. Okay, so when you are looking for the images in any kind of books, don't pay attention to the anatomical position features which I just talked about. Okay, so they may be different because we are talking about overall the position of the body or the limb or a specific part of the body, in what position we are talking. Okay, so number one is the supine position. Supine position, in which you can see a person is lying on back, arms by the side, palms facing forward, and feet are put together. Okay, so very important basic position which you should understand. Then prone position. Okay, these are the two positions which you will find for the cadaver. Okay, during the entire year when you will see the dissections in the human body, you will see these two positions only. Okay, so in prone position, a person is lying on their belly with face, chest and abdomen facing downwards. Okay, so again this is important for the dissection also, when you will dissect the back side. Okay, then there is a position known as lithotomy position. So being a doctor, you should be aware of this position again. So in lithotomy position, a person lies on the back with legs up and feet supported in the stirrups. Okay, so these are the stirrups which you can see. Okay, so these are very important positions. If you don't know the relevance of these positions and how they are described and how to make them for the patient, so you cannot get your work done during surgeries. These are very important. So when you utilize these positions, you can achieve the anatomical structures, the knowledge which you can use to visualize certain things. Okay, so usually during the gynecological examinations, and obviously during the delivery of the baby and certain surgeries, you use this lithotomy position. So you should be able to describe to the patient how he has to be there. Okay, so knees are semi flexed, notice this, knees are semi flexed. Okay, and thighs are abducted, very important. Okay, thighs are abducted and knees are semi flexed. Okay, these are very important points. Legs up and person lies on back. So this position is normally used for the normal vaginal delivery and also for the perineal examination. Okay, we will study the perineal region separately. So any kind of procedure, examination, surgeries can be using this. Then what else? We have the right lateral recumbent position. Okay, so there is something known as fundamental position. Okay, so fundamental position is similar to the anatomical position only, except the palm is facing the body. Okay, so suppose if you are standing in an assembly, so that if you are facing forward and if you are looking, that is almost an anatomical position only, but the palm is facing towards the body. Okay, so that is a fundamental position. And then you have right and left lateral recumbent position, in which you can see the person is lying either on the right side or left side, with the body's right side or left side actually touching the surface. Okay, so these are the recumbent positions. Again, these are very important during certain specific procedures, like you will be examining the body, so you will be understanding these relevance of these positions later on. Okay, so if the surgeon or if the doctor who is teaching you the clinical examination, if he says please place the patient in left lateral recumbent position, so you should be able to understand what to do. Then there is a Trendelenburg position. Okay, we will study this word many times, Trendelenburg sign. Okay, but position is something different. Okay, in this position a person is lying in the supine position only, with the feet higher than the head. Okay, by 15 to 30 degrees. This position is very important, especially for you should know, because being a first year student, when you enter the dissection hall and you are seeing the cadaver for the first time in your entire life, you tend to faint. Okay, So some people vomit and some people tend to faint, and when you faint, then you have to be put on a stretcher or on a bed, and then we use this Trendelenburg position to make you wake up, okay, without any other medical attention. So this position helps. What it does, it does to help to increase the blood flow to the brain, okay. So blood flow increases to the brain, okay, in this region. So in cases of hypotension, in case of shock, it is used, okay, Trendelenburg position. It is even used in case of laparoscopic surgeries of the lower abdomen and pelvis, okay. So this is the clinical relevance for the Trendelenburg position, which you should remember. Then we have Fowler's position, okay. What is this Fowler's position? I think you all have seen in movies and pictures, and and so many, if you have gone in wards, you will see this Fowler's position very commonly. What is this? In this position, a person is sitting straight up or leaning slightly backwards, okay. This position helps in improving the breathing in non-ambulatory patients, okay, and increases comfort during eating, okay, very important, okay. I hope you all are understanding the things. You can give me thumbs up in the chat so that I can move accordingly, because these are some words are new to you, some words are already known to you, but it will be really helpful if you interact in the chat so that I can also understand what you're going through. Okay, because the words will get tougher sooner or later, so hence you should be able to. Okay, so you can message in the chat if you're understanding everything. Give me a thumbs up or yes or something, okay. I will move accordingly, and it shows that you are attentive. Okay, so this is Fowler's position, okay, which I just told you. Then we have another position, that is the Sims position, okay. What is the Sims position? In this position, a person lies on his or her left side with left hip and lower limb straight, okay, right hip and knee semi flexed, as you can see in this image, okay. It is used for rectal examination, okay. If you want to do a per rectal examination, so you can use this Sims position, okay. Again, very important clinically, okay. You will understand this further. I have written everything below also, used for rectal examination and improving breathing in non-ambulatory patient. I have written few keywords so that you can revise. Obviously you need to see my videos so that you can recollect the things what I am telling you, okay. Then done with the positions, so then we can use the anatomical planes of the body to understand certain structures, okay. So see this beautiful image showing the different planes which you can understand. So midline, here you can see one plane, and then you can see transverse horizontal plane, and again mid sagittal, this is mid sagittal, then there is a sagittal plane parallel to it, and then there is a coronal section. If suppose if there is a wall in front of you, okay, so that is a coronal plane. Okay, so anatomical planes are useful for description of the different structural arrangements of the human body and relationships of the different structures. So if you do a CT scan or an MRI scan, so these are the different planes which are important, okay. So rectal means rectum, we are talking about the rectum basically. Okay, we'll study that in detail in the abdomen and pelvis region. Okay, we will discuss about these planes one by one, don't worry, I am bringing this topic now. So I hope you understand the importance, clinical importance of these anatomical planes, why they are important. So number one, we have a median or a mid sagittal plane, okay, which you can see in this image also, median or a mid sagittal plane. So this is passing through the center of the body, and it divides it into two halves, equal right and left halves, okay. So you will study this more importantly mid sagittal section of the brain, where we will study different important structures. So neuroanatomy, sagittal section, horizontal section, coronal section is extremely important, okay. Then there is a sagittal plane, the word sagittal plane. Now there is a catch, okay. So please remember, as someone messaged in the chat also, any plane parallel to the median plane is sagittal plane, okay, simple. So it can be parasagittal, it can be simply sagittal. So in the textbooks you will see mid sagittal plane, that is a very good textbook, some textbooks may mention sagittal plane, so they have maybe they're not using the nomenclature properly, but you have to be very wary about where the word is used. But classically, if it is used mid sagittal section, so that means the midline, and if you are going parallel to the median plane, that is the sagittal plane. It can be parasagittal plane also. Then we have the coronal plane. Okay, it is called as frontal plane, but you remember coronal plane only because that is more standardized nomenclature which is followed. It passes longitudinally at right angle to the sagittal plane. During my NEET PG entrance exam, I got an image based question in which the planes were asked. So you can imagine such a basic question they asked in the exam. So again, so much important this is. So this divides the body into anterior and posterior portions, the coronal plane. Okay, then we have a transverse or a horizontal plane. Okay, it is a cross sectional that plane that passes parallel to the horizon and divides the body, any part of the body, into upper and lower parts. Okay, then there is another plane also which is known as oblique plane. Okay, oblique plane, any plane other than all these planes which have been described in this image, like coronal plane, transverse plane, sagittal, mid sagittal, any other plane is the oblique plane. Okay, so not disturbing this diagram, just showing you, highlighting. Suppose if I take a section this way, if I take a section in this manner, any kind of oblique section, that is an oblique plane. Okay, simple. Then we discuss about certain important anatomical terms. I hope now certain queries in the chat are clear. Okay, you can give me a okay or thumbs up if you are getting to understand these things. Anatomical terms. Now anatomical terms are very important because you will often hear them, and trust me, you have to develop a habit of English. Okay, not Hindi. Okay, आगे और पीछे नहीं बोलना है, speak anterior and posterior. You become a doctor, and if you answer these terms, use medical terms, anatomical terms to discuss with your colleagues and also to write on your prescriptions to describe certain lesions, you will gain more attention, and that will be more acceptable socially also, and also during your presentations in academic conferences. So these words will be spoken by you in English only. Okay, that's a standardized language which is used in India. So you should be able to focus more using English, and all the anatomy textbooks are in English only, as you know. So that will make much more relevance to communicate further if you plan to go abroad in your future. So if you develop this starting habit of English, it will be helpful. It will take some time initially for some students, but trust me, it is important. And I am focusing on English terms only so that you get used to it. Once you start hearing more, you will learn more. Okay, so there is a word anterior, that is towards the front of the body, as you can see in this image. Okay, then posterior, okay, that is towards the back of the body. Superior, towards the head of the body. Cranial, same word. Inferior or caudal, towards the feet. Okay, then similarly we have certain words like proximal, distal. Okay, same meaning, towards the body, and distal we are moving away from the body, so this is distal. Okay, this is proximal. Okay, then this foot, if you look at, this is having dorsum above and plantar surface below. Okay, then we don't add any more planes. Whatever I am teaching you, that is more than sufficient, and that is only being used in your entire anatomy syllabus. Okay, so study these words clearly. Proximal and distal, okay, which I just showed you. So in this lower limb and upper limb, you can imagine the distal and proximal through these images. Then you have certain words like the medial, that is towards the median plane of the body. Okay, so this is medial, A point, which is shown in this image. Lateral, away from the median plane of the body. Okay, we are using this midline, which is the median plane of the body, as a standard point. Okay, then superficial, towards the which is not shown in this image, but superomedial and inferolateral, these are two relative terms. Okay, which you can understand just superiorly and inferiorly. Okay, so lateral and medial. Similarly, there will be borders which will be medial close to the median plane, lateral away from the median plane, the borders of the limbs. Okay, and then there is different terms like superficial and deep. Okay, so superficial is towards the surface of the body skin. Okay, so that is superficial. Then we have deeper aspect. Okay, inside, deep inside, away from the surface or the body of the body or skin within the body, you can say. Okay, then again superficial, you can see in this image. Okay, then there will be some terms like central. Okay, central means towards the center of the body. Okay, central, that is towards the center of the body. Then peripheral, away from the center of the body. Okay, so there are other words which you can understand: the central, peripheral. Okay, so I hope you remember the central nervous system, peripheral nervous system. Okay, external and internal. Then there will be some words like external and internal. Have a look at these image. Okay, then there are certain terms like external, not the external examiners I am talking about. Okay, the external and internals. So external is close to the surface of the body, that is towards the skin. Internal is close to the center of the body. Okay, so again internal. Then ipsilateral. Ipsilateral would mean towards the same side of the body. Okay, opposite word for this one would be contralateral. I am writing the keywords here so that you can revise and recapitulate. You can recollect whatever I have told you. We will be using them multiple times at so many places. Okay, especially in neuroanatomy, we will see the lesions, and we will discuss the ipsilateral, contralateral. Okay, then there are words like invagination, evagination. Invagination, inward or inside protrusion. Evagination is outward or outside protrusion. Okay, so this manner you should remember. Okay. So I hope you know this now. In so ipsilateral and contralateral. Okay, I hope this is understandable. Invagination and evagination. Okay, then for the limbs we can see the words. Okay, for the limbs we can use these words like proximal, which is written in this image only, proximal, and distal, which I showed you previous image also. Proximal is near to the trunk or close to the root of that limb. Okay, so starting point of that limb, that is proximal. Distal is away from the central trunk or away from the root of the limb. Simple. Okay, then there is a palmar surface. Okay, which you know, this is towards the palm of the hand. Then dorsal surface, towards the dorsum of the hand or the foot. Okay, for that matter. And then we have a ulnar border, that is a medial border, and lateral border or a radial border. So ulnar is towards the inner border of the forearm, and radial is towards the outer border of the forearm. Okay, right. And similarly for the lower limb we will have certain words, that is the tibial border. Okay, towards the medial side of the leg, you can imagine on your body. Then we will have the fibular border. Okay, which will fibular side or tibial side towards the outer side of the leg, that is fibula. Tibia and fibula are the two bones, if you remember, for the leg. Then we have certain surfaces. One is a flexor surface, so that is front of the upper limb and back of the lower limb. Okay, front of the upper limb and back of the lower limb. So remember one and you can remember the other one. Okay, so flexor surface, flexor and extensor. We will read them in the limbs. Okay, so this is flexor surface, front of upper limb and back of lower limb. Okay, and extensor surface, back of upper limb and front of lower limb. This will be very important when we study the muscles also. You will remember the flexor and extensor group of muscles. Okay, similarly then we have the plantar surface, that is towards the sole of the foot. Okay, so there is a there is a plantar surface, okay, towards the sole of the foot. Okay, then we have certain words with respect to the embryology. Okay, so there will be some embryological descriptions. Let me write it here only. Okay, then we have the certain terms used for embryological descriptions. Okay, so when you will study the book of embryology, you will see these words. What are these words? Number one, ventral. Okay, that is towards the belly. Okay, then dorsal, that is towards the back. Okay, then cranial or rostral, again very important, you get confused between these two terms, the rostral end, that is towards the head end. Okay, cranial end. Caudal is towards the tail. Okay, then you have two words that is, one is the pre-axial border and post-axial border. Okay, so there is a word pre-axial and post-axial. Okay, these are all borders. Okay, the pre-axial border is the outer border of the upper limb. Okay, and inner border of the lower limb. Okay, this has importance in case of embryo. Okay, not in case of adult. You will not be it is not of any relevant. You know the radial border, ulnar border, tibial border, fibular border, that is more than sufficient. Okay, so for post axial we have the inner border of the upper limb, and outer border of the lower limb. Okay, exactly the opposite of the above. So during the embryonic development, okay, the limbs actually rotate opposite to each other. So the upper limbs, they rotate medially. Okay, so rotation, if you discuss rotation of the limbs, that is why this is happening. Okay, don't have to go into too much details how this rotation is happening, just the resultant of this rotation you should know and how it is happening. In detail you don't need to study, because limb rotation and limb development is not in your curriculum. So you can just remember simple viva question, because this knowledge we will use when we will talk about the nerve supply of the important areas. So rotation of the limb, okay, so that that includes the upper limbs, they are rotating medially. Okay, upper limb rotate medially. Okay, and the lower limb, they rotate laterally. Okay, so upper limb rotating medially, and in case of lower limb they are rotating laterally. Okay, so that is why we are getting these borders which are different for their different limbs, upper limb different, lower limb different. Then there are certain terminologies used for the muscles. Okay, which is number one, origin, that is relatively fixed end of the muscle. Okay, although these origin and insertion, these are relative terms. Okay, so insertion is relatively movable end of the muscle. Okay, this is relatively fixed end of the muscle. So nowadays the origin and insertion word is okay if you can remember, but you can simply use the word attachments, because it's not true for every place in the body that insertion is relatively movable and origin is relatively fixed. It's not happening everywhere, so that changes. So hence you can use the word attachment to be precise. Okay, so these are the origin and insertion which are relative terms. Okay, then there is a term tendon. Tendon means fibrous non-contractile cord or rope like end of the muscle, okay, tendon, which for the different muscles you will see the tendons. We will discuss a lot of tendons. Then there is the belly of the muscle, which is the fleshy and the contractile part of the muscle. Then there is a aponeurosis. Again we will discuss palmar aponeurosis, plantar aponeurosis. These are flattened tendons only, okay. Then there is a word raphe. What is raphe? These are stretchable fibrous band made up of interdigitating muscle fibers, okay. So there are certain raphes in the body, especially in the head and neck region we will talk about, okay, at some places. So those are raphe. Then we have ligaments. With respect to each of the joints we will talk about, there are certain ligaments like the fibrous inelastic band which are connecting the bones together. So bone to bone, that is ligament, okay. Then tendon is ligament, tendon is muscle to bone, okay, and ligament is bone to bone. Then other terms what are used, one is the prime movers. What is this? The group of muscles which initiate and maintain a particular movement, okay. So some muscle groups are known as prime movers. Some are known as antagonists, which oppose the action of these prime movers. Then we have certain synergistic muscles which assist the action of the prime movers, okay. Then we have fixators, which are a group of muscles that contract simultaneously and isometrically to fix the bone, okay, and they will facilitate the action of the prime movers, okay. So there are certain fixators of certain group of muscles, okay. So then there are certain terms with respect to the movements, okay. Number one, that is the flexion, okay. For the movements we are talking about flexion. So it approximates the flexor surfaces of the adjoining body parts to reduce the joint angle, okay. So this takes place in the sagittal plane around the transverse axis, okay. So don't need to worry about the axis, because axis and all those structures are not too much asked in your Viva and theory. That is for a postgraduates, that how the axis movement is happening around the axis. But for your undergraduate level first year, you don't need to bother about the axis and all. You just remember the movements, that is more than sufficient, okay. Then we have the extension, okay. As you can see in this image also, extension is, it approximates the extensor surfaces of the adjoining body parts to increase the joint angle, okay. So flexion of the elbow and extension of the elbow, which I can show you, okay. Then there are certain words which are adduction and abduction, okay. Adduction and abduction. There in this image you could see other words also, like the flexion and extension at the ankle joint. So those was plantar flexion, that is of this plantar surface that is having flexion, and the dorsum of the foot having its flexion. So that is dorsiflexion and plantar flexion, very important neurological examination. Then all the other joints are shown to do flexion and extension in this image. So these are certain movements which are happening at certain joints, right? Then we have an abduction movement, extremely important movement. We will study in the upper limb region how the abduction of the upper limb is happening, okay, at the shoulder joint especially. So it is the movement of the limb away from the midline in the coronal plane, that is abduction, okay. Then we have adduction, which is ADD. ADD means it is a movement of the limb towards the midline of the body in the coronal plane, okay. So I hope you understand. Flexion is this, flexion of elbow, and extension of the elbow is this, okay. And adduction adduction and abduction at the shoulder joint, okay, which you can see in this image. So these are very important movements. Examiner can say to you to do these movements and perform them, to tell you all the muscles how these are performing, okay. So again, these are very, very important from the examination point of view. Then we have certain other things. What are the rotations, okay? Medial rotation, lateral rotation, okay. So rotation movements which are involved. So rotation is the movement of the body part around the long or vertical axis. Okay, so it can be medial rotation or lateral rotation. Okay, simple. Right. Okay, and then medial rotation is inward rotation to make the anterior surface of the part to face medially. Okay, it is lateral rotation is an outward rotation to make the anterior surface of the body part to face laterally. Okay, so this is something which you should know about the medial rotation and lateral rotation, as you can see in this image. Okay, with the neutral position in the center and it is moving. So there is a medial and lateral rotation of the arm, which you can see in this image. Then you have the combination of all these movements. It is a circular cone shaped movement of the body part with the combination of flexion, extension, okay, adduction, abduction. So the joint is forming the apex of the cone, okay, in which the movement is happening, as you can see in this image. Okay, so circumduction movement can happen at the shoulder joint, hip joints, okay, wrist joints, okay, ankle joint, okay. And so this circumduction movement, clinical relevance, all of you might relate it. The circumduction movement of the shoulder joint is helpful for bowling in cricket. Okay, so that is circumduction movement. Without it you can't do bowling in the cricket. Okay, so again, very important, these movements are extremely important. Okay, then you have certain other movements. What are the other movements possible? There are gliding movements, okay, which is movement of relatively flat surfaces against each other in multiple directions. Okay, for suppose if there is a intercarpal joints which are moving, so there can be gliding movements. Okay, slightly present. We will study in the joints what all movements are possible at what all joints. Okay, so angular movements can change the angle of the joints. Okay, then there is an opposition movement of the thumb. Okay, so you just know this is the opposition movement of the thumb. Opposition of thumb. Okay, we will study the different movements of thumb specifically in the upper limb region. Okay, then the lateral flexion, okay, as shown in this image. Lateral flexion, as you can see, this is the movement of the trunk sideways to the right side or left side. Okay, this is a lateral flexion. Elevation is movement that lifts the body parts upwards. Okay, so there can be a movement that is elevation. Okay, then there is, so the elevation of the mandible, suppose if I can show you here, that is elevation to close the mouth. So depression again. So these kind of movements you will understand better when we will discuss region wise. Okay, this elevation, depression, okay, all these movements. Depression, okay, that is to lower down the body part, depressing of the mandible to open the mouth. Okay, then protraction, we will study in case of elevation, depression, all these movements we will study in eyeball movements, we will study in scapula, we will study here. Okay, that is the mandible, you will study in the head and neck region. So protraction of the jaw, okay, and protraction of the shoulder, arm. So these are protraction movements. Then you have retraction, movements, okay, which are backward thrusting movements of the body part, retraction of the jaw, okay, or mandible. So any kind of such movements will be important, okay, which you can understand for the different kind of movements possible. See this image. This is for the foot, which you can imagine for the hand and the feet, adduction and abduction. Okay, so understand that there is actually some axis during adduction and abduction. Okay, so in case of adduction and abduction of fingers, so there is you can say the midline which is passing through the middle finger. Okay, so this is the axis of the movement, okay, in case of fingers, and in case of the feet we have the second digit. So in case of feet, we have the second digit as the axis. Okay, and in case of hands, we have the third digit, that is the middle finger, as the axis of the movement. So in upper limb, lower limb, we will study like the palmar interosseous, dorsal interosseous, so pad and dab movements we will study in the upper limb. Okay, so all those things we will discuss in mnemonics also. So you can understand these kind of basic movements, right? Have a look at another image for the supination, pronation. So these are useful for picking up the food from the plate and putting in the mouth. So supination, pronation. Then similarly there are words like eversion and inversion movements. Okay, so those are helping us to walk on an uneven surface. Okay, movements of the thumb, they are occurring in a perpendicular plane other than the fingers. Okay, so that also we will study in upper limb separately. Okay, what all movements are possible. So supination and pronation, as you can see in this image also, it's a rotation movement to make the front of the forearm and the palm to face anteriorly and superiorly in the mid flexed elbow, okay, position. And pronation, that is to make the palm face posteriorly. Okay, so this is pronation, supination, pronation, supination, pronation. Okay, simple terms of movements which you should know. Inversion, in which a movement of the sole of the foot, in this image also you can see, in which the sole faces medially or inwards. Okay, so that is the inversion. And eversion is towards the sole of the foot is facing laterally or outwards. Okay, so that is eversion movement. Okay, so this is towards the medial side, this is towards the lateral side. Okay, so inversion and eversion. Okay, so that is two different movements. So these movements are told asked to you in the exams how to perform, so do remember them. Protraction, okay, retraction movement, protraction movement and retraction movement, protraction, retraction. So you will study these all movements specifically region wise when we will discuss. Even the muscles we will talk about how to these movements are produced. Okay, then we have then we have certain terms used for certain other things. Okay, anatomical terms which are important. Apart from the movements, we have terms for certain vessels. Okay, like the arteries. Okay, arteries which are carrying the blood away from the heart, veins which are carrying blood towards the heart. Okay, arteries, veins. Okay, then we have capillaries which are small. We have capillaries which are small microscopic vessels that are forming a network. Okay, then we have a word known as anastomosis. Okay, anastomosis, which is basically a communication between the adjacent vessels. Okay, communication between the adjacent vessels. And then sinusoids, okay, which are basically, we will hear these words separately region wise also in history also. Sinusoids are thin walled vessels with large gaps in the wall. Okay, then you will hear a word venae comitentes. What is this? That is veins which are accompanying an artery. Okay, then for the nerves you will hear, so there is a nerve word, that is the term nerve. Okay, that is a cord like structure that consists of bundles of nerve fibers. Okay, then you will hear a word plexus. Plexus is a network of these nerves only. Then you will hear ganglion. Okay, ganglion is a group of neuronal cell bodies outside the central nervous system. Okay, you're not talking about the ganglion cystic swellings, not those things. I'm talking about a ganglion in the human body inside the normal term. Okay, so don't confuse with the clinical entities. Then we have certain different terms for the bones. Okay, anatomical terms for bones. Okay, what are those? One is the line. Linear elevations or less prominent ridges like the superior nuchal lines, temporal lines. Okay, then there is a term known as crest, a sharp ridge or a border. Okay, like an iliac crest. okay, for example. Then there is a ridge, okay, which is again a linear raised border, okay. Crest is a sharp ridge or a border, and ridge is a linear raised border, okay. So ridge like supracondylar ridges of the humerus, if you have heard of, right. Then tubercles. Tubercles are slight rounded elevations like the greater or the lesser tubercles of the humerus, okay. Then the tuberosity, okay. Prominent rounded elevations or projections like the ischial tuberosity in the hip bone. Trochanters, okay. Very large projections of the bones like the greater trochanter of femur, okay. Then spines or spinous processes, long thin projections like spines of vertebrae. Then styloid process, a sharp pointed bony projection, okay. Then head of humerus, head of radius, that is rounded articular end of the bone, okay. Then condyles, like rounded knuckle like projections, condyles of femur, condyles of humerus, okay. Then epicondyles, okay. Then we have epicondyles, okay. Rough prominence above the condyles like epicondyles of humerus. Then we have facets, okay. Small flat area for articulation, okay, like facets on vertebra or ribs, okay. Then you will understand these differences when you will see region wise these structures on different bones. You will understand the different places where you will see these names, these nomenclatures, okay. Then facets, small flat area for articulation like facets on the vertebra for the ribs, so costal facets, okay. Then there are certain grooves, or you can say sulcus. So those are linear depressed area like the radial groove of the humerus, bicipital sulcus, okay, bicipital groove again in the humerus, okay. Then fossas, large hollow depressed area like radial fossa of the humerus, okay. Then there is foramen. I am giving only one or two examples, but there are a lot of other examples, okay, in the entire human body. Foramens are holes in the bone for passage of certain nerves and vessels. And welcome to MBBS. You have to remember all the names of foramens and the nerves and vessels what are they passing through, okay. Suppose for example foramen ovale of the skull, okay, mandibular nerve, okay, that passes through the foramen ovale, okay. So that is example. Then canals or meatuses, okay, canals or meatus. So tubular passage in the bone like carotid canal of the skull, okay. So then there are inferior meatus in the nose, which you will hear, okay. So we will talk about that eventually region wise. Fissures, gaps between the adjacent bones like the superior orbital fissure, okay, in the head and neck we will read about. Sinus, air filled cavity in the skull bone, okay, like maxillary sinus, it can get infected also, okay. So these are certain important terminologies we will use with respect to the bones. Okay. Similarly, anatomical terms with respect to the clinical anatomy. So I will talk about clinical anatomy for every topic, and you will hear some common words. Okay, what are those? Number one, the suffixes. Okay, suffixes, there will be some suffix which will be used like itis. Okay, itis means inflammation. Okay, for example, tonsillitis, inflammation of the tonsils. Appendicitis, inflammation of the appendix. Okay, there may be some infection. Arthritis of the joints. Okay, so itis. Then there is a word which can be linked ectomy. Okay, that means removal from the body. I will use a word appendicectomy, means removal of the appendix. Tonsillectomy, removal of the tonsil. Then some word with the otomy at its end, means anatomy, if you remember. So means to open and close a hollow organ or any region. Like for example, a word laparotomy, that means opening and closing the abdominal cavity. So there is a laparotomy procedure. Okay, this is a surgery which is done. Then hysterectomy, that is removal of the uterus. Okay, then hysterotomy, that would mean opening and closing of the uterus. Just imagine for the cesarean section to take out the fetus. Okay, so hysterotomy. Okay, then cystostomy for opening the urinary bladder. Okay. Then there is a word which will have ostomy at its end. Okay, ostomy, which would mean to open the hollow organ and to leave it open. Okay, suppose if I am using a word cystostomy, that is to create an opening in the urinary bladder, and suppose if the urine is not passing, there is a urinary retention, chronic urinary retention, you can insert the Foley's catheter inside the urethra to take out the urine. If it is not inserting, if the Foley's catheter is not passing through the urethra, then you can make a cut open inside the urinary bladder to drain the urinary bladder. Okay, and to leave it connected to the exterior, to leave it open. Colostomy, to create an opening in the colon. Okay. Tracheostomy, very important procedure, life-saving procedure. You cut open the trachea to allow the person to breathe. Okay, so you can do an endotracheal intubation, in which you put a tube inside the trachea to to give the airway. You have seen the movies also, Ambu bag, which is inflating and deflating. So that is one procedure. If the oral cavity is not if it is disrupted, like suppose if in a road traffic accident there is the oral cavity is disturbed or distorted, so based on the Malampatti scoring, which you will hear in the anesthesia prof, so if the mouth opening is not proper, then you can cut open the trachea in the anterior end and you can just create an opening to allow the person to breathe. You have heard of the word airway, breathing, circulation, ABC, that is for the life support. Okay, so that is a part of your basic life support course also, right? Then there is a word that is linked last mein oma, that means a tumor, like a lipoma, tumor of the adipose tissue, osteoma, tumor of the bone, hemangioma, tumor of the blood vessels. Okay, so this kind of examples for the suffixes which you can remember. Okay, then again in clinical entities, clinical anatomy, you will hear some words. Okay, one is the symptoms. Symptoms is something which the patient is presenting with. Okay, complaints of the patient, you have to take care very clearly. If you don't hear them properly, he will kill you or he will beat you. Okay, that डॉक्टर साहब तो बहुत बड़े डॉक्टर साहब है, वो तो मेरी बात ही नहीं सुनते हैं, उन्होंने तो सुना ही नहीं, उन्होंने बस एक लाइन सुनी और फिर दवाई लिख के भेज दिया, जाओ अम्मा घर जाओ. ऐसा नहीं, you have to listen everything in detail. Okay, so that is symptom. Then sign, that is something which you are eliciting in the patient. So that is an objective or physical finding of a physician on observing or examining the patient. Okay, then diagnosis, that is identification or determination of the cause of the disease, nature of the disease, okay, or any clinical condition. Then prognosis, that is forecasting a probable course or outcome of the disease. Patient will ask you, इसको कैंसर है, नाउ टेल मी कि ये जिंदा रहेगा कि बचेगा, बस जिंदा रहेगा कि मरेगा. ठीक है, तो कितने % चांसेस है कि ये बचा रहेगा. सो दीज आर ऑल प्रोग्नोसिस जो पेशेंट वांट्स टू नो फीवर आ गया, अब डॉक्टर साहब ये बताओ फीवर जाएगा कितने दिनों में. सो दिस इज प्रोग्नोसिस. यू हैव टू बी एस्ट्रोलॉजर, you have to forecast based on the probable course or outcome of the disease, medically correct. Okay, not you're not looking at the stars and telling the prognosis. Okay, based on the condition of the patient. Then therapy is mode of treatment. Okay, then pyrexia is fever. Okay, then you can hear the word paralysis, loss of voluntary movements of the body parts. Okay, then hemiplegia, that is paralysis of half of the body. Paraplegia, that is paralysis of both the lower limbs. Okay, monoplegia, that is paralysis of any one limb, mono. Okay, then continuing the list further, quadriplegia, that is paralysis of all the four limbs. Okay, then anesthesia, that is loss of sensation. Okay, analgesia, that is loss of pain sensation. Then coma, or you can say coma, that is loss of consciousness. ये तो पिक्चरों में सीरियल में बहुत बार देखा होगा. From loss of consciousness from which person cannot be aroused. Okay, then lesions, skin lesions or brain lesions, abnormal or damaged area of the body. Okay, inflammations. The list is actually endless, but whatever I can recall and remember, importantly I am writing it down. Inflammation is local reaction of the body part to injury. It includes swelling, pain, redness, raised temperature, loss of function, all these things. Inflammation is a separate chapter in pathology which you will read about in detail from Robbins. Okay, so this is a separate chapter. Then edema means swelling due to accumulation of excess extracellular fluid. Okay, then ulcer, that is discontinuity in the skin or the mucous membrane. Ischemia, you will hear all these words in clinical entities in the entire textbook of anatomy. Ischemia is reduced blood supply to the body part. Okay, then necrosis, death of the tissue due to irreversible damage to it. Okay, so if there is a tissue necrosis, so maybe amputation may be required. Suppose in a diabetic foot, that foot is damaged, so there can be necrosis. Okay, then there is a word, we move further in the next page, again continuing for the clinical anatomy only. We were on necrosis. Okay, then we have infarction. Necrosis was death of tissue due to irreversible damage to it. Then infarction, death of tissue due to loss of blood supply. Okay, that is infarction. Okay, one more topic after this I have to take. Okay, so you can I think in 5 minutes I can wind up this topic, and then after this topic we have the skin and its appendages, which would take another 1 hour. Okay, so you can either manage your time accordingly. I'm soon going to finish this in another 2-3 minutes. Okay, so yeah, you have to bear with me with these classes, because definitely these terms are very important for you to understand. Infarction, death of the tissue due to the loss of blood supply. Then gangrene. Okay, necrosis with putrefaction by the bacteria. Okay, again very important. Atrophy. Atrophy is decreased size of the cells. Then hypertrophy, that is increased size of the cells. Then hyperplasia, that is increased number and size of the cells. Then syndrome, a disease with group of signs and symptoms together. So there may be any syndrome which we will talk about eventually. Then tumor. Tumor is a circumscribed or non-inflammatory abnormal growth. Okay, this tumor, you will hear cancer, tumor, okay, which you should know a word, but this tumor is specifically a circumscribed non-inflammatory abnormal growth. Okay, very important. Then there can be two varieties. One will be benign, this growth, that is mild form of the illness or non-spreading tumor. Then malignant, that is severe form of the disease, or you can say spreading tumor. Okay. Then cancer, is a malignant tumor. Okay. Then moving further in this list, metastasis. Metastasis is a spread of disease or cancer from one part to another. Suppose if there is a first site of the cancer is suppose let's say in the abdomen, the cancer can be present in the vertebral column. Okay, so that means the cancer has spread in so to another site, that is the metastasis. Then we have thrombosis. Thrombosis means intravascular coagulation of the blood. Okay, simple. Then embolism, that is occlusion of a blood vessel by a circulating thrombus. Okay, this is very dangerous. Suppose example, pulmonary embolism, lungs, if it is a blood vessel is occluded, so it can lead to instant death also. Okay. Then hemorrhage. Hemorrhage is abnormal or excessive bleeding. It can be internal bleeding or external bleeding, so it is hemorrhage. Then sinus, that is a blind tract which is open at one end. Okay. So these are certain points to remember. Okay, which you can recollect later on, and there are a lot of other words also, but these are certain ones which are important for exams. So that's it about the introduction part. Okay, thank you so much for patiently listening to me regarding the introduction to anatomy and the anatomical terminology. Next we move on to the other topic. We have the next topic in line, that is skin and its appendages. Okay, so skin and its appendages actually again will have certain important competencies as per the NMC. So different types of skin, dermatomes, obviously we will be covering these competencies in certain topics. Like appendages of the skin we will talk about today, structure and function we will talk about today. Superficial fascia with fat distribution will take up in the next class. Modifications of deep fascia, again fascia will take separately along with the skin lesions, incisions, sorry, we will take up separately at the respective topics. Okay, so you can understand this is important from NMC point of view also. So to introduce you to this topic, one second, yeah. So to introduce you to this topic, you should understand few things. Integumentary system of the integumentary system of the body, if you remember the regional anatomy, this consists of the skin and its appendages. Integumentary system. Okay, so this consists of skin and its appendages. Okay, okay, so what all these are, one is the skin, itself, that is consisting of two layers, the epidermis and dermis, which we will talk about in a while. Okay, then we have the hair follicles, or you can say the hairs. Okay. Then we have the sweat glands, then we have the sebaceous glands, and we have the nails and mammary glands. Mammary glands we will take up separately, the breast in the upper limb only. Okay, but right now we are concerned more of the skin and its appendages. Okay, then there is another entity also which is present, that is the hypodermis. Okay, this consists of adipose tissue only. Okay, that lies deep to the dermis. Okay, so that is hypodermis, subcutaneous fascia basically. Okay, so I think I can write it there only, it will make much more clarity. Wait, let me write it again, just 1 second. The epidermis, okay, dermis, these are the two main layers of the skin, and below it there is hypodermis. Not too much to talk about the hypodermis, only the epidermis and dermis will be the mainstay of the discussion. Okay, so talking about the skin now. Okay, so skin forms the outer covering of the body, right? All of you know that, supported by appendages or derivatives of the skin such as hairs, nails, sebaceous glands, sweat glands. It is the largest organ of the body. Okay, it constitutes about 16% of the total body weight. Okay, then functions of the skin, see, most of the things I am not writing, I am just telling you because those are just factual things which you can remember or may not remember, but some things which are the key points I am writing it down so that you can remember for your examination point of view. Okay, simple. Functions. I hope everyone is there. Please in the chat give me thumbs up or yes or something. Chat is dead, I don't like that. So chats and comments are very important to keep the classes live and running. I know this is going to be a burden for you because of the time frame and the duration of the classes, but this is as per the request of most of the students, because general anatomy is something which they are lacking in and they are not able to recollect so many things, understand so many things. So I have taken up this at priority. So I told you in the beginning also. So it is tough for me also to bear and this change of the timings. You have been with me in the previous extremity upper limb we have discussed. Everything was very systematic, but now I am also going to rush because of the limited time frame which I have been given and also the duration of the classes. So please bear with me because it is ultimately benefiting you only because of the current demand of the time. Okay, so I hope it is okay. Give me thumbs up. If I have so many thumbs up, it will keep me motivated. I will not lose, my motto, because it's a lot of things to cover. I can cut down wherever I want, but that won't be useful to you. So functions, number 1, the protection. Okay, it acts as a physical barrier that protects the body from pathogens like bacteria, okay, and viruses, chemicals, physical injuries. Okay, then we have regulation of the body temperature. So these are very important for Viva questions. Okay, so you should remember them. sensations. So this skin is helping to regulate the body temperature through sweating and regulating the blood flow to the surface. Sensations, like it contains as receptors, we will talk in a while, like we detect the stimulus such as touch, pressure, temperature, pain, etc. Okay. Then the function of excretion. Okay. Sweat glands, they help eliminate the waste products. Okay. Then we have the immune defense. Okay, immune defense, that actually skin hosts few immune cells also. Okay. Then we have synthesis of vitamin D, which if you check in most of the population nowadays it will be low. Okay. Skin produces vitamin D when exposed to sunlight. Number 7, absorption. Okay, so these are all your functions of the skin which are covered in the NMC competency. I showed you in the initial slide also. Okay, it absorbs certain substances including medications and chemicals under specific conditions. Okay, so you can imagine skin is so especially the epithelium, it is so much selective. When there are certain microorganisms, it doesn't admit it inside, but if there is some ointment which you apply on the skin, it takes inside to cure the surface of the skin. So it is magical, right? So then we understand the functions. Then there are two types of skin depending upon the thickness of the epidermis. Number 1 is the thick skin, that is moti chamdi. Thick layer of the epidermis, that is its epidermis shows thick stratum corneum. Okay, so that is thick skin. Thick skin does not have hairs. Okay, locations, example, the skin of the palm and the sole. Okay, skin of the palm and the sole of the feet. Okay, very important, that is thick skin. Okay, there is no hair on the palm, right? So you can remember easily, there is thick skin. Then thin, or you can say hairy skin. I can write it here only so that you can remember for your entire life. This is hairy skin, thin skin or hairy skin. So in thin skin, epidermis is thin. Thin skin shows hairs. Example, the skin covering the entire surface of the body except the palm and the sole. Okay, that is understandable. And there are certain other things which you can understand in this image, but very importantly, please remember this, which is often asked in the MCQs regarding the stratum lucidum. So there are certain layers of the epidermis which I will talk to you in a while. Out of that, stratum lucidum is the one which is present in thick skin and absent in thin skin. So please remember this lucidum. Okay. Lucidum makes the entire difference. Okay, so stratum lucidum. And then epidermal ridges which are absent in thin skin. Okay, then hair follicles which are absent in thick skin. Erector pili muscle, again along with this hair follicles, जैसे रोंगटे खड़े हो जाते हैं, तो there is some thing in the skin which is actually keeping this hair follicles straighten up. So that is erector pili muscle. I'll talk to you in a while. Okay, so these are absent, hair is absent and erector pili is absent. Simple. Sebaceous glands, they are absent. Okay, in this palm you will see there is sebaceous glands are absent. Sweat glands are many, very important. If you see when you are working, when you are seeing that there is a sweat accumulation in the palmar surface. Sensory receptors are more in the thick skin. So obviously you are doing so many work with your palm and the sole, you are walking every day, so that is why. So this is again important. Location you already know, so very basic thing which you can remember. Then the structure of the skin. So skin consists of two layers. The one is, that is epidermis, and then we have the dermis. Okay, so epidermis is a superficial layer that consists of the keratinized stratified squamous epithelium. That will be covered in histology. What is this stratified squamous epithelium, keratinized variety? We will talk about it separately. Okay. Dermis is a deeper layer that is made up of connective tissue. Simple. Okay. Very basic thing. So epidermis, it has certain layers which are important for your examinations, which you should know. So it consists of 5 layers. Okay. So what are those 5 layers? Number 1, that is in sequence, that is stratum corneum, then stratum lucidum, okay, then stratum granulosum, then stratum spinosum, and lastly stratum basale. Okay, you can remember through a mnemonic CLGSB. Okay, this is a mnemonic which I always remember, so you can remember CLGSB. Don't make too many mnemonics in the entire human body because too many mnemonics will confuse you in the exams. So keep minimum mnemonics, the ones which we are giving or ones which are mentioned in the textbooks. That is more than sufficient. Don't make yourself any mnemonics. There are plenty of mnemonics you will hear. Okay. So these are the 5 layers of epidermis. And as you already know, we have already discussed, this stratum lucidum is the one which is present only in thick skin. Only in thick skin. And rest everything is same. So stratum lucidum is present only in thick skin, and if it is present between the stratum granulosum and stratum corneum. Okay, so you know where to look for. I have attached a separate image, although I am not going to talk too much in detail about the different aspects of this image, because obviously this will be covered in your histology separately. Okay, so then number 1, a few important points about these layers. The stratum basale, it is also known as stratum germinativum. Okay, germinativum. Okay, it is the deepest layer of the epidermis. It consists of single layer of cuboidal cells, okay, low columnar cells you can say, that are resting on the basal lamina. Okay, it contains melanocytes and mechanoreceptors. Melanocytes and mechanoreceptors. Okay, and the cells, they show melanin pigments, and these cells, they divide mitotically to give rise to keratinocytes. Okay, keratinocytes. The cells of the skin, basically keratinocytes. Cytes is cells. Okay, so this is cells of the skin that form the superficial layers of the skin. So hence this stratum basale is known as stratum germinativum. Okay, so it is allowing the formation of the different layers of the skin. Then we have number 2, that is the stratum spinosum. Okay, few important points about these, because those are only important for examination point of view. You can read about them in histology textbooks in detail, there is not a problem. So above the stratum basale, there are several layers of thick stratum spinosum is present. Okay, and this is also known as Malpighian layer. Malpighian layer, okay, or prickle cell layer. Prickle cell layer. Okay. Keratinocytes of the stratum spinosum, those are polygonal cells, okay, and that are connected with adjacent cells by some desmosomes, okay. So there are some desmosomes which are present, which are nothing but junctional complexes, okay. Again, so these desmosomes and all these structures you will study in the histology part, okay, the junctional complexes, that is separate chapter, okay, junctional complexes. Okay, which are actually joining the two cells, cell to cell talk, okay. And these spines are basically artifacts, okay. So during preparation of the tissues for sectioning, the cells often they shrink, and but these keratinocytes, which are these prickle cells, okay, which you can see in this image also, prickle cells, okay. So these remain adherent with each other at the site of the desmosomes, okay. So similarly, it is like a fevicol which is between the two cells, okay. So it creates spines over the surface of the cells at the site of the desmosomes. Thus the keratinocytes in this layer, this shows small spine like projections on the external surface. That is why it is known as stratum spinosum, okay. Then you have the next layer, that is the stratum granulosum. Stratum granulosum. Okay. Now granulosum, stratum granulosum is something which is having 1 to 3 cells thick layer of keratinocytes, okay. So 1 to 3 cell layers of keratinocytes, okay. And cells of the stratum granulosum, they contain granules of keratohyaline protein, okay. So hence this keratohyaline protein, and hence the name is given, that is a stratum granulosum, okay. And keratohyaline is actually a precursor of filaggrin protein, okay, that on aggregation forms keratin filaments, okay. So it's this keratohyaline, you can write this is nothing but a precursor of filaggrin protein. Again, if you are bothered about too much detail, what is it, how it is, all these things you will study in more detail when we will discuss histology, okay. So this is just the overview, you can say, okay. We are not going into too much details how these structures are oriented. And then number 4, we have the stratum lucidum. Stratum lucidum, okay. Stratum lucidum is basically, we are using the word lucid. Lucid means clear, okay. So it is present only in the thick skin, we already know this, present only in thick skin, and I am writing this again and again because this is a viva question and theory question. The cells of the stratum lucidum, they are stained lightly with eosin, and then hence they appear homogeneous, okay. Their cell boundaries, they are very indistinct, and the nucleus and the cell organelles, they become disrupted and they disappear towards the superficial layer, okay. The cells of this stratum lucidum, they contain alidin, okay, alidin. These are all your one-liner MCQs, okay. So what is alidin? This is a clear intracellular protein, okay. It is a clear intracellular protein, okay, which is, one thing more, here it was filaggrin protein, Okay, keratohyalin protein. Here it is illidin protein. Okay, so this illidin is a clear intracellular protein derived from the keratohyalin only. Okay, and later this illidin gets converted to keratin. Okay, in stratum corneum. Okay, so this is converted to keratin in stratum corneum. Okay, then we have the last fifth layer, that is the stratum corneum. Okay, now this stratum corneum is the most superficial layer of the epidermis, and cells of the stratum corneum, those are non-nucleated, flat and scale like. Okay, squamous cells which are dead cells basically, and they do not have any cell organelles. Okay, cells of the stratum corneum, those are filled with keratin filaments, and these cells, okay, so you can write the stratum corneum is basically having non-nucleated, I am writing the key points only, non-nucleated flat scale like squamous cells, scale like squamous cells, or you can say dead cells. Okay, and they do not have cell organelles. Without cell organelles. Okay, and cells of this stratum corneum that are filled with keratin filaments, and these cells are held together by extracellular lipid and carbohydrates that form a glue like substance. Okay, extracellular lipid actually makes the skin impermeable to water. Okay, then the thickness of stratum corneum, it actually depends on the amount of friction to which the skin is exposed. Okay, very important. Stratum corneum is very thick in the palm and the soles. Okay, and superficial cells of the stratum corneum, those are being constantly shed off and are replaced by proliferation of the stratum germinativum, which I just discussed previously. Okay, so very important, this stratum corneum is very thick in sole and palm. Okay, right, I hope now you know. And if you remember, thickest skin of the body is actually in the upper part of the back. Okay, here the skin covers thin skin covers extremely thick dermis. Okay, so that is the thickest part, upper back origin. Okay, then if you just remember for a interesting fact, like mammary gland, those are modified sweat glands in females. Okay, so what I told you in the beginning, mammary glands, those are nothing but modified sweat glands in females. Okay, coming on to the clinical integration for the skin, whatever we have discussed till now. I told you anything we discuss will include clinical integration. Okay, number 1, the basal cell carcinoma. Okay, you will hear this word multiple times in the dermatology classes also. You know, dermatology, skin is a separate branch. Dermatology is one of the finest topmost paid branches. So that is skin, derma. Okay, so the basal cell carcinoma, this is the most common skin cancer. It arises from the trichoblast, or you can say folliculo-sebaceous apocrine germinal layer. So it begins as a painless skin elevation. It rarely metastasizes, like spreads to different locations. I told you what is metastasis. And basal cell carcinoma occurs in hairy skin, mostly on the face. Okay, so that is the basal cell carcinoma. Second, we have heard of the term that is the squamous cell carcinoma, okay, or you can say epidermoid carcinoma. Epidermoid carcinoma. Okay, what is this? It arises from squamous cells of the skin and parts of respiratory tract and gut. Squamous cell carcinoma of the skin usually arises in the sun exposed parts, like the UV light exposed parts in older people, and mostly on the face, ears and back of the hands and the scalp region and the lips. Okay, so these are certain most UV light, that is why we say na, don't be exposed to sunlight, UV light, extreme bright light. So this is something which is possible, that is squamous cell carcinoma, epidermoid carcinoma. Okay, then we move further to the dermis. So we have covered epidermis. Let's talk a bit about dermis. Okay, so dermis is a deep vascular layer of the skin. Deep vascular layer of the skin. Okay, it is made up of connective tissue, contain the collagen bundles, blood vessels, lymphatics and nerve fibers. It also contains erector pili muscle and the hair follicles, which we'll talk about eventually. Dermis has two layers. One is, it has two layers. Number one, that is the superficial. I hope now you know the words superficial and deep. Okay, I can use them. Superficial papillary layer. And number two, we have the deep reticular layer. Remember any one? You will always remember the other one in the MCQs. Are you all there in the chat? Please message. I know it's a lot of time for the class. Are you there? Please mention yes or something. If no, if you're not there, please say no, you're not there. Okay, so if you're there, please say yes. Type something in the chat so that I know people have not left, they are not slept. Okay, you can eat your food also along with it and you can attend the class. I will try to manage the time accordingly next time, so it's much more convenient to both of us, even for me, even for you guys. Okay, so first one, that is a superficial papillary layer. Okay, so it actually lies deep to the basal lamina of the epidermis. I hope you can imagine the basal lamina of the epidermis. So it just immediately deep to epidermis, the last layer of epidermis is the papillary layer of dermis. So obviously that is superficial layer of the dermis. Okay, it consists of the, okay, I can write it separately also. Let me move it. Number one, that is the papillary layer. Let us note down few important points about each. Papillary layer, and here we can write, here we can write the other one, that is the reticular layer. Okay, just to save the space and have everything on one slide, I am keeping it. It's not like some difference or something we are making. Okay, so papillary layer of the dermis, this is actually lying just deep. This is lying just deep to the basal lamina. Deep to the basal lamina, okay, of the epidermis. Okay, it consists of loose connective tissue. It shows finger-like projections into the under surface of epidermis. Okay, these projections are known as dermal papillae. Okay, dermal papillae. Epidermis also protrudes into the dermis in the form of certain epidermal ridges. Epidermal ridges, or you can say the rete ridges, or you can remember retepegs. Okay, so dermal papillae and epidermal ridges, they are longer in the skin where the mechanical stress is more. For example, the skin of the palm and the dorsum of the hand. Okay, so there this is more longer. Then in case of reticular layer, it is lying deep to the, it lies deep to the papillary layer. Okay, and it is nothing but dense irregular connective tissue. Okay, it is thicker and less cellular than papillary layer. Okay, so it is thicker and less cellular. Okay, it consists of thick irregular bundles of type 1 collagen fibers and elastic fibers. Okay, so that is the reticular layer. Okay. Then you have something known as paniculus carnosus. Paniculus carnosus. Okay, so it is a part of subcutaneous connective tissue. It consists of a layer of striated muscle just deep to the subcutaneous fascia, or you can say hypodermis. Okay, so you can write layer of striated muscles, okay, just deep to the subcutaneous fascia, or you can say hypodermis, which we just mentioned in the beginning. Okay, and it is well developed in lower animals. Okay, like you might have seen some cow or buffalo, the backs of them, they have some flies or mosquitoes. They just twitch those muscles and they can make them fly away. So those are the muscles which are the paniculus carnosus in lower animals. Okay, and whereas in humans which are the actually higher animals, okay, in humans we have the examples of paniculus carnosus, which include the muscles of facial expression. Okay, we will study in the head and neck. Muscles of facial expression, okay, including the platysma. These are all muscles which we will study separately, region wise. Then we have palmaris brevis, a short small slip of muscle in this region, okay, in the hand. We will study in the upper limb. And dartos muscle in scrotum. Dartos muscle in scrotum. We will study in the pelvic region, the abdomen and pelvis. Okay. So this is paniculus carnosus, which you should know. Okay. So by now you know most of the things about the skin. Okay, the layers and important things. Now just to complete, we should know some important aspect, that is the cells. Okay, so talking about the cells of the epidermis. Okay, let me just write it here. Cells of epidermis. Okay, now skin has 4 types of cells. Okay, one is the keratinocytes. Okay, one is the keratinocytes, which we just talked about. Okay, then we have melanocytes. We will not go into too much detail. I will just tell you the brief things about them, overview, because that is much, because all these things will be again repeated in the region wise. Okay, then we have the Langerhans cells. Langerhans cells, and we have the Merkel cells. Merkel cells. Okay. So these are the four basic important types of cells. So keratinocytes. Keratinocytes, they consist of approximately 85% of the cells of the skin. Those are the predominant cell types. Okay. And the major functions of these cells, they include production of the keratin and formation of the epidermal water barrier. Okay. So keratinocytes, those synthesize the keratohyalin granules, which I just told you previously. Okay, and later these keratohyalin granules, they release the keratin filaments into the cytoplasm, and these filaments get aggregated with the help of the same filaggrin protein which we just discussed, and also trichohyalin protein, and this entire process is known as keratinization. Okay. So don't need to go into too much detail, just telling you overview about the keratinocytes. Okay, so those comprise of 85% of the cells. Okay, then we have certain cells, those are the melanocytes. They are present in the so then we have the melanocytes. They are present in the stratum germinativum, or you can say stratum basale. Basically, they have dendritic like dendritic like processes, which you can see in this image also. Okay, dendritic like processes. These are the melanocytes. Okay, they synthesize the melanin and transfer it to the other cells. Okay, so that is about the melanocytes. Then we have the cells, Merkel cells. Okay, the Merkel cells, they are sensory cells responsible for the cutaneous sensations. Okay, they are located in the stratum basale. Okay, and these Merkel cells are mechanoreceptors. Okay, so they are useful for the blind people basically. Okay, so sensory nerve endings, they are present in relation to the Merkel cells. These are more abundant in the fingertips, oral mucosa, and hair follicles. Okay, so that is something which you should remember. And then there are Langerhans cells, which you can see in this image, which are derived from the bone marrow. They lie in the stratum spinosum. Okay, so these are different cells of the skin which you should know about. Okay, then talking about the different things, like also one more thing before I begin further, talking about the clinical integration here only. Clinical. So there is something known as psoriasis. Okay, which you should know about. This is a skin problem. Okay, a skin disorder which shows a patch of skin covered by silvery white scales. Okay, patch of skin consisting of silvery white scales. You will hear about this disease later also. Okay, and it occurs because of the rapid turnover of the keratinocytes. Okay, that is around 8 to 10 days. Okay, so next we come on to the color of the skin. Okay, now very short entities are left. We can wind up this topic in another let's say 5 to 10 minutes maximum. Okay, so bear with me. Color of the skin. So the color of the skin, it actually depends upon the presence of pigments. Okay, the pigments like the amount of melanin okay, depends upon the amount of melanin, okay, in the epidermal cells. Okay, and just one second amount of melanin in the epidermal cells, okay, and then it is the color of the skin is based on the carotene pigment carotene pigment, okay, that is the yellow color of the skin. Okay, and also very important, vascularity of the skin, okay, so that is the hemoglobin level. Okay, so it depends upon these three pigments basically. Okay, 1, 2 and 3. Okay, so melanin, it is a brown pigment okay, I will tell you why I am discussing this all, because there are a lot of clinical entities which are important and linked to this information. Okay, that is why I have put up this in front of you. So the melanin, which we have written here, melanin, this is actually a brown pigment. Melanin is present in melanocytes, keratinocytes of the skin, and pigmented epithelium of the retina, and some neurons of the brain also. And the role of melanin is, melanosomes, they acquire the supranuclear position in the keratinocytes and they protect the nuclei from ultraviolet ray induced damage. So the more the melanocytes, the better it is. Okay, and carotene pigment carotene pigment, this is actually the yellow orange pigment. Okay, it is taken from the food and present in the stratum corneum and the fat cells of dermis and superficial fascia. Okay, so why all this information is important? Because there is a lot of clinical entities, okay, clinical applied anatomy related to this. Okay, number 1, you might have already heard of this disorder, that is the albinism. You will study all these in the skin final prof. It is an inborn error of metabolism that makes the melanocytes incapable of melanin synthesis. Okay, and very important, it occurs because of absence of tyrosinase enzyme, and this is an MCQ which has been asked in the exams. Okay, then there is a clinical entity known as vitiligo. Okay, it occurs on destruction of the melanocytes, mostly because of autoimmune reactions only, and it produces patchy depigmentation of the skin. Okay, so that is patchy depigmentation of the skin. Okay, and then we can have some moles, which are the identification marks also. Okay, those are dark, slightly elevated, flat lesions of the skin. They are present almost in all individuals, either at birth or they appear later in life because of hormonal influence. Okay, then there is something known as malignant melanoma. Okay, malignant melanoma. This is an invasive tumor arising from melanocytes. It may spread locally or throughout the body through blood or lymphatics. It may occur because of excessive exposure of to the sunlight. Okay, Then we move on to the next entity, that is the skin surface patterns. Okay, so there are three types of surface patterns you can say on the skin. Okay, or you can say surface irregularities of the skin. Number one, that is the tension lines. Okay, so we are talking about the patterns. Patterns of skin. Okay, so number one, that is the tension lines. Okay, so tension lines, and then we have number two, that is the flexure lines. And number three, we have the papillary or friction ridges. Okay, so flexure lines or flexure creases, as you can see in this image also, these are acquired permanent lines and creases in the skin. The flexure creases are well marked in palm as well as soles. They are produced by habitual movements. Okay, so you can see the hand of a laborer who is used to do more work, and he will have more darker lines. Okay, then you have some Langer's lines or cleavage lines. Langer's lines, or you can say cleavage lines. Okay, Langer's lines or cleavage lines. So these are tension lines of the skin. Okay, these are tension lines only. Okay, these lines correspond to the natural orientation of the collagen and the elastic fibers in the reticular layer of the skin. Okay, so these are the Langer's lines or cleavage lines. So Langer, because the scientist name was Carl Langer, who actually invented this. So Carl Langer, so Langer's lines. Okay, then you have the skin along the flexor lines is thin and firmly bound to the deep fascia. So lines are prominent on the flexor aspects of the joints also. Okay, so they are present. So there are another lines which are the papillary ridges basically, or you can say friction ridges. Okay, which are present on the fingers, palms and soles. Okay, and they form narrow ridges separated by parallel grooves and correspond to dermal ridges. Okay, the pattern of this is unique for any individual and hence very important for identifying. So fingerprints, very important. Okay, so these patterns are genetically determined. Okay, so there are papillary ridges. Okay, or you can say friction ridges. Okay, so patterns of these papillary ridges are very important. There are four basic dermatoglyphic patterns. Dermatoglyphic, you should be knowing this word, dermatoglyphic patterns in the digits. This is basically the fingerprints which we are talking about in digits. Sorry, dermatoglyphic patterns in digits. Okay, so what are these? The arches, whorls, loops and composite patterns. Okay, this will be more important when you will discuss in the forensics. Okay, you will understand more in detail these structures. Okay, then clinical integration of this information that we just discussed, clinical or applied. So there can be stretch marks. So there can be stretch marks. Okay, or linea albicans. We will discuss these lineas in abdomen. Okay, when we will discuss a lot of lineas. Linea albicans. This appears due to overstretching of the dermis. Okay, it results due to the rupture of the collagen fibers and repairs due to the scarring of the tissue. It commonly observed in the lower part of the abdomen, thighs, breast of the multiparous females. Okay. Then you have the wrinkle lines. Okay, which are produced by contraction of the underlying muscles. Then the lines of expression. Okay, the lines of expression. Okay, then yeah, this is the last topic only. We are going to cover this quickly in maximum 5 minutes. I will try to wind up. Okay, so the lines of expression, the furrows or the lines on the forehead, the face, they are produced by the continuous contraction of the muscles of facial expression. Then I told you the clinical and medico legal importance, that is the fingerprints. Okay, so every individual has unique fingerprint pattern, you already know that. Okay, so that is something which you should know about the different aspects of the skin with respect to clinical entities. Then if I talk about this skin sensory receptors, so there are some free nerve endings. Okay, there are free nerve endings in the skin. Okay, which basically terminate in the stratum glandosum of the epidermis. They carry fine touch, heat, cold, pain sensation, hair movement sensations. Okay, then we have some Pacinian corpuscles. Okay, which are responsible for deep pressure and vibration sensations. Okay, then we have the Meissner's corpuscles for light touch. Okay, then we have the Ruffini's corpuscles, the stretch and the torque sensations. Okay, then we have the end bulb of Croce for cold temperature sensations as seen in this image. Okay, very clearly you can see, not in detail, we are not going into too much detail because that is not beyond the class of this beyond the scope of this class, because definitely this all will be covered in the region wise when we will discuss separately. Okay, then we have the Merkel disc receptors, those are the mechanoreceptors which I just told you previously also. Okay, so you should know about this. And then we come to the next part, that is the appendages of the skin. In appendages of the skin, the epidermis is actually giving rise to certain appendages, okay, which supports the skin. Okay, so the main appendage which we have to discuss is the nail hair. Okay, which you can see in this image also. Nails are modified zones of epidermis which are found. We will discuss those words, albicans and all, in abdomen region, so don't worry. Okay, so nails are modified zones of epidermis found on the dorsal surface of the tips of the fingers and the toes. Okay, high sulfur content of keratin is responsible for the hardness of the nail plate. Okay, so very important, you should know the parts of the nail. Okay, as you can see in this image also, number one, the nail plate. Okay, which is important. I am highlighting the ones which are very important. There are a lot of other things also, you can completely ignore them. Okay, but one is the nail plate. So keratinized cells, basically the nail plate shows free distal end and an embedded proximal end. Okay, embedded proximal end. Okay, and a free end. You can see in your side also, in your hand also, the nail bed. Okay, sorry, nail plate, that is the body basically. Okay, so this is having an embedded proximal end, that is the root of, or you can say radix part. Okay, so that is the root of the nail. Okay, and then we have the nail bed. Okay, very important, nail bed. If you get any injury on this finger, then nail bed will become bluish. Okay, so this is basically, you can remember, nail bed is highly vascular. Okay, nail bed is highly vascular. Okay, connective tissue layer that is deep to the nail plate, which you can see in this image also. Okay, that is a nail plate, nail bed. And these the rest of the nail bed is actually very important, because nail bed is vascular, and hence if there is any injury, so there can be bleeding from this nail bed. Okay, so that is mostly important for your examination point of view. Okay, then we have something known as lanula, which you can see in this image also, lanula. Okay, sorry, lunula, pronunciation, lunula. Okay, this is a proximal soft heart, half moon shaped. If you can see in this in your nails also, you can appreciate the proximity in your thumb, it will most clearly visible the lunula. So lunar, you know, that is the moon. So proximal soft half moon shaped white part of the nail plate that overlies the germinal matrix. Okay, so that is the lunula. Okay, then you have the eponychium. This is an extension of the base of the nail plate only. Okay, you can see this is extending here. You can see this is extending the base of the nail plate, it is extending, and this extension of the nail plate behind this deep to the proximal nail fold, this is actually the eponychium. Okay, so then there is another word that you can hear, that is the hyponychium. Okay, so that is a part of the stratum corneum, the epidermis only, that lies under the free edge of the nail plate. You can see in this image, very well labeled. Okay, so that is about the part, and then there is another part which is not labeled here, that is known as cuticle. Okay, what is cuticle? It is a skin that overlies the base of the nail at the matrix. Okay, so that is the cuticle. So this part, that is the cuticle. This part of the skin that is overlying the nail matrix, base of the nail basically. So that is a cuticle. Okay, so you know cuticle clearing also you do in manicure, pedicure, right? So this is about the basic structure which you should know. And so growth of the nails, it involves the proliferation of the cells of the nail matrix which produces continuous nail growth. Nails, they grow throughout the life. Okay, and growth of nails, fingernails, that is fingernails growth is faster than toenails. Okay, that is approximately 1 mm per week. So when you cut your nails, you know, you cut these hand nails, fingernails more frequently as compared to the toenails. Okay, and if suppose if there is an injury, if that full nail goes away, okay, so it takes approximately 3 to 4 months for the whole nail to grow. 3 to 4 months for whole nail to grow again. Okay. Hence, to remove nails infected with fungus, the treatment should be continuing for 3 to 4 months. So that is the clinical applied anatomy of this information. Okay, which you should know as a dermatologist and as a doctor also. Okay, then so there are so many clinical entities linked to this. Okay, so then we talk about the clinical integration for the nails. Okay, there is a word known as onychia, or you can say that is inflammation of the nail folds that results in pus formation and shedding of the nails. Okay, then we have onycholysis, that is detachment of the nail plate from the nail bed. Okay, then you have an onychocryptosis. Okay, that is ingrown toenail. Okay, then we have paronychia. Okay, that is bacterial or fungal infection of the nail base. Okay, then we have koilonychia. Okay, that is spoon shaped nails. Okay, these are caused by iron deficiency or vitamin B12 deficiency. Okay, spoon shaped nails. Okay, then have a look at another clinical entity, that is the nail clubbing. Okay, so there can be clubbing, nail clubbing. What is that? Bulbous swelling of the nail bed that results in convex curved nails. Okay, and increase in the angle between the cuticle and the nail plate. So nail clubbing is a deformity of the nails associated with a lot of diseases which we will study in the medicine prof. Okay, so that is due to the hypoxic injuries causing the proliferation of the nail bed and results in clubbing. For example, lung diseases, heart disease, and so on. Okay, so then there is a Shamroth window test which is done, okay, clinically tested on opposing the distal phalanges of the corresponding fingers of the opposite hands. A small diamond shaped window is usually apparent. Okay, you can check also, that is a diamond shaped window which you can see. Okay, and between the nail plates, and if this window is obliterated, then there is a Shamroth's test, okay, which is considered as positive for clubbing. Okay, in case of clubbing, that is positive. Okay, similarly there is Lovibond angle. This you will study in the medicine prof. Okay, the angle between the proximal nail fold and the nail, okay, which you can see in this image also, and you can check on your body also. Normally it is less than 180 degree. If it is more than 180 degree, that means it indicates clubbing. You can see in this image very clearly. Okay, so that is very important from clinical aspect. Okay, then we discuss about the hairs. Okay, so they are elongated keratinized structures. They cover the entire body except the palm, sole, and sides of the hand. Okay, lips, feet, and ventral surface and sides of the digits. Okay, and structure wise, if you talk about the hair, we have three parts. Okay, number one, we have the shaft. Number two, we have the root. Number three, we have the bulb. Okay, shaft is the visible part of the hair that projects above the surface of the skin. Root is the part of the hair, see in this image, root is the part of the hair which is embedded within the skin and enclosed by a hair follicle. Okay, and bulb is the part, okay, bulb is the part which is expanded end of the root of the hair. Okay, so this is something which you should understand as a whole, okay, for very important point. Then there are three parts, okay, which you can see in this image. Have a look. Number one, the shaft, the parts of the shaft, you can see the medulla. Okay, and medulla is the central part of the hair. It consists of large keratinized cells. Okay, and we have the cortex which is surrounding the medulla. Okay, you can see this yellowish in this image, and this is made up of cornified cells containing hard keratin filaments. Okay, then we have the cuticle of the hair, which you can see the outermost, which covers the surface of the hair. Okay, and this actually resembles the scales of the fish. Okay, so hair follicle, you can see the image, previous image, okay, which has different things visible on the cut section in case of histological image. Okay, it's a high magnified H&E stained image. Although you will not be focused, you will not be asked a hair follicle on histology in detail. Okay, you just need to see the skin, layers of the skin. Okay, so you can ignore that, just hear the names only, that is more than sufficient. So inner root sheath, actually the inner root internal root sheath, it has various other aspects like the Henle's layer. Okay, there is a Henle's layer, there is a Huxley's layer. Okay, Henle's layer is single layer of cuboidal cells. Okay, so it is single layer of cuboidal cells. Okay, whereas Huxley's layer is double layer of flattened cells. double layer of flattened cells. Okay, and cuticle is having squamous cells that cover outer free surface of the hair shaft. Okay, so these are squamous cells. Okay, then outer root sheath, which we can see in this image. Okay, and then so the clinical integration, the cortex of the hair, it determines the color of the hair. Okay, and graying of the hair, if you know the old age. Okay, the color of the hair and graying of the hair. Okay, clinical integration. Graying in old age, hairs they become gray or white basically. Okay, don't worry if it's going OST, just telling you Huxley's there, Hensley's there. If you don't know this, you will not fail or pass, nothing. It's an extra information which you can gather. Okay, don't need to go into too much detail, also you can ignore that, no problem. Then moving further, you can see this clinical picture which is having all the dermatological disorders, which you can see. The acne vulgaris, pemphigus vulgaris, herpes zoster is a viral infection, psoriasis, which we just discussed, keloid, a scar mark, which you can see in this image, epidermolysis bullosa, melanocytic nevus, vitiligo disorder, okay, patchy depigmentation, which we just showed you, and sebaceous cyst, clubbing of the nails, onychomycosis, okay, and alopecia areata, which you can see the patch of the skin has been gone. So spot baldness, also baldness, hairs are lost in small area of the body. So this is something which you can remember and recollect, okay, for the clinical integration. Have a look at this histological image for the sebaceous glands. Okay, sebaceous glands. So sebaceous glands are actually holocrine simple saccular glands present in the dermis. Okay, and this is an histological image showing the sebum secreting cells. Okay, you will see this sebaceous glands on histology also. We will talk about this in histology section. So even if we don't talk about hair in detail, that is not a problem. Okay, so you can totally relax if you don't know it just now, but just understand what is it. It's actually a holocrine simple saccular gland present in the dermis only. Okay, so hair independent sebaceous glands, they are found in the lips, areola of the nipples. Okay, and each of the sebaceous glands, they are having certain functions. Okay, they are secreting sebum, that is oily secretions. Okay, and so clinical correlation you can remember for this sebaceous glands, that is very important, and something which so many people experience, that is oily skin. Okay, that is known as seborrhea or oily skin. Okay, that is overactive sebaceous glands which are producing excessive sebum. Okay, baldness of hair, yes, correct, alopecia areata, I showed you the image also. Then a very important, acne vulgaris. We will study these entities in detail in dermatology. Okay, I'm just telling you briefly the nomenclature. It occurs during the adolescence age in both the sexes, in males and female. Hair follicles, they get clogged with the dead cell debris and sebum. Okay, so that is why this acne vulgaris is something, in 80% of the cases you can say it is genetically based. Okay, and increased hormonal levels during puberty, this enhances the acne. Okay, then have a look at this difference. So this is about the sweat glands. Okay, so there are basically sweat glands which produce sweat, or you can say perspiration. Okay, and there are eccrine sweat glands and apocrine sweat glands. Again, in detail I am not talking about here, I am just giving you a brief overview because everything will be discussed in histology, so it's no point talking about it here and then histo again. Okay, So just overview which you should know. So eccrine or typical merocrine sweat glands, these are distributed all over the body except the lips and the external genitalia. Okay, so very important, that is the eccrine sweat glands. Okay, and then there are apocrine sweat glands, which are atypical sweat glands. These are present only in the axilla, areola, okay, and nipple of the mammary glands, skin around the anal opening, and these apocrine sweat glands, these include glands of Moll, okay, MOL, glands of Moll in eyelids. Okay, so this is something which you should be hearing of, that is the sweat glands. Okay, about the different sweat glands. Okay, and I told you mammary glands or breast, that is also a modified sweat gland only. Okay, and it is located in the superficial fascia of the chest region. They secrete the milk during the lactation. Okay, I told you we will discuss breast in detail in the upper limb. Okay, and then there is a clinical correlation, that is the gynecomastia. What is that? Clinical for this, that is the gynecomastia. What is gynecomastia? Gynecomastia. Okay, abnormal development of the breast in males. Okay, so that is something which you should know about the sweat glands and sebaceous glands. Okay, then talking about the last topic in this region of the skin and appendages, that is the burns. So something in brief about the burns which you should know. So total surface area of the skin in adults, that is around 1.5 to 2 square meters. Okay, and skin burns, they are classified into first degree burn, second degree burn. Okay, so you can say degrees of burns are very important. Degrees, number 1, first degree burn, second degree burn, and third is third degree burn only. Okay, so number 1, first degree burn, it destroys only the epidermis. It destroys only the epidermis. It results in redness. Okay, it results in redness, swollen skin. Yes, you are right about the Klinefelter syndrome. We will discuss that in genetics. Epidermis, it results in redness, swollen skin. It is painful, but it heals in 3 to 6 days without scarring. Okay, very important. Prognosis is important for examination, for the patient. Prognosis is very important clinically. Then second degree burn, it involves the epidermis and plus part of dermis. Okay, it causes blister formation, very important. So second degree burn will lead to blister formation. So you should know as a medico that if it is second degree, only then blister will form, and it is again painful. It heals in few weeks with or without scarring. Okay, again important. Then we have the third degree burn, that involves epidermis obviously plus entire dermis plus underlying tissues. Okay, which involves the muscles and bones. Okay, it may involve muscle only or bone also, and the burned area is insensitive to touch. It heals with scarring only, and this will require skin grafting. Very important. The plastic surgeons, they are earning in crores from this skin grafting. Okay, due to the wounds of the burn wounds. Okay, so you should know this information if you tend to become a plastic surgeon in future. So you should know this also. Then there is a Wallace's rule of 9. Okay, rule of 9, which you can see in this image. Even the nursing staff knows this rule of 9, so you should be knowing at least, okay, because it's very important. Easy method to estimate the percentage of body surface area affected by the burns. Okay, so head and neck region, that is given 9%, you can see. Okay, each upper limb is given 9%. Okay, sorry, each upper limb is given 9%, and the front of the trunk is given the 9%. Okay, and back of the trunk again 9%, and each lower limb having 9% each. Okay, and then we have the 1% in the perineum or the genitals. Okay, so that is the rule of 9 to estimate the degree of burns. Okay, and age changes in the skin involve the wrinkles and the fine lines which can come, loss of elasticity resulting in sagging and laxity of the skin. Okay, uneven skin due to uneven distribution of melanin. Okay, reduced hydration and reduced capacity of wound healing. Okay, cosmetics can reduce aging to certain extent, but their overuse may be very harmful. So here we are with the next topic for today. Okay, so another important topic which is going to be asked in your exams for general anatomy, that is the connective tissues and fascia. Okay, and then we will take up the muscular system after this topic. So to begin with, first, just matter of an introduction. See, most of the things here which I will discuss will be taken up in histology also. Okay, microanatomy separately, but whatever is required for the basic general anatomy I will cover in this class. So the basic organization of the human body. Okay, this includes, see, human body is a complex, highly advanced machine. Okay, inside the body there are different levels of structural organization. Okay, so there are basically, you can say, there are four main layers of organization. Okay, four main layers of organization. Okay, what are those? Number one, the cellular level. Number two, the tissue level. Number three, the organ level. And lastly, number four, we have the system level. I'm sure you have read this already in your biology classes in 11th and 12th. So the cellular level, actually fundamental building block of the life is actually the cell, and a multicellular organism like human being, they consist of 60 to 100 trillion cells. Okay, so there are various cells in the body specialized to carry specialized for any particular task. The specialized cells, like example, bone cells, muscle cells, fat cells, blood cells, nerve cells, all these are examples of cellular levels. Okay. And the structure of each of these cells depends upon its functions. Okay. Then talking about the tissue level. So tissue is an aggregation of the group of cells to perform one or more specific function. For example, the epithelial tissue, connective tissue, which we will discuss today, muscular tissue, which we will again discuss today, nervous tissue. These are the four basic tissues of the body. I will talk to you in a while. Then organ level. So an organ is a specialized self-contained structure that performs a specific function or group of functions. Suppose heart, kidney, liver, so many internal organs, stomach. Okay, so this is organ level structural organization. Then we have the systems. So each organ system consists of multiple organs working together to carry out designated function. Okay, similar function. So human body comprises of 11 primary systems, which includes the last class, if you remember, we have discussed yesterday regarding integumentary systems, skeletal, muscular. So these are all systems, skeletal system, muscular, nervous, and all these are going to be the general anatomy topics one by one. Okay, the integumentary system, skeletal, muscular, nervous, endocrine, circulatory, lymphatics, respiratory, digestive, urinary, and reproductive systems. Okay, so having understood this basic thing about the human body, we can move on to the specific thing to discuss today. That is number one, the tissues. Okay, so this is a very important thing to know because it will be asked to you in the Viva also, in theory exams as well. So for tissues, I told you it's an aggregation of the group of cells which are organized to perform one or more specific function, right? So what are the four basic tissues of the body which you should know? Number one, we have the epithelial tissue, okay? Or you can say epithelium, okay? Epithelial tissue. Number two, we have the connective tissue. Number three, we have the muscle tissue. And number four, we have the nerve tissue. Okay. So epithelial tissue or epithelium, the surfaces of the body, the inner or outer, suppose the inner surface of the tubular structures within the body, they are covered by a layer, okay, that rests on a basement membrane, and that will be studying in the histology. Okay, such a covering, which is covering layer, which is called, that is the epithelium. Okay, epithelial tissue which you are talking about. Then we have the connective tissue. So it supports the three basic tissues of the body. Okay, and it consists of the cells and the connective tissue fibers, intercellular matrix. Okay, and specialized connective tissue including like bone with the mineralized matrix. Okay, cartilage with hyaline matrix. Okay, then we have the blood with the flowing connective tissue. Okay, the then we have the next, that is the muscle tissue. So it is contractile cells. It is further classified into skeletal, cardiac, and smooth, which we will take up today only. Okay. And then we have nerve tissue. So the property of excitability, conduction, okay, all these things we will study in the nervous system. So nerve tissue receives the information from the external and the internal environment. The brain actually interprets the information, it conveys to the other organs to control their functions. Okay, and it consists of nerve cells and supporting neurological cells. Okay. So let us take up the connective tissue, which is the mainstay of our discussion today. So connective tissue, I hope everything is good. In chat you can respond. If you are online, you can give me a thumbs up if everything is good. It's very basic stuff, and basics are extremely important to understand. If you are online and attending this session, please give me a thumbs up. Okay, connective tissue. So connective tissue is comprised, or you can say characterized by the presence of three components. Okay, so there are three components. Okay, number one, the cells. Then we have the fibers. Okay, and then we have the extracellular matrix. Okay, extracellular matrix. Okay. Right, So this is the basic thing about the connective tissue, and this actually gives a definite shape to the organ and body. And just the people who have joined, I just want to emphasize that I possibly cannot write the entire book to you in the notes, so I am writing the key points and important things which you need to remember, which will give you a framework what I have discussed today. And you can listen to this video again and again if you miss out something, if something is not understood in one go. Okay, you can repeat the words and understand the things, very basic things. And obviously you have to read the textbooks, find time to read everything, but trust me, reading the books after attending this class will take less time. Okay, if suppose it was to take 1 hour or 2 hour, it will take only 15 minutes or 20 minutes. You can just give a scanning look in the book and you can make out everything very easily. Okay, so these are the three components, and I told you this connective tissue is the one which gives the definite shape to the organ and body. It supports the other tissues, performs various other functions. Okay, fibers of the connective tissue, okay, which I have written here, the fibers. Okay, this actually there are the connective tissue has three different types of fibers in the matrix. Okay, what are these three? Number one, that is the collagen fibers. Number two, we have the reticular fibers. Number three, we have the elastic fibers. Okay. So collagen fibers, these are found almost in all the connective tissues. Reticular fibers, these are present in the basement membrane, lymph nodes and liver. Okay, and elastic fibers, they are present in the blood vessels, lungs, and there is a ligament which we will read in the head and neck region, the ligamentum nuchae. Okay, nuchae is the neck region. Okay, so back side we have a ligamentum nuchae. We will discuss that eventually. So to understand this connective tissue in nutshell, we can make a flow chart which will help us to understand few things in proper sequence. So let's make three headings. Basically, we have three things to write here. Okay, 1, 2 and 3. Okay, so number one, we have the embryonic connective tissue. I am abbreviating as CT to save time. You can write full in your exams. Okay, then we have connective tissue proper. Okay, and then we have specialized connective tissue. Okay, I will try to wind up till 9. Okay, maximum 15 minutes it can stretch, or maximum 20 minutes. I will try to wind it up till 9. My target is that. If it exceeds, that is not in my hand, but I will try to wind it up. I need to finish the topics. Okay, so embryonic connective tissue. Okay, so we have these three major things to consider here. Okay, and in this number one, we have the embryonic connective tissue, in which we have mesenchyme. First you write, and I will explain you what is all these things. Okay, mesenchyme and mucoid connective tissue. Okay, and then we have this connective tissue proper. So connective tissue proper, or anyways, I hope everything is okay. Then we have the connective tissue proper, in which we have the adult connective tissue. Okay, so if some people are having echo, please just rejoin if you have some issues. I don't want to waste any major time of this on this. Okay, anyways, I'm writing also most of the things, so you can see also, right? So connective tissue proper includes the adult connective tissue. Okay. Specialized connective tissue, that involves the cartilage. Okay. The bone. Okay. Then the blood. Okay. And adipose tissue. Okay. So these are the specialized connective tissues. Okay. Then we have the further bifurcation from this adult connective tissue. Okay. So number one, we have the loose connective tissue. Okay. And then we have the dense connective tissue. ये क्लासिफिकेशन बहुत ज़्यादा इंपॉर्टेंट है बिकॉज इट इज़ गोइंग टू बी द बेसिस ऑफ कनेक्टिव टिश्यू. ठीक है, सो प्लीज़ मेक इट अ पॉइंट टू रिमेंबर दिस. इट्स वेरी ईजी ऑल्सो. आई विल टेल यू इन अ वाइल एक्सप्लेनिंग एवरीथिंग. फर्दर फिर हम देख सकते हैं वी हैव द डेंस, रेगुलर एंड डेंस इरेगुलर. ओके, सो डेंस, सॉरी, the dense, irregular connective tissue. In the exams you need to write everything very, I would say, no abbreviations are allowed in your theory exams. Okay, so please make it a point to write everything incomplete. Here to save time I am using them. Dense regular connective tissue. Okay, so this is the basic framework of connective tissue. Now a very important thing to understand, this connective tissue will actually be dealt with you in detail in case of the histology. Okay, so but now just for a basic understanding about connective tissue you should know few things. Like connective tissue has been classified into three major categories: the embryonic connective tissue proper and the specialized. Okay, so embryonic connective tissue, it is present predominantly during embryonic life. Okay, as the name suggests, and these consists of the mesenchymal tissue and mucoid connective tissue. You will be shown histological slides for this mucoid connective tissue, so that will be discussed again. Then we have the connective tissue proper, or you can say the general connective tissue. Okay, the general connective tissue. Okay, so this is one category. Then there is specialized and there was embryonic. Okay, so connective tissue in general, so this is present in all the organs of the body, and it is classified further into loose areolar tissue. Okay, like the consisting of loosely woven connective tissue fibers and abundant adipocytes. Okay, the fat cells. It is present in the superficial fascia, lamina propria. All these words you will hear in histology again, surrounding the blood vessels, the nerves and viscera and the muscles, parenchymas of the glands, and in the mesentery. Okay, linked to the intestines. Okay, then we have the dense connective tissue which can be further split into two categories, that is irregular and regular. So irregular, it contains mostly irregular bundles of collagen fibers. Okay, examples like dermis of the skin, dura mater. Okay, we will see in the head and neck region, submucosa of the intestinal tract, epineurium, pericardium, periosteum, tunica albuginea of the testis, the sclera, and even the capsules of various organs. Okay, talking about the dense regular connective tissue, have a look at this dense regular. So it contains a compact parallel array of thick bundles, that is regularly arranged collagen fibers. Okay, there will be regular arrangement. You will see in histology again. So examples of dense regular, very important and often asked in the exams, that is tendon. Okay, the ligaments and the stroma of the cornea. Okay, so that includes the dense regular connective tissue. Okay, then we have the last category, that is a specialized connective tissue, which has characterized by specialized nature of their extracellular matrix, including the bone, cartilage. These are all separate chapters in histology, we will take up separately. Then the blood, okay, even the adipose tissue, the fat tissue, and also there is a lymphatic tissue, which we will take separately. Okay, so that's about the connective tissue. So don't worry if you have not got into the pictures of all these, because that is to be covered in the histology. Okay, so don't worry about that. So we move to the next major important topic of today, that is the fascia. Okay. So very important, this is a connective tissue that surrounds the muscles, the vessels, nerves, organs, and even spaces of the body. Okay, it helps in maintaining the body structural integrity and provides support and protection. So there are two types of fascia which we will discuss. Okay, I hope you already know this, number 1 and number 2. So number 1, we have the superficial fascia. Okay, and then we have the deep fascia. So immediately when you will cut open the skin, I will introduce you to the dissection also in the last part of the general anatomy. I have kept a separate topic for that. So immediately when you cut open the skin, you will encounter the fascia. So it may be superficial fascia, it may be deep fascia, depending upon what you are dissecting and where you are seeing the structures. So talking about the superficial fascia first. Okay, superficial fascia, this is actually I can say loose connective tissue beneath the skin. Okay, so talking about the superficial fascia first. Okay, everything is fine, समझ में आ रहा है अभी तक? Like please give me thumbs up if everything is okay. बीच में कुछ connectivity, कुछ problem थी voice में. I hope now everything is okay. Right, so superficial fascia is a layer of the loose connective tissue that is just beneath the skin. Okay, it connects the dermis, that is the part of the skin only. Okay, we discussed epidermis, dermis yesterday in the skin lecture. Okay, so it connects the dermis with the underlying deep fascia. Okay, hence also it is called subcutaneous tissue or hypodermis. Okay, it is primarily made up of loose connective tissue or areolar tissue with varying amounts of fat. Okay, so now what are the basic features of the superficial fascia? Okay, so number 1, that is the distribution of the fat. Okay, so fat is distributed in variable amount in the superficial fascia throughout the body. Very generalized statements I am telling you so that you can understand better. Okay. Thank you. Agar everything is fine. So धीरे धीरे you will have accustomed to my voice also. ठीक है, और फिर हो सकता है if I don't know students जो classes देख रहे हैं अभी तक, you may love my voice and you may fall in love with the subject also. So it depends upon time to time. कुछ students को they will not go to any other person, they will feel कि मुझे यहीं से सीखना है, I have to learn from me only. So it depends, student to student variability होती है, but I try my level best to give things to you, okay, from maximum sources possible. And obviously if you have any feedback, you're most welcome. I will try to incorporate everything. I'm very open to anything. If I need to learn something, I will do that. Okay, so distribution of the fat, fat is distributed in variable amount in the superficial fascia throughout the body. Okay, there can be thick or distinct superficial fascia which is present in the lower part of the anterior abdominal wall, okay, perineum and limbs. Thin superficial fascia is present. I will write some important things, don't worry, I am just telling you overall, okay, what is the placement. So thin superficial fascia is present in the dorsum of the hand, the feet, the sides of the neck, face and around the anus. Okay, so deep I would say this is the superficial fascia. It is variable amount of fat which is present. Okay, and the in the lower part of the anterior abdominal wall, we will discuss in the abdomen region also, the perineum and the uppermost part of the thigh. The superficial fascia shows two layers. Okay, we will discuss that separately. That is a scarpa's fascia, camper's fascia. We will discuss separately when we will talk about in the abdomen region, anterior abdominal wall. Okay, so you can remember few things about the superficial fascia. That is number one, the fat. Okay, so this is in the NMC competency also, because that has been asked repetitively regarding the fat. So certain sites the fat is abundant and certain sites there is absence of fat. Okay, so distribution of fat, let us see. Let me just move this. Okay, so we're talking about the superficial fascia and here the distribution of the fat. Okay, so now number one, there is abundance of fat. Fat is, okay, let me make it in that manner. It will be just easy to remember otherwise. So at certain points in the body there is abundant fat. Okay, abundant fat. Okay, that is and certain sites there is absence of fat. Okay, we are talking about superficial fascia only. Okay, so number one, that is the abundant. Okay, so fat is abundant in the gluteal region. Okay, gluteal region, the buttocks. Okay, we will discuss separately all these regions. Okay, and then the front of thigh. Okay, and anterior abdominal wall, that is the belly fat, if you know, anterior abdominal wall. Okay, then mammary gland. Okay, that is itself having the breast tissue actually, that also has fat. You will see these things when you will dissect in the cadaver. In these regions you will be able to find a lot of fat. Okay, and overall the fat is more abundant in females and children. Okay, and fat also fills the spaces in the axilla, the orbit. Okay, fills the spaces in axilla, okay, orbit, right, and istiorectal fossa. We will talk about that also separately. Istiorectal fossa. Okay, and the spaces around certain organs such as kidney. Okay, perinephric fat. Okay, around the kidney, you will see that in dissection very easily. Okay, then we have the fat, which is the sites where the fat is absent in the superficial fascia. So that includes the eyelids. Okay, external ear. Okay, the penis in males, along with scrotum. Okay, and flexor creases of the digits. Okay, the flexor creases of digits. Okay, of digits. Okay, सुपरफिशियल फेशिया एंड डीप फेशिया जनरल टर्म है, हाँ, मतलब फेशिया को ही हम दो तरीके, दो लेयर्स देख रहे हैं, एक सुपरफिशियल है और डीप है, जो हमने जनरल एनाटॉमी में वर्ड्स यूज किए थे. सो बॉडी पार्ट के अकॉर्डिंग नाम अलग अलग होता, या actually no, the superficial and deep fascia is something which you know about the superficial and deep, basic thing. Okay, you have to attend the previous class, otherwise things will be gone. Okay, you will not understand these terms. Okay, then we come on to the contents. The contents of the superficial fascia. Okay, so there are certain contents which includes the adipose tissue itself. Okay, the adipose tissue. Okay, the mammary glands. Okay, they are also in the superficial fascia only. We will discuss that separately in the upper limb. Okay, mammary glands, cutaneous nerves and vessels. Okay, and lymph nodes. Then there can be sweat glands. Okay, then subcutaneous muscles in the face. Okay, even in the neck and in the scrotum. We will discuss region wise, you will understand all things better. And then there can be hair follicles, which we also discussed yesterday only. Okay, so before I move any further, do you know the function? So basic function of the superficial fascia, that would include insulation. Okay, so due to the presence of fat and protection against the cold. Okay, so these are all your theory and viva questions which you can recollect. Okay, so if I talk about, we have the functions. Okay, so number one, insulation. Okay, so insulation due to the presence of fat and protection against the cold. Then padding and shock absorption. Okay, then it also facilitates the movement of the skin over the underlying structures. Okay, by reducing the friction. So facilitates movements, okay, of skin over underlying structures. Okay, number 4, it supports the skin and gives external shape to the body. Okay, it acts as a support to the skin, as it is lying just below it. Okay, then again it is a reservoir of energy in the form of fat, right? And then it gives passage to nerves, vessels and lymphatics. Nerves, vessels and lymphatics. Okay, and also it helps in wound healing and also immune response. Wound healing and immune response. So these are many functions of the superficial fascia, okay, which you should know. Okay, so this is something which you should remember, okay, for the functions of the superficial fascia. Then talking about the clinical integration. So clinical integration, very important point to remember, that is the subcutaneous injections. Okay, anything what I will teach you in the entire course of anatomy has certain clinical entities to consider, and I will try my level best to include maximum clinical applied anatomy for every structure whichever I discuss, so that you know why we are talking about it. Okay, so this subcutaneous injections, as the name suggests, subcutaneous. Okay, so that is beneath the skin. Okay, so these are administered into the fatty tissue layer of the superficial fascia. Okay, and the common sites of this subcutaneous tissue where you can inject the medicine, that is, number one, we have the anterior abdominal wall. Okay, we can give injection on the anterior aspect of the thigh. Okay, and posterior aspect of the arm. Okay, in this region, posterior aspect, very important, not the lateral here, in the deltoid you give IM injection. Okay, but in the posterior aspect of the arm. Okay, and then also this all sites you can easily remember if you have some diabetic person at home who is using insulin. Okay, so you can remember through that. So this entire subcutaneous injection, this is most commonly used for the administration of, for vaccines. Okay, certain vaccines are given subcutaneously, and then certain hormones like insulin, very important, insulin, okay, which is given in diabetic patients. Okay, specifically the type 1 diabetic, type 1 diabetes mellitus, which is insulin dependent, and in type 2 also, at certain cases where the oral hypoglycemic agents are not working, you can add a supplement using the insulin therapy. Okay, we can give a Lantus insulin in the night, or you can give the regular insulin and in the morning time. Okay, so this is something which you should remember for the subcutaneous injection. Now, why this is helpful? Due to the poor blood supply in this region, the subcutaneous route is very useful for the drugs which need slow, prolonged absorption and sustained release into the bloodstream. This is the preferred site. For example, if you inject a Lantus insulin, okay, that's a long acting insulin, so it works 24 hours. Suppose if you give an injection right now for 10 units, that will secrete the insulin in the body, taking care of all the meals for up to 24 hours. Okay, so that is very helpful by giving a subcutaneous injection. And very important, subcutaneous injections are less painful due to the small size of the needles. Okay, so even the patient can himself, the layman person, he can himself inject the medicine. So that is very important to know about the subcutaneous injections. Okay, so having understood the relevance of this region, we move to the next part of fascia, that is the deep fascia. I hope superficial fascia is clear to everyone. Please give me a thumbs up in the chat. Please give me okay. It will be really helpful to understand that you are on this, we all people are on the same page. Okay, so I can move accordingly. Then we talk about the deep fascia. Deep fascia is a tough, inelastic fibrous membrane that encloses the tissue deep to the superficial fascia. Okay, now distribution is very important. Deep fascia is well defined and thick in the limbs. Okay, and deep fascia keeps the soft tissues in place. It gives structural support and also shape to the body. Okay, very important, you should know that the deep fascia does not cross the subcutaneous bones. Okay, so because both are derived from the mesoderm only. Okay, so talking about the modifications of deep fascia, so there are certain modifications. Modifications of deep fascia. So the deep fascia actually gives certain modifications, and some of them you might have already heard in your classes also. Okay, so number one, we have, okay, I can use the image till much better. So let us see in this only. Okay, so this image I think you all are familiar with. this is the image showing the palmar aponeurosis. Okay, you can see flexor retinaculum in this image. Okay, so number one modification of the deep fascia, let me move it from here. So number one modification of the deep fascia, that includes aponeurosis. Okay, aponeurosis. Now this is a broad, flat, thick sheet of deep fascia that corresponds to the flattened tendon. Okay, you can see the tendon of the palmaris longus muscle which is ending into it. So very good example is this, which is shown in this image only. So you have to remember the modifications of deep fascia along with certain examples at this point for your Viva and theory exams for general anatomy. Later on, all these examples you will be very masters of this when you will go through the entire anatomy. So aponeurosis, I told you what is it, and the classical example is palmar aponeurosis in the palmar region. Then in the sole we have plantar aponeurosis. Okay, so this, in case of this palmar aponeurosis, this is representing the degenerated tendon of the palmaris longus muscle. Okay, so this is something which you should know. Then talking about the next, that is the retinaculum. Okay, retinaculum, it is a band of deep fascia that retains the tendons of the long muscles. In the wrist we have this part. Okay, you can see the place. Remember here till this wrist joint, here you see the radius and the ulna parts. Okay, so here it is not present. The flexor retinaculum is present above the wrist in this place. Okay, over the carpal bones. So you know this is an important Viva aspect which can be asked you in the exams. This region has the carpal bones and here the band of flexor retinaculum is present. Okay, we have already discussed this in the upper limb region. So you can talk, you can go through that classes to understand in detail about the flexor retinaculum. So it prevents the bowstringing of the tendons during the muscle contractions. So very good examples, flexor retinaculum as shown in the image. There is an extensor retinaculum around the wrist as well as around the ankle joints. Okay, so same things in upper limb and lower limb. Okay, then you have a third modification, that is the fibrous sheaths. Fibrous sheaths. Okay, so these are condensation of the deep fascia around the neurovascular bundle. Extremely important for Viva. All these sheaths are going to be your long questions in the exams. You will understand in region wise. Okay, so classical examples of this sheaths like structured, one is the femoral sheath as shown in this image also. Okay, so other examples being so femoral sheath, that is in the thigh region around the femoral vessels, and then we have the carotid sheath in the neck region around the common carotid artery, internal jugular vein, and also the vagus nerve is the content of this carotid sheath. Okay, then in the axilla region we have the axillary sheath around, winding around the axillary vessels. Basically this is provided protection, you can say. Okay, so around the major vessels you will see all these kind of sheath like structures. Then you have fibrous capsules. Okay, then we have the number 4, that is the fibrous capsules. Okay, okay, so fibrous capsules includes modifications of the deep fascia that encloses the glands. Okay, so there is a parotid gland which has a capsule around it. There is a capsule of the thyroid gland. Okay, we will discuss in region wise. In head and neck region we will discuss the capsules of these glands. Extremely important from clinical point of view. We will talk about how and why this is important in the region wise. Then number 5 we have the intermuscular septa. Okay, between the muscles. So intermuscular septa. Okay, so these are deeper extensions from the deep fascia as you can see in this image also. The medial intermuscular septa and lateral intermuscular septa is shown in this image. Okay. Okay. So in this image you can see the cut section of the arm region, okay, where you can see the flexor compartment, extensor compartment, and there is a septa, okay, dividing these two compartments. Okay. So deeper extensions from the the deeper extensions from the deep fascia only, that is separating the muscles into separate compartments. Okay. And then we have something known as interosseous membranes. I hope you know the meaning. We can break the words interosseous. Between the bones there is a membrane. Okay. So it is also a modification, that is, for example, connecting the radius and ulna in the forearm and tibia and fibula in the leg region. Okay. So that is a classical example of the interosseous membrane. Again, in the separate limbs we will be discussing it in detail, more detail. Okay. Then we have another entity that is known as fibrous flexor sheaths. Okay. So that is also a thickening of the deep fascia only on the flexor surface of the fingers and the toes around the long flexor tendons. Look at the images in the Netter atlas. You will see these fibrous flexor sheaths around the long flexor tendons. Okay. So these are nothing but they are holding the tendons in position and they prevent the bow stinging of these tendons during the muscle contraction. Okay. And then we have other things like the ligaments, okay, the fibrous capsules of the joints, okay, and the synovial membranes, and even the bursa. Okay. All these are the modifications of deep fascia only. Okay. So this is something which you should know for the basic, like these nomenclature we will discuss separately also, like for example some of the well important developed deep fascia in the body, for example cervical fascia in the neck we will discuss. Deep cervical fascia is a separate chapter which we will talk about in the head and neck region. Pectoral fascia in the anterior part of the chest, okay, not of much relevance, but you will hear of the term clavipectoral fascia, which is again important from examination point of view, covered in the upper limb. And fascia lata in the thigh region, which we will discuss. Thoracolumbar fascia in the lower back region. Then pelvic fascia in the lower part of the pelvic area, okay. And then we have the renal fascia around the kidney, okay, renal fascia around the kidney. Simpson's fascia or the suprapleural membrane at the root of the neck, okay. Here we will talk about it, Simpson's fascia in the thoracic region, okay. All these are specific fascias, we will talk about region wise, okay. Endothoracic fascia again in the thoracic cavity, so we will hear about these terms, okay. So then we move on further to the sites of absence of deep fascia, okay. So sites where deep fascia is absent, okay. What are these sites? Let us see. Number one, the face, then breast, okay. Number three, the dorsum of the penis and the clitoris, okay. Anterior abdominal wall, number 5 we have the scrotum, and then number 6 we have the istiorectal fossa, okay. So deep fascia is actually minimal in the palms, the soles, and even the eyelids. Okay, so absence of deep fascia in all these regions actually allows distension, flexibility, and mobility. Okay, so you can write this thing actually allows the distension depending upon the region to region. Okay, so that allows the distension, okay, flexibility, and mobility. Okay, so this is something which you should remember for the deep fascia. Okay, and this is minimal, you can write it is minimal in the palm, sole, okay, and eyelids. Okay, so the functions of the deep fascia, those include the structural support. Okay, the deep fascia, its functions, it includes the structural support. Okay, and also gives shape to the body. Okay, number 2, it gives an area for the muscular attachments. Gives area for the muscular attachments. Okay, number 3, compartmentalization. Okay, compartmentalization. I hope you know the meaning of this word now. As I told you, the intermuscular septums, okay, which are dividing the various flexor and extensor compartments in the limbs. Okay, so we have studied that separately in the upper limb, lower limb. So compartmentalization, it is very helpful. Thank goodness we have compartments, because there is a nerve which is supplying all the muscles of one compartment: flexor compartment, extensor compartment, superficial group, deep group. So very easy to remember those nerve supply of any muscle in the body. Okay, we will discuss that region wise. Then we have the protection of these structures. Protection of these structures, the deeper structures. Okay, and transmission of weight and forces. Okay, transmission of weight and forces. So also it you can say facilitates the movements and the change in the direction of the muscle pull. Okay, so this is something which you should know about the deep fascia. And before I conclude this topic, let me again discuss the clinical for the deep fascia. Number 1, that is the compartment syndrome. So having compartments is a good thing also, and there can be some syndromes linked to it. Okay, so unyielding, or you can say inelastic nature of the accumulation of the pus, it can lead to increased pressure within the facial compartments, and hence the compression of this content of this compartment can happen. Like any muscle, any artery, any nerve can be compressed in this, and this will be leading to conditions and symptoms in the patient. This is known as compartment syndrome, and it can result in severe pain, necrosis, or even paralysis of certain muscles, and so on. There can be other features which we will discuss limb wise. Okay, then there is another entity, that is the spread of infections. Spread of infections. Okay, so deep fascia actually limits the spread of infection. However, the infection can spread along the facial sleeves, around the vessels, and muscles due to this compartment continuity of the deep fascia. Okay, and planes of the deep fascia, they are the routes for infection spread. Okay, for example, tubercular abscess. Okay, it can spread from the cervical vertebra and it can enter even the axilla. Okay, along the prevertebral fascia. So there is a prevertebral fascia which we discuss in the head and neck region. Okay, and the tubercular abscess from the thoracic or the lumbar vertebra can reach the inguinal region through the psoas sheath. Okay, so that is also we will discuss. There is a fascial sheath around the psoas major muscle, so that is psoas abscess, which we will discuss separately also. Okay, in the abdomen region. Then it plays an important role in the surgical plane. Okay, so surgeons, they perform surgeries along the facial planes to avoid injuries to the adjacent structures. Okay, for example, there can be compression of the median nerve in the carpal tunnel syndrome, we have discussed in the upper limb. Similarly, there can be compression of the tibial nerve in the tarsal tunnel syndrome, we will discuss in the lower limb. Okay, so this is something which you should remember. And before I wind this topic up, okay, because we will discuss the muscular system now, just to wind this up, so there can be some interesting facts to remember. Okay, just first let me write the thank you, because this is the end of this topic. Okay, so some interesting facts to remember, okay, from this chapter. Superficial fascia of the eyelid, the penis, the scrotum, they do not have fat. Okay, very important, and you should know as a medico. Okay, temporal fascia in this region, head and neck we will discuss separately, and fascia lata in the thigh region, these are the toughest fascia of the body. Okay, we even take some grafts from this temporal fascia to reconstruct in the perforations of the tympanic membrane. We will discuss that in head and neck. Deep fascia is absent on the face and also on the external genitalia. Okay, so these are some interesting facts to remember, which you can recollect, because this is all very basic anatomy, which if you know, it will be very helpful during the dissections. Okay, so thank you all for this topic. So I hope this is okay and clear. Give me a thumbs up. I've tried my level best to include all the maximum clinical relevant clinical entities from this topic. I hope you are there, you have not slept or you have not left the class. Okay, so just give me okay or thumbs up or yes or anything, whatever you feel like, so that to keep the chat running, I can move to the next topic. So next topic in line, we have the muscular system. Okay. So let us discuss now the muscular system. So before we discuss this, let me show you the important competencies as per your NMC's curriculum. Okay, so they expect you to know and the classification of the muscle tissue according to its structure and action. Okay, action of the muscles is very important. I will talk to you in a while in detail. We will also enumerate certain parts of the skeletal muscle and differentiate between the tendons and aponeurosis with certain examples. And we will also understand what are shunt and spurt muscles. Okay, so these are all the competencies which are important for you to understand. So let's dive in this topic. Okay, so first, to introduce you to this topic, so muscle is a contractile tissue. Okay, please remember this very important line. Muscle is a contractile tissue. Okay, so the muscle tissue it consists of certain cells. Those are known as myocytes. Okay, myocytes, or you can say muscle fibers. So, muscle fibers. Okay, the myocytes are actually elongated or they are spindle shaped cells. Okay, so actually the word mus is the Latin word for the mouse. Okay, so like the mouse is there. Okay, so sorry. So like you have the mouse. Okay, so similarly this is resembling, okay, the muscle cell. Okay, that is the elongated spindle shaped cell. Okay, elongated, or you can say a spindle shaped cell. That is about the muscle. Okay, so in a muscle we have certain important entities which you will hear, okay, eventually. One is the sarcolemma, then we have sarcoplasm. Okay, we have sarcoplasmic reticulum. Sarcoplasmic reticulum. Okay, and then we have sarcosomes. Okay, so sarcolemma is the plasma membrane, sarcoplasm is the cytoplasm, sarcoplasmic reticulum is endoplasmic reticulum, and mitochondria, sarcosomes is basically mitochondria. Okay, so basically the sarcos is the word derived from Greek, that is flesh, and plasma is a thing. Okay, so flesh like thing, that is sarcoplasma. Okay, so all the muscles are derived from mesoderm, except there are few which are derived from ectoderm. Okay, and those things we will discuss in the embryology, the derivatives and all those structures. We are not focusing on that right now. Okay, another thing I can just tell you overall, no need to write, we can just understand, it's very basic thing, that is regarding the major functions of the muscles. Okay, so I think that will be better if I can write it. Some students may have problem otherwise. Okay, so the major functions of the muscular system. Major functions, number one, that is the movement of the body. Okay, number two, we have the maintenance of posture, very important again. Maintenance of posture. Okay, we have respiration. Okay, there are certain muscles which are responsible for respiration. Okay, then we have production of body heat. Production of body heat. Okay, then also very important, which I am also doing to you because I cannot see you guys, but I am doing this, that is communication. Now this communication can be in the form of speaking, which I am doing, that is involving the articulation of speech, that is again some muscles of the larynx which are working. Then I am writing. Okay, I am writing using some muscles of the hand, and then even I am giving you some facial expressions. I don't know what are your facial expressions, but those are also certain muscles which are bringing the facial expressions. We will discuss them separately, region wise. Okay, then there is something known as contractions. Contraction of the organs and vessels. Okay, so there is a musculature present in certain around the certain organs, and also certain vessels which have some muscle tissue. Okay, and then a very important function, that is the pumping of blood. Okay, so we will discuss that also, where it is actually happening. So soleus muscle in the lower limb, that is known as peripheral heart also. Okay, so it is a muscle which is pumping blood. Okay, we will discuss that eventually. So to understand this muscles, okay, further I need to classify that, before we dive into the basic tissues structural classification. So number one, we can have a structural classification. Okay, so structurally we can classify the muscles based on the presence of striations in their cytoplasm. Okay, so that is number one category. You all know from your biology classes, that is striated muscles. Okay, and then we have non-striated muscles. Striated and non-striated. Okay, so striated muscles includes the skeletal as well as the cardiac muscles, and non-striated includes the smooth muscles. Okay, similar kind of classification we can do, but based on the functions. So there is a functional classification of the muscles. What does that include? Number one, that includes based on the physiological control of the muscles only. Number one, that is the voluntary muscles. Number two, that is the involuntary muscles. Okay, so this includes the voluntary, includes the skeletal muscles. Okay, okay, and the involuntary includes the cardiac and the smooth muscles. Okay, so I hope now you know, and obviously these three muscle tissues you already know from a biology also. So have a look at these kind of images. I am not destroying the image, I am just using the highlighter now. Okay, so number one, skeletal muscle. Okay, it has a long cylindrical muscle fibers which you can see running in the form of cylinders. Okay, and peripherally located flat nucleus. So it's a multinucleated muscle fiber. Okay, which you can see, and there is no branching which you can see. Okay, so again this is the skeletal muscle fibers which are running here. So cylindrical muscle fibers which are running. Compare it with the cardiac muscle. Okay, where you can see this cardiomyocytes. Okay, these are the cardiomyocytes. So having a single oval centrally placed nucleus. Again, very important. And obviously there will be striations here also. You can see different striations. Okay, there are striations in this. Okay, and there are also cross striations in this also. So another important thing is the intercalated disc which is present in this cardiac muscle. Okay, you can see the cardiomyocytes are joined by this intercalated disc, and there is a branching present in this cardiac muscle fiber which you can see in this image, right? And see here, you can notice the spindle shaped cells. Okay, the spindle shaped cells with their nucleus in the center. Okay, and flat elongated nucleus. Again, very important when you will see in histology slides. These are all histological features. Okay, you will discuss everything in clear in histology, and you can see this is how you will appreciate this smooth muscle on a longitudinal section. Very important. Compared to a transverse section of the same smooth muscle, where you will see the same cells in different manner. You will see dotted like structures. Okay, clusters of dot like structures with the nucleus, centrally placed nucleus. So here, that is the difference in the smooth muscle which you should know. So just for a recapitulation, I have put this table in front of you so that you can revise later on. Okay, all these things are very known to you. There is nothing new. Okay, So skeletal muscle, unbranched cylindrical fibers, very long cylinders, which we saw previously. Cardiac muscle, small branched cylindrical fibers again, and smooth muscle has small unbranched spindle shaped cells, which we just saw. Okay, and then it has multinucleated appearance in the skeletal muscle, whereas in the cardiac muscle we had the single centrally placed oval nucleus similar to the smooth muscles. Okay, striations very important. Okay, cell junctions again very important. Functions you already know. Okay, and then talking about the regeneration after injury or rhythmicity. Okay, then presence or absence of stretch receptors and examples. So these are certain important things to remember. Okay, and also one more thing, like I told you here about the intercalated disc, right? So this is something which is a thing which you saw on the histological slides previously. Have a look. Okay, this is the intercalated disc. This intercalated disc further has certain, junctional complexes. So number one is the fascia adherens. Again, in detail you don't have to go, I'm just telling you the names because that has been asked in the MCQs. And then we have the desmosomes, and then we have the gap junctions. Okay, so you can remember this with the mnemonic also, like F, D and J. So you can remember the functional DJ. Okay, if you can remember, recall later on, functional DJ. So cardiac muscle is playing a DJ band, and it has to be functional. Why I am telling you functional? Because cardiac muscle has a property that is functional syncytium. Okay, it works as a functional syncytium. So remember this for cardiac muscle specifically. Again, we will talk that in detail in histology, not here. Okay, I'm just telling you the main important things to remember. Okay, and all these things we have already discussed in the previous that from 11th and 12th also, so nothing very new. Okay, then we move to the next part, that is the basic property of muscles. So basic properties of muscles. Now the muscles as a general, any kind of muscle, they have 4 basic properties. Okay, number 1, that is the contractility. I wrote this word in the initial slide when I was introducing the muscular system. Then excitability, first note them down, I will tell you what are these. Third is the extensibility. Number 4, we have the elasticity. Okay, elasticity. Okay, so number 1, contractility, that is the ability to shorten with force. Okay, so in case of muscles. And excitability, okay, you study this more concepts in detail in physiology subject. Okay, so the capacity to respond to stimuli which may be neuronal or chemical. Okay, so that is excitability. Okay, then you have extensibility, that means the capacity to regain the normal shape on removal of the stimulus, so that is extensibility. Okay, then we have elasticity, that is the capacity to assume a desired shape regardless of the stretch effect. Okay, so that is elasticity. So talking about the skeletal muscles first. Okay, so skeletal muscles are actually the ones which are the most abundant muscle in the human body. Okay, most abundant muscles in the human body. They are also called striated or somatic or voluntary muscles. Okay, you know that. Skeletal muscles. Okay. So typically, if I talk about the skeletal muscle as a general rule, the skeletal muscle has two ends. Okay, one is the origin, as you can see in this image. For example, any muscle you can take origin, and one is the insertion. Okay, and there are two parts, that is the fleshy part and the fibrous part. Okay, so these are certain parts of the skeletal muscle. So the two ends which I told you, the origin is the end of the muscle that remains fixed during the contraction, and insertion is the end of the muscle which moves during the contraction. So suppose if you're doing a flexion, okay, movement, so there is a muscle end which is actually contracting, okay, and which is bringing about the movement, and origin is relatively fixed. Okay, I will tell you certain things more about the how this nomenclature has changed to attachment now. Okay, I will talk about in a while. And then the two parts which you can see in this image also, one is the fleshy part. Okay, that is basically the belly. Okay, any muscle we're talking about, a belly contractile portion, that is called as belly. Okay, and this is the contractile part. Okay, and the fibrous part, that is non-contractile. Okay, fibrous part is non-contractile and also inelastic. Okay, that includes two structures further. So that was a competency. I told you what is the difference between the tendon and the aponeurosis as per NMC. Again, very important, the difference. Okay, you should understand. So the tendon is nothing but a cord or rope like fibrous part of the muscle. Okay, now you know the fibrous part and fleshy part. So this is the fibrous part. Aponeurosis is a flattened fibrous sheet of the muscle. Okay, so if you want, I can write it down. Tendon, as it is in the competency also. Tendon is a cord or rope like fibrous part of the muscle. Okay, compared to as the aponeurosis, if you remember the upper limb, we talked about the bicipital aponeurosis, which was holding the medial cubital vein also, right, for sampling. So, and tendon, the long head of the long tendons of the biceps brachii, if you remember, short tendons and heads of the biceps brachii. So there are certain tendons, cord like, rope like, and there are numerous tendons in the forearm muscles, which we already discussed multiple times. Aponeurosis is a flattened fibrous sheet. Okay, so this is the difference between the tendon and aponeurosis. So you should know as a NMC competency, okay, competency based education. So this is important to remember. Then you hear a term known as raphe. Okay, we're talking about the skeletal muscles only. Okay, that is why I've put up skeletal muscles on the left side so that you can remember. Okay, I hope you are understanding these things. I am moving a bit slow also, but I need you to understand these basic stuff. Please give me okay or thumbs up or yes if everything is okay and you are understanding a bit of it. Okay, because this is very basic. I don't know it has been covered in your classes or not. Tell me that also in the chat if you can. If you have seen these words and discussions more clear in the class rather than here, so you can tell me that also. It will give me more insight whether I am doing justice to the topic or not. So the raphe means basically, you can see in the image also, I have projected an image also in front. So raphe is a linear fibrous band which is formed by the interdigitation of the muscle fibers. Okay, so there is a you can say fibrous band which is formed, and this is very important, it is a stretchable band of fibrous band. Okay, classical examples of raphe, there are multiple places you will hear this term. Okay, so number one, the linea alba, we will discuss that in the abdomen. Okay, then okay, let me just not write it here. Raphe, it includes examples linea alba. Okay, then we have the pterygomandibular raphe, pterygomandibular raphe, we will discuss in head and neck. Okay, then the mylohyoid raphe, okay, sorry, raphe. Okay, and the pharyngeal raphe, okay, and anococcygeal raphe. Okay, we will discuss these separately in the region wise anatomy. You will hear these words. In this example, you can see this mylohyoid muscle. Okay, you can appreciate in this muscle, in this image, mylohyoid muscle, and you can see the green color structure in the center, that is the median raphe. Okay, median raphe between the two sides mylohyoid actually. Okay, so this is formed by the interdigitation actually. Okay, so this is raphe, a fibrous band formed by the interdigitation of the muscle fibers. Okay, stretchable band you can say. Then any topic is not complete without its clinical integration, as I always do. So there is a clinical integration of this. So that is also an Viva question also, to list the most common sites of intramuscular injections. Okay, so common sites of intramuscular injections. I have made a reel Instagram, okay, on my Instagram ID. I have made a reel also on this. You can see the augmented reality skeleton and the various sites where it is used for the intramuscular injections. And so the fleshy part of the skeletal muscle is commonly utilized by giving intramuscular injections. It is intra, not inter. Okay, so what is the commonest sites? Number one, we have the deltoid muscle. Okay, this is the first example, that is number one. The site of injection is the middle part of the deltoid muscle, we discussed in the upper limb. So that is the outer quadrant of the shoulder region. Okay, then we have the second example, classical example, that is the gluteus maximus. Okay, so upper and outer quadrant of the gluteal region, so that is the site of injection. Okay, so basically there is gluteus medius muscle, which is actually the muscle in which you are injecting the medicine. Okay, and this the deltoid muscle, middle part of deltoid muscle, and then the third site is the vastus lateralis muscle in the thigh region. Okay, we will discuss that in the lower limb. So that is the anterolateral aspect of the middle part of the thigh. Okay, anterolateral aspect of the middle part of thigh. Right, the ID is dr.nikhil.mbbs.md.kgmu. okay, so you can find that and you will be able to see. Okay, so clinical integration point, I hope this is clear to you regarding the common sites of IM injection. Then we talk about the microscopic structure of skeletal muscle, not in too much detail because that will be covered in physiology and histology. in the anatomy region only, but we will discuss a brief about it so that you have some outlook. Okay, so number one, the skeletal muscle is actually consisting of a muscle fiber, as you can see in this image also, cut section, a muscle fiber, and also there is a supporting tissue. Now supporting tissue of the skeletal muscle, it consists of certain important entities. Number one, the endomysium. These are all your viva questions. Okay, endomysium, and then we have perimysium. Okay, and then we have epimysium. Okay, so endomysium, perimysium, and epimysium. Okay, so this is something to remember. I can just type it here only. Okay, so the endomysium, you need to know the difference between these three mysiums because that is important to be asked in the exams. Okay, so endomysium is a layer of the reticular fibers that covers the individual muscle fibers. Okay, that is the endomysium. Okay, endomysium, right? And then we have perimysium. It covers a bundle, or you can say fascicles. That is the perimysium. See in this image only. Okay, so first in the endomysium, which is a layer of reticular fibers, it covers the individual. Suppose this pencil is an individual muscle fiber which is being covering. Okay, so this is an endomysium. Okay, I hope you are understanding these mysiums. Please give me thumbs up or something in the chat. I don't know if you are slept or there. I asked the yes or thumbs up, but most of the people have not replied. Please text because it's a long way through. This topic is quite vast, so I should know if my speed is okay, if everything is fine. The people, all those people who are online, please give me a thumbs up or yes or something to understand whether it's going good for you, because I need to move at this pace, otherwise I will lose track. Okay, so supporting tissue I am talking about. Suppose this is an Apple pencil which is having, this is a muscle fiber, okay, that is having an endomysium covering it. Okay, and then there is a perimysium. Suppose there are multiple Apple pencils, okay, or fascicle of muscle fibers. So the bundle of Apple pencils, the muscle fibers, that is surrounded by a perimysium. And suppose there are multiple bundles of this Apple pencil, and then that is the entire muscle, and which is covered all around, that is by the epimysium. Okay, the outermost covering. So you can see in this image also these three mysiums which are important for viva exam. Okay, so please understand them because otherwise you will forget the basic structure. Okay, and another thing, I told you about the origin and insertion. So if by the external force the insertion end of the muscle is fixed, I told you insertion is the movable part. Okay, but if suppose insertion is fixed, so then the origin end of the muscle will move during the contraction. So this is known as reversal of the muscle action. So there is a recent concept in this. Okay, so remember, let me write here only where it was discussed. Okay, so there is a recent concept about origin and insertion. Okay, we use the word that is the proximal and distal attachment. Okay, the proximal and distal attachments. Okay, proximal and distal attachments. So very important. Instead of the origin and insertion, some books, some authors consider the word like proximal or distal. So in case of limbs, the origin is the proximal attachment and insertion is the distal attachment. So you will see these words which are mentioned in the textbooks, higher textbooks of anatomy, where you will understand these words. Okay. So I hope you have understood this much, the myceliums which I just told you. Okay. Next, to understand this structure further, you should know that muscle fibers, they are basically the contractile parts of the skeletal muscle, right? There is a multinucleated syncytium in case of skeletal muscles. Okay, I told you multinucleated syncytiums. Okay, now what is this? Each muscle fiber, as you saw in the histology also, a histological image, sketch image. So each muscle fiber is cylindrical and it has multiple oval flat nucleus placed at the periphery of the fiber. Okay, and we saw the cytoplasm that shows transverse striations of alternate dark and light bands. Okay, so let me bring you to this image. Have a look regarding the microscopic structure. Okay, so the sarcoplasm or the cytoplasm, it shows transverse striations of alternate dark and light bands due to longitudinally oriented myofibrils. Okay, this all contraction and everything you will study in physiology. Guyton and Guénon, those textbooks offer more detailed explanations. You can go through those. You have to read them basically. This consists of bundles of myofilaments. There are two types. One is a thick or myosin filaments. Okay, I'm telling you the basic things so that you can understand the concepts later in physiology. The thick, or you can say myosin filaments. Thick or myosin filaments. And then we have the thin or actin filaments, actin associated filaments also. Okay, the arrangement of these myofilaments, it gives striated appearance to the muscle fiber, hence it is called as striated muscle. Okay, so have a look at these image, because this kind of image has been asked in NEET PG entrance exam also. Okay, so you should know this basic things. So in a polarized light microscopy, okay, you can see the ultra, this is the ultra structure of the skeletal muscle, and also the sarcomere length in different stages of the muscle contraction. You can see resting stage, contraction stage. Okay, so in a polarized light microscopic image, the muscle fibers, they show dark or anisotropic bands. Okay, so I'm writing the keywords here so that you can recollect later. The dark, or you can say A bands. A is anisotropic band, anisotropic bands. Okay, and light bands, or the I bands. I or light, you can remember. Okay, I and light, dark ka A and A band, so that you don't forget. Okay, which one is which, and that is isotropic band. Okay, the dark band A band and light band isotropic band. So in the center of the I band, now focus on the image. So I told you what is thin filaments, thick filaments, and you know what is I band. There is an A band. So okay, so these are the bands which are present. Okay, so in the center of the I band, have a look at this image. In the center of the I band, in this region, you can see there is a dark Z line. Okay, Z line is present, Z disc you can say, that is the Z disc or Z line. So very important Viva question and theory question. Z disc is present in which band? So that is in the I band. And in the center of the A band, you can see in the center of the A band, there is a narrow lighter zone that is called as H band, or you can say H zone. Okay, a central H band is present, and in the center of this H zone or H band, a central dense M line is present. Okay, so again these are all Viva questions where these M lines and H zone is present. Okay, which band basically. So very important basic things. So if you know this diagram, you can remember. So sarcomere, okay, another important point to consider. The sarcomere, which is written here in this image also, is the structural and functional unit of myofibrils. Okay, structural and functional unit of the myofibrils. Okay, so you can see in this image also this sarcomere. So this sarcomere is lying between the two adjacent Z lines. Okay, and you can see the two Z lines, Z disc basically, Z line or Z disc. Okay, you can see in this image the Z lines. Okay, so between the two Z lines you can appreciate there is a sarcomere, okay, which is having all these important things. So between the two Z lines, it is about 2 to 3 micrometers in length. Okay, so that is the sarcomere. Then talking about the clinical integration of this information which I just told you. Rather than clinical, the correct word for this entity would be medico-legal. Okay, medico-legal importance. That you will study in more detail in forensic medicine. Okay, in your third year. Earlier it was to be in the second year, now it's become in third year. So there is a very important word which you will hear, that is the rigor mortis. I am telling you just a brief about this. Obviously you will study in detail in forensic. So this is nothing but stiffening of the muscles of the body after death. Okay, muscle stiffening after death. Okay, it starts with 2 to 4 hours, okay, after death and lasts for 2 to 4 days. Okay, so it starts within 2 hours or 4 hours immediately after death, and it lasts up to 2 or 4 days, and therefore thereafter it gradually disappears. Very important to remember. Okay, there is a explanation regarding this fact, because that is you will study in forensic, but I'm just telling you here so that you can remember for the examination point of view, because externals they do ask, okay, even the first years. So just remember, for muscle contraction you will study in physiology. For muscle relaxation, the bond between the actin and myosin, this bond should be released, which requires ATP molecules. Okay, so after death there is depletion of ATP obviously, and the muscles they remain in contracted state. So because for muscle relaxation this was required. Okay, and after death there is depletion of ATP molecules, and hence the muscles they remain in contracted state, and ATPs are also required to pump out the calcium ions from the muscle fibers. Okay, and lack of ATPs results in gradual accumulation of calcium in the muscles, and that leads to again muscle contraction. Okay, so what happens after 2 days? The cellular enzymes, the natural decomposition, it breaks down the muscle proteins and causes the release of rigor mortis. Okay, so this is something which you should know about the rigor mortis. Okay, what is it? Okay, then further if we go about, that is regarding the type of skeletal muscle fibers. Okay, so type of skeletal muscle fibers. Okay, I hope till now everything is clear. Please give me thumbs up or okay. So based on the diameter and color, the muscle fibers, they are grouped as type 1 or red fibers. Okay, let me use different colors. The type 1 or red fibers, okay, and the type 2 or white fibers. Okay, so type 1 or red fibers, they are basically slow twitch fibers. Very important, extremely important for examination point of view regarding the twitch fibers. So these are slow twitch fibers, these are fast twitch fibers. You have provided a flow chart, or sorry, a table, so that you can revise later. Okay, so they contract, the type 1, they contract slowly, but their contractions are more sustained. So they are resistant to fatigue. Okay, they are resistant to fatigue. Best example, the postural muscles and the limb muscles. Okay, muscles of the limbs. Then type 2b, or you can say white fibers. So those are thick fibers, or you can say fast glycolytic fibers. These are all your questions which I am typing, okay, which I am marking them, because these are the things which they ask in Viva also and theory also, examples also. Okay, so these type 2 or white fibers, they are high twitch fibers. Okay, so they are fast twitch or high twitch fibers that can generate more force of contraction. So they mostly generate energy from anaerobic glycolysis. Okay, again this has been asked in the exams, and hence they fatigue easily. Okay, so this is easy fatigue. Best example, muscles of the eyeball. Okay, rapid precise movements of the eyeball, fingers. So if you are doing a lot of rapid movements from the eyeball or even from the hands, so when you are looking at a screen, when you are working too much for prolonged hours, you feel fatigue in the eyes. Your hands, if you are typing too much or if you are writing too much, your hands, they feel fatigued. So that is the reason, okay, behind this. So there are, these are the red fibers and white fibers. There are other I would say comparative things in between the two, but these are few things which are more important. You can remember all if you want, but these are the important ones. Okay, and clinical integration for this, let me write here only, the red fibers, they are useful for long distance running. Useful for long distance running. Suppose in marathon runners. Okay, so this is very important. It has been asked in clinical case scenarios also. And if you talk about the white fibers, the white fibers, they are useful for rapid and skillful movements. Rapid and skillful movements. Okay, so this is an important clinical integration for all these two fibers. Okay, clinical integration. Okay, exercise actually improves the aerobic metabolism of the red fibers. Okay, so then we come on to the next thing, that is the fascicular architecture. Okay, fascicular architecture. Now we will go through very quickly because this is very basic things and most of the things have been given in your textbooks also and have been discussed in your classes, maybe in your colleges. Okay, so now there's not too much of technical things. You can go through them again and again. So fascicular architecture means basically the muscles that have varied fascicular arrangements. Okay, so like there is parallel arrangement. Okay, you can see in this image also parallel muscle, quadrilateral muscle. Okay, then there can be convergent. They can be, okay, I will talk about one by one only. Then there can be spiral muscles, cruciate muscles, sphincteric or pennation. Okay, pennate. So these are all your important viva questions. So number one category, that is the parallel muscles. Okay, parallel muscles. Now parallel muscles that include the muscle fascicles, okay, that are parallel to the line of the muscle pull. Okay, so the arrangement provides maximum range of movements. They have smaller number of fibers and hence they produce less force of contraction. Okay, so the parallel fasciculi, they have like arrangements which you can see in this image also, quadrilateral, strap like arrangement, and then fusiform. Okay, strap like tendinous intersections also exist. Quadrilateral muscles like thyroid muscle, pronator quadratus. Okay, you will study all these examples in textbooks and eventually in all the limbs we will discuss. Okay, so that is parallel group of muscles. Okay, in which you can see different examples. Then strap like muscles like rectus abdominis. Okay, you will see in the abdomen rectus abdominis, which will have tendinous intersections just like the same as shown in this sketch. Then fusiform, like if you can remember the biceps brachii, okay, biceps brachii muscle, the digastric belly. So all these are examples of the parallel muscle group. Okay, then we talk about the convergent muscles. Okay, then we have another category, that is the convergent. Okay, so convergent, the muscle fasciculi, they converge at the insertion point. So these are powerful muscles with a limited range of movement. Okay, so the convergent arrangement, like they can be triangular. Okay, so because see in this group you could see the quadrilateral, strap and fusiform earlier in the parallel. So in the convergent, as you can appreciate in the image only, this includes the triangular muscle group. Okay, example, the adductor longus. Okay, fan shaped like the temporalis muscle in the head and neck region. We will focus on that. In the head and neck region, temporalis muscle, we will say how these fibers are arranged, and very importantly, the contraction will cause different movements of the mandible. Okay, then there is a spiral or twisted muscle. Okay, third category, that is the spiral or twisted muscle. Spiral or twisted muscle. Okay, this includes the muscle fasciculi that have twisted arrangement near the muscle insertion. Okay, I told you in the upper limb region, that was the pectoralis major muscle, if you remember, right? Pectoralis major, the muscle which was originating in this chest region, the front muscle which we discussed, and the fibers, they were twisting and inserting onto the humerus. Okay, so that is classical example of the spiral or twisted muscle, that is the pectoralis major. What are the other kind of examples? That includes the trapezius, the latissimus dorsi, the supinator muscle. Okay, so these are all classical examples of the spiral or the twisted muscles. Okay, then we have certain other group of muscles, that includes number 4, that is the cruciate muscles. Okay, cruciate muscles. And yeah, cruciate muscles, that includes the muscle fibers which are arranged in strata which cross each other like a crisscross. Okay, cruciform, if you remember the plus sign, cruciate arrangement in the form of cross, or you can say X like arrangement. Okay, better word will be X like or cross like. Okay, so that is which the muscles which are arranged in strata which cross each other in the form of an X manner. Okay, so classical examples being the sternocleidomastoid, the masseter muscle in this head and neck region, we will discuss all these, and in the lower limb we will discuss adductor magnus muscle. Okay, so these are all classical examples of cruciate muscle. Then we have the sphincteric muscle. Number 5, sphincteric muscle. Okay, the muscle fasciculi, they are arranged around the opening or orifice, okay, and or around the opening or orifice, their contraction closes the opening. Okay, so for classical examples, like in the eye, we have the orbicularis oculi. Okay, around the oral cavity, around the mouth, we have the orbicularis oris. Okay, around the mouth, we have around the eye, so that is around the orbicularis oculi, orbicularis oris. Okay, so similarly we have the pennate muscle groups. Okay, so as you could see in this image only, that is the pennate muscles. So now fasciculi are arranged in oblique manner to the line of the pull, muscle pull. The arrangement resembles like a feather. Very important, you can see this pennate group which resembles like a feather. Okay, feather like arrangement, and hence we termed, the name is, that is pennate. Okay, it has greater force of contraction. The following subtypes which you can see in this image, that is the unipinnate. Okay, which is the first category, unipinnate. So all these fibers are sloping on the side of the tendon along only one. Okay, so it gives one half feather like appearance. Okay, one half feather like appearance. So classical examples being extensor digitorum longus, okay, flexor pollicis longus, okay, peroneus tertius. So these are very classical examples for the unipinnate muscles, which we will discuss in the upper limb and lower limb. Then we have bipinnate, okay, where you can see the muscle fibers arrangement on the single tendon. So tendon is forming the central axis, and the muscle fibers, they are sloping in two sides of the central tendon. So it gives like a simple feather like appearance. So classical example being the rectus femoris in the lower limb, flexor hallucis longus in the upper limb, and dorsal interosseae of the hand as well as the foot. Okay, so that is bipinnates. Then we have a multipinnate, that is, you can see in this image only, multipinnate. And it has a series of bipinnate arrangements. So it has multiple septa that gives origin and another set of septa that gives insertion. Okay, so for classical example, we already discussed this muscle in detail, that is a deltoid. That is a classical example, okay, for multipinnate, often asked in the viva. Circumpinnate, it has a central tendon, which you can see in this image, central tendon, and fibers, they are converging from all the directions onto the tendon. Okay, classical example is tibialis anterior. Okay, please remember tibialis anterior. This is in the lower limb. Okay, this is in the upper limb, deltoid. Okay, these are very important questions, the circumpinnate and deltoid as the multipinnate. Okay, oftenly asked. There are other examples which you can read from the textbooks, but this is the main thing which you should remember. Then we talk about the nomenclature of the muscles. Okay, so nomenclature. Now nomenclature is very important to understand few things. Okay, so nomenclature, the muscles are named according to different things. Okay, so number one, let us understand number one, that is the location. So I'm not writing everything down, just telling you the keywords here. You can listen to me and understand. It's very basic things. Okay, so number one, that is location. Okay, so based on location, you can describe the nomenclature of the muscles like anterior, posterior. Okay, anterior, posterior. Okay, tibialis anterior, tibialis posterior, lateral, medial. Okay, lateral, medial, like vastus lateralis, vastus medialis. Okay, then superior, inferior. Okay, superior rectus of the eyeball muscle, supraspinatus, then inferior rectus of the eyeball, these are all eyeball muscles, infraspinatus in the upper limb. So all these are classical examples where we use the location as the key point. Okay, second thing, which is region. Okay, based on region, you can say the back or dorsal side. Okay, the pectoral region, Okay, the back, latissimus dorsi. Pectoral region, pectoralis major. Then temporal fossa, temporalis muscle. In between the ribs, there is in between the ribs there is intercostal muscles, okay, between the ribs. Then gluteal region, okay, there is different muscles in the gluteal region, gluteus maximus, medius, minimus, okay. Then femoral region, okay, rectus femoris. So you will get a hint from the muscle name only that it is in which region, okay. So that those are very easy muscles, I would say, to remember. Then we have the shapes, which we already discussed. I'm not writing again. The triangular shape, okay. So like there can be triangular shaped muscle like deltoid, which we already discussed. Quadrangular, okay, like quadratus femoris, we will discuss, okay. Rhomboid shape, that is diamond shaped. Rhomboid major, okay, rhomboid minor we discussed, okay. Trapezoid shape, that is example trapezius, okay. Serrated shaped, that is serratus anterior, example. Straight, the shape is straight, so that is rectus abdominis, okay. Then we have slender, okay, that is gracilis, okay. Then we have round or teres. So we discussed teres, that was teres major muscle, for example, okay. Then based on the actions, we have flexor, okay. So flexor action, flexor, extensor, flexor carpi ulnaris, extensor digitorum, okay. Then adductor longus, okay. Abductor pollicis longus. Then supinator, pronator teres, okay. Then elevation, levator scapulae, okay. Depressor anguli oris in the face. Dilator, that is dilator pupillae, muscle in the eye. Constrictor pupillae muscle again in the eye, okay. Then based on the number of heads, okay, or you can say parts, so it can be 2 biceps brachii, 3 triceps brachii, 4 quadriceps femoris, okay. 2 parts, okay, 2 parts, that is digastric muscle, okay, classical example. Then based on attachments, okay, based on attachments, so that is sternocleidomastoid, classical example. Sternocleidomastoid muscle attached to sternum, cleidoclavicle and mastoid process, okay. Then stylohyoid, classical example, attached to styloid process and hyoid bone, okay, classical examples. Then direction of fibers, like straight, that is rectus abdominis, okay. Transverse, that is transverse abdominis. Obliques, that is external oblique abdominis muscles, okay. Then continuing the list further, 7 we have done, 8, that is size. Based on the size, that is big muscle, pectoralis major. Small muscle, pectoralis minor, okay. Long, I'm giving you one example of each to make you understand. Adductor longus. Then short muscle, that is adductor brevis. Then broad muscle, that is latissimus dorsi, okay. So that is something about the size. Then the depth, that includes the superficial, okay, flexor digitorum superficialis. Then deep, that is flexor digitorum profundus, okay. Then external, like external oblique abdomen, again in the abdominal muscle, external oblique. Similarly internal oblique, a muscle in the abdominal region, we will study in detail, okay. So these are certain things which you can remember for the I would say nomenclature of the muscles, okay. So blood supply of the muscles, that is basically you can remember the muscles are very highly vascular to fulfill the need of the metabolic activity, and muscles, they receive neurovascular bundles through the neurovascular hiatus, okay. So the blood vessels, they enter the substance of the muscle and ramify, they split into delicate capillaries in the endomysium, and each muscle fiber, it is accompanied by parallel capillaries, okay. So before I continue further for the nerve supply of the muscle, skeletal muscle, let us think about the clinical. So the clinical integration, okay, what does that include? Number one, the muscle stiffness, okay. So severe exercise, it results in accumulation of lactic acid in the muscles, and that causes muscle stiffness. So this lactic acid is removed by venous blood slowly, and muscle stiffness gets resolved. If you walk long kilometers for at a stretch, trust me, your feet will feel, you know, in the lower limb you will feel muscle stiffness, okay. Akadan si lagegi, okay. Similarly, same things if you're doing with hand, multiple things if you're in a machine, you know, if a person is working in a factory, so there he at the time he will return home, there will be muscle stiffness, okay. Similarly, there is joint stiffness also, but that is separate thing, okay. Then clinical integration, muscle grafting, okay. I am giving you certain important keywords so that you can use in your answers to gain good marks in your viva and theory. You can write in your words if you have understood the thing, you can write anything, okay, based on what you have understood. So muscle grafting, an important part of reconstructive and plastic surgeries. It is prepared as a part of muscle with along with its neurovascular bundle. A very important, graft is incomplete without a neurovascular bundle. So that graft can be used to you know, for any burns. If we discussed yesterday about the burns, so third degree burn, that will always require a muscle graft or some graft, okay, to cover that area of the skin, okay. So depends whatever area has been disturbed. Then we come on to the nerve supply of the muscle, okay. So in nerve supply, there are, again, it's a very vast topic, and for this topic also you will study more details in histology as well as in physiology, okay. So I'm just telling you the brief outlook about this topic. So the muscle fibers, they are supplied by alpha efferent fibers arising from multipolar anterior horn cells of the spinal cord, okay. These are myelinated, okay, you can see myelinated axons. So these are myelinated and large diameter fibers. So now there are certain keywords to remember. One is the motor unit. Motor unit. Okay. Motor unit consists of one anterior horned neuron and all the muscle fibers which are supplied by it. Simple. Okay. Small motor units, they are present in precision acting muscles like muscles of the eyeball, whereas large motor units, you can remember, small motor units, precision muscles of eyeball, okay, precision acting muscles, and then we have the large motor units, okay, which are present in the postural muscles. Okay, and then we have the motor end plate. Motor end plate. Okay, the junction between the muscle fiber and the nerve terminal. Okay, so that is the motor end plate, which you should remember. Okay, again in detail you will study in physiology. The muscle spindles, they are the sensory organs located in the muscle only. Okay, so they are supplied by myelinated gamma efferent fibers that arise from the gamma motor neurons of the anterior horns of the spinal cord only. Okay, so in this image you can see another important entity, that is neuromuscular junction. Okay, neuromuscular junction, that is motor end plate only. So junction complex of the axon terminal, okay, axon terminal and the muscle fiber. Okay, so at the terminal end, as you can see in this image, okay, at the terminal end, axon loses its myelination. So here till here there was myelination. In this region you cannot see any myelination, and this divides into many terminal branches. Each terminal branch expands at its end, where you can see a terminal button has been formed. Okay, I can zoom in. This is a terminal button which is formed here. Okay, and this forms the junctional zone of muscle fiber at the plate. Okay, so that is a part of the sarcolemma only. Okay, so this is the part where you can understand how it is forming. Okay, so terminal button, basically this region, if you see in this image, terminal button, this consists of certain secretory vessels. Okay, so there are certain secretory vessels in this terminal button which contain acetylcholine neurotransmitter, okay, and numerous mitochondria also. Okay, you can see mitochondria as drawn in this image. And the motor end plate, basically it has a number of foldings that contains many receptors for the acetylcholine. Okay, then there are certain synaptic clefts, as you can see in this image, which is narrow gap between the axonal terminal button and the motor end plate. Okay, so this is the synaptic cleft which you can see in this image. Okay, synaptic clefts. And neurotransmitter actually needs to cross the synaptic cleft only. Okay, and acetylcholine esterase is the enzyme that destroys acetylcholine quickly. Okay, so this is something very basic about this neuromuscular junction, which you should remember. You will study everything in more detail in physiology. This is a topic from physiology. Okay, so read in detail. Details in the physiology subject, okay, regarding the same. Talking about the clinical correlation of this information, why I told you this, because there is a very important entity, that is myasthenia gravis. You will read about this in Guyton and Gilong also. It is mentioned separately in detail. Okay, the myasthenia gravis. So what is this? This is an autoimmune disease in which the antibodies are found against the acetylcholine receptors. Okay, so it is an autoimmune disease. Okay, and the antibodies are formed against the acetylcholine receptors. Okay, and the antibodies progressively damage the acetylcholine receptors and muscles. Slowly they become weak. Okay, so they become non-responsive to acetylcholine. So basically the word myasthenia is having two words, myasthenia gravis. Okay, so myasthenia means weakness of the muscle, and gravis means severe or serious. Okay, so there are many neurotoxins. Okay, so there are certain neurotoxins which you will again study in forensic. So many snake venoms, okay, in the snake venoms, sap, okay, snake venoms contain the neurotoxin, the snake venoms, okay, they bind with the acetylcholine receptors, and this can cause paralysis of respiratory muscles and death of an individual, okay. So that is something which you should remember. Then discussing about the nerve supply in a bit, same image is very important from physiology, okay. This image shows something about the muscle spindle. Muscle spindle. Are you guys there or left? Please write something in the chat. You are there or left? I know it is getting over time, but this topic is important, so I cannot skip the important things. It's a lengthy topic indeed, but I need to tell you some important things so that you can read about them, okay. Are you there? Please give me yes or no. I don't have your faces in front of me, okay. So the nerve supply of the skeletal muscle, that includes this kind of an image which you can see, okay. So there are certain things in this image. The structure, okay, that is the muscle actually consists of capsules and sensory neurons and gamma motor neurons and intrafusal muscle fibers, okay. The capsule, that is the muscle spindle, is enclosed within a fusiform connective tissue, okay. Intrafusal muscle fibers, then there is something known as intrafusal the muscle fibers, that includes the intrafusal muscle fibers, okay, and we have the extrafusal muscle fibers. So muscle spindle, it actually has, you can see in this image also, the intrafusal and extrafusal. So the muscle spindle has intrafusal muscle fibers, those are enclosed within the capsule, okay. You can see this is a cut open section for the intrafusal muscle fibers within the capsule, and extrafusal as means that is bahar, okay. Extrafusal fibers, they form the main bulk of the muscle, okay. So that is the difference between the two. So extrafusal, that is forming the main bulk of the muscle, okay, and intrafusal fibers, those are enclosed within the capsule, okay. So I hope you understand this much. Then we have some important entities which are again visible in the same image only. There are two types of intrafusal fibers. Types of intrafusal fibers, okay. Number one, that includes the nuclear bag fibers, okay. Number two, that includes the nuclear chain fibers, okay. So nuclear bag fibers and nuclear chain fibers. So many nuclei are located in the middle of the fiber, that is the nuclear bag fibers, okay. You can see in this image also nuclear bag fibers and nuclear chain fibers labeled, okay. So nuclear chain fibers, the nuclei are arranged in the single row, which you can see in this image also, okay. They are long and extend outside the capsule up to the endomysium of the adjacent extrafusal fibers, okay. So that is again very important, all right. So that's about the different kind of intrafusal fibers which you should know. And functions during muscle contraction, the stretching of the muscle spindle, it stimulates the sensory nerve fibers, okay. Let me use different color, sensory nerve fibers, okay, which is shown in this image also. So that is type 1A and type 2 nerve fibers, okay. All these details you will study in physiology, again I am telling you, okay. These sensory fibers, they provide inputs to the CNS about the muscle stretch and help modulate the activity of the motor neurons supplying the same muscle. Okay, so classically clinical relevant information for this information is this, that is the stretch reflex. Stretch reflex. Again, you will study this more in detail in the textbooks of physiology. So stretch reflex is nothing but a myostatic reflex. It can be elicited by blow upon a muscle tendon. Okay, so suppose if you are doing a biceps jerk, biceps reflex, if you are checking, so that is basically, it can be elicited by blowing using a hammer. You can see this reflex hammer is being used here. This is a reflex hammer, hold in the hand. Okay, this is a kind of instrument which can be elicited by blowing a muscle tendon, and in reflex it induces the muscle contraction. Okay, so if you tap using a hammer on the tendon, the muscle contracts, and the twitching is the thing which you have to see whether it's present or not. It is a very important part of the neuro examination which you will study in the medicine prof. So blow using the hammer on a tendon of the muscle, it actually causes stretching of the muscle spindle that goes through the sensory inputs, stimulates the alpha motor neurons, and finally produces muscle contraction. Suppose example is the biceps jerk. In this image you can see there is a calcaneal tendon reflex which is shown. Okay, calcaneal tendon reflex. The tendoachilles, okay, the Achilles tendon, and you can see in the lower image that is the pathway for a simple reflex. Okay, so that is a pathway for a simple reflex. So this is the most important reflex for maintaining the health of a muscle. Okay, then we look at the lubricating mechanism of the tendons. Okay, so there is something known as synovial bursa. Okay, for the lubrication. So it is nothing but a closed sac of membrane. You can see a lot of bursas in this image. Okay, bursas, green colored bursas you can see. Okay, so a closed sac of membrane containing a thin film of slippery fluid. Okay, so bursa is a word which is derived from the Latin that means purse. Okay, so it's a lubricating device that helps diminish the friction and allows free movements of the muscle tendons. Okay, very important. These occasionally they can communicate within the joint cavity. For example, in this case, if you can see, obviously in the lower limb we will study in detail, like the suprapatellar bursa. Obviously this is the patella bone which is the main station in this image, that is a patella. Okay, so anything above you can see the suprapatellar, then the infrapatellar, below the patella, in front of the patella that is prepatellar. Okay, and then you can see certain subcutaneous and certain deep infrapatellar bursas. So these are very important as they are present where the tendons are rubbing against the bone, cartilage and ligaments or tendons. Hence they are very common in the limbs. Okay, in the limbs you will hear the names bursas. Okay, they are also found very close to the joints where the skin rubs against the underlying bony structures. For example, this prepatellar bursa, classical example. Okay, so the types of bursa can be, the types of bursa number 1, we have the subtendinous bursa. Okay, and then we have the articular bursa. And then we have the subcutaneous bursa. Okay, so subtendinous, they are present between the tendon and the bone or tendon ligament or between two adjacent tendons. Most of the synovial bursae of the limbs belong to this subtendinous type of bursa. Articular, like they are present near the joint. So obviously that is common sense, that is articular around the joints only. Okay, and then for example the bursa in the dens of the axis, transverse ligament of the atlas. Okay, then we have a subcutaneous bursa which is present between the skin and the bony prominences near the joints. For example, this prepatellar bursa, it is also known as housemaid's bursa. We will talk about in lower limb, not here in detail. Housemaid's bursa. Okay, then subcutaneous infrapatellar bursa, this is also known as clergyman's bursa. Okay, so these are different names given to these bursa because they are more useful during those clinical conditions. Okay, like the prepatellar prepatellar bursa, that is housemaid's bursa. And for example, the subcutaneous infrapatellar bursa, that is clergyman's bursa. We will talk in detail in lower limb. Okay. Then we have certain other entities. Those are the synovial sheaths. Okay, synovial sheaths. These are tubular synovial sheaths over the long tendons. Those are also nothing but modified bursa only. Okay, so it prevents the friction of the tendons while passing through the tunnel. Okay, and the clinical integration for this bursa, clinical integration, that is bursitis. Okay, inflammation of the bursa, it can lead to swelling and pain. Okay, so that is something which you should know about the bursa. Okay, then we talk about the next, that is the actions of the muscles. Okay, the actions of the muscles. I will wind up in another 5 to 10 minutes maximum. Okay, on stimulation the muscle contracts and produces movements. Okay, so the movements, the range of the movement, it will depend upon the range of movement will depend upon, number one, the length of fleshy fibers. Okay, number two, we have the number of fibers. Number three, the power or force of contraction. Force of contraction. Okay, so that is something which you should know about the range of movement. Okay, and then regarding the muscle tone. Okay, there is something about the muscle tone. See, all these terms will be very important when you will attend the clinics. Okay, in the medicine prof. So muscle tone, the amount of tension or contraction in a muscle at rest, that is known as muscle tone. Okay, what is the function of muscle tone? Function, that is, it helps in the maintenance of body posture. Okay, and keeping the body straight during sitting or standing. Okay, again, this is okay. Let me just write it here only so that you can recollect later. The muscle tone is actually the amount of tension or contraction. Okay, in a muscle at rest. Okay, so functions I told you, maintenance of the body posture and keeping the body straight during sitting or standing. It is maintained by a set of muscle fibers. Okay, and all the motor units, they are not contracting simultaneously at a given point. They contract to maintain the muscle tone constantly. Okay, so now there can be things like hypotonia. Okay, so the clinical entity which is important with respect to the muscle tone, hypotonia. Okay, this is decreased muscle tone, decreased muscle tone. Okay, and whereas if you compare this with the opposite term, that is hypertonia, that is increased muscle tone. Okay, you will hear this word in various diseases also, okay, regarding the tonicity. So factors affecting the muscle tone can be the neurological conditions, certain disorders, exercise. Okay, even the exercise is also an important factor. Age, with age also the tonicity changes. Physical therapy can improve the tone of the muscles. Okay, so these are certain things which you should remember. Then regarding the muscle actions, okay, regarding the muscle actions, there is something known as excursion of the muscle. Okay, excursion of the muscle. So what is that? So there is a relationship between the tension and length. Tension and length relationship. Okay, now muscle excursion. To see this image is very beautiful and explanatory. The displacement of the myotendinous junction throughout the range of the motion is known as muscle excursion. The tension is the force which is built up within the muscle during muscle contraction. Okay, so suppose if there is a stretching, it builds up tension within the muscle during the muscle contraction. The muscle shortens by 1/2, or you can say 1/3 of its normal resting length, as you can see in this image. Okay, this image you can see the normal resting length. Okay, and in the contracted state it has reduced. Okay, the muscle is shortened. The action of the muscle is strongest when it is slightly stretched. Okay, so in this manner it is stretched, so that will produce, so the remaining part, this is the excursion. Okay, so this is the displacement of the myotendinous junction throughout the range of the motion. So this is an explanation for the excursion. Okay, so there can be different types. Okay, there are different types of muscle contraction. What are those? Number 1, isometric. Number 2, we have isotonic. Number 3, we have concentric. Number 4, we have eccentric. Okay, so isometric, the length of the muscle does not change and tension does not increase. Okay, very important to remember. The length is of the muscle, length of the muscle does not change. Okay, and tension does not increase. Tension does not increase. Okay, for example, holding the hand in outstretched position. Then isotonic contraction, in which the length of the muscle changes, the length of the muscle changes and tension is constant. Tension is constant. Okay, for example, the movement of the fingers and the hands. Okay, then concentric contractions, the length of the muscle decreases, length of the muscle decreases. Okay, whereas the tension is increased. Tension is increased. Okay, for example, most of the movements which are produced by the concentric contractions only, most of the movements in the body. Okay, eccentric, in which the length of the muscle decreases. Okay, and the desired tension is maintained. desired tension is maintained as per desire. Okay, for example, lowering the arm to the side of the body. Okay, so that is as per a desire, we are making the tension. Okay, and the length of the muscle is also decreasing, so that is eccentric. Okay, so these are certain types of muscle contractions which you should know. And then we move to the actions of the muscle, another aspect, that is another thing which you will hear in the questions, that is there is a category which is prime mover or agonist group. Okay, then we have an antagonist group of muscles, okay, or you can say opponents. And then we have third type, that is fixators, which is not shown in this image, fixators. And then we have the fourth type, that is the synergistic muscles. Okay, so what are these? I will explain you, just listen to me, because writing everything is not possible. So these prime movers or agonist, okay, they are the group of muscles which primarily are responsible for producing a specific movement at the joint. Okay, so they are chief or prime muscles. For example, in this example only you can see biceps brachii is a prime mover of flexion at the elbow joint. Okay, so this is the prime mover or agonist. Then we have the antagonist or the opponents. These are the group of muscles that oppose the action of the prime movers. As the name suggests, they undergo controlled relaxation during contraction of the prime movers and help to produce smooth and precise movements. Okay, so simple thing. For example, for the flexion of the elbow joint, okay, if there is any doubt, you can later on refer to that. There are some mistakes in the book which you are mentioning. Okay, so just go through the content which I have told you. Many grammatical mistakes and other mistakes are there in those books. Okay, you can refer to the Gray's Anatomy also for more detailed discussions if you want to read in detail everything. So the antagonist or the opponents, they are the group of muscles those oppose the action of the prime movers. They undergo controlled relaxation during the contraction of the prime movers, and they help to produce smooth and precise movements, which I just told you. For example, for the flexion of the elbow joint, the biceps brachii is the prime mover, triceps brachii is the antagonist. And so these muscles, they have reverse role in extension at the elbow joint. Okay, then we have fixators, or you can say stabilizers. Okay, fixators or stabilizers. So they contract to stabilize the origin of the prime mover. It's not true for this example because that is not happening in this example. But just remember, this is another action of the muscle, that is the stabilizer or the fixator action. These muscles, they contract to stabilize the origin of the prime mover so that it can act efficiently, same as the name suggests. For example, the muscles around the shoulder joint, they stabilize the scapula. Okay, so around the scapula also, so these so that the biceps muscle can contract to produce flexion at the elbow joint effectively. So suppose if you want to produce flexion at this elbow joint, so this shoulder joint and these scapular muscles, these all should be very much stable, okay, fixed. So otherwise this movement will be not proper. Okay, so that is the reason these are known as fixators or stabilizers. It's not drawn in this image, but you can take the same example and understand the other group of muscles. Then we have a special type, that is synergistic muscles. What are these? They are the ones which assist the prime movers in executing the movement. They don't necessarily perform the same action as the prime mover. If a muscle you can say crosses more than one joint, then the synergistic, they prevent an undesired action at the proximal joints. Okay, so suppose if there are two joints and it is not happening in this example, just telling you, suppose if there is a muscle which is going around the two joints, so and there is a specific action which has to be produced, so then they will this synergistic muscles, they will actually prevent the undesired action at the proximal joints so that the distal joints can move properly. Okay, This is true for examples in the wrist and the hand, okay, or the long tendons which are crossing different joints, you know, the wrist joint and the metacarpophalangeal joints, the interphalangeal joints. So those movements are very refined movements. So those are specific examples of these kind of images. Oh, sorry, of these actions. So suppose the long flexors of the fingers, they cross the wrist joint and other joints of the fingers. So while making a fist, okay, the extensors at the wrist, okay, extensors at the wrist, they are preventing the unnecessary flexion by the long flexors at the wrist joint. Here in this example, in this whatever I told you, the extensors of the wrist, those are acting as synergistic muscles, okay, when you are putting this flexion at the wrist joint, okay. So brachioradialis, as in this image you can see, brachioradialis is acting as a synergistic muscle to the biceps brachia to produce flexion at the elbow joint, okay. So that is something which is very easy to understand, okay. Then another concept for the shunt and spurt muscle, because it is important from NMC competency based also, I showed you previously. So take this example, very easy example to remember, again elbow joint only. The spurt muscle, okay, spurt muscle, suppose it is, this origins at a distance from the joint, okay, and inserts near the joint where it acts. It is also the prime mover of that joint. For example, the brachialis muscle in this image, okay, that is a spurt muscle, based on the origin and insertion. Shunt muscle, it's an origin near the joint and insertion is at a distance from the joint where it acts, okay. So it is a synergistic muscle, you can say, for example the brachioradialis in the same example. So very important, regarding the origin and insertion points, that is the difference between the shunt and the spurt muscle. So this is often asked in the vivas, okay, so please remember this. So if you forget, you can just remember one of those and other you can recollect. So I think the best example to remember is the brachioradialis muscle, okay, which was also in the previous group, that was the synergistic muscle, and it is known as shunt muscle, okay. So you can recollect the position of this muscle and you can remember the origin insertion thing, okay. Then we talk about the clinical integration point. So clinical integration of all this, whatever information we discussed, because nothing is complete without any clinical integration. Number one, the poliomyelitis. Poliomyelitis. So it is an infection caused by the poliovirus. This virus enters the body through the oral route, which later enters the nervous tissue and affects the motor neurons of the spinal cord. This polio, or you know, it is eradicated in India, but it may cause permanent lower motor neuron paralysis and muscle weakness, okay. So it was very important to eradicate this disease. Then we have something known as paralysis, okay. General anatomy is everything about the basic terms. Paralysis means loss of voluntary muscle function. It can be due to the damage to brain, spinal cord, or peripheral nerves in the body. Then there is an entity known as upper motor neuron paralysis, okay, upper motor neuron paralysis. It involves the loss of control of the cerebral cortex over the anterior horn cells of the spinal cord. So this can result in spastic paralysis and exaggerated or increased heightened tendon reflexes. You will study this all in different regions in the body, okay. Then there is a thing known as lower motor neuron paralysis, that involves damage to the anterior horn cells. Earlier it was upper level, that was the cerebral cortex. Here it is a lower level, that is the anterior horn cells of the spinal cord itself, or you can say peripheral nerves supplying the muscle. So this will result in flaccid paralysis, okay. So this was having spastic paralysis, this is having flaccid paralysis, okay. And with this was having increased tendon reflexes, okay, exaggerated tendon reflexes. This will have loss of or diminished deep tendon reflexes, okay, the deep tendon reflexes, okay. Then we have the muscle spasm. Number 5, muscle spasm or muscle pull. I think all of you have experienced this in one time or the other. That is painful contraction of the muscle. Okay, it can happen at any place in the body. If you are taking a roll on the bed, you can experience this. It occurs classically in tetanus, in epilepsy, in high temperature fever, and excessive exercise, and there are so many other examples. Okay, then there is a possibility of muscle atrophy, a reduction in the fleshy part of the muscle due to the loss of contractile proteins. So it can occur in used muscles for a very long time, or that is known as disused muscles, I would say, which are the muscles which are not used. So if you will not use your brain, that is disuse atrophy of your brain. Okay, just joking. Okay, so similarly, a muscle which is not used for a very long time, it can lead to disuse atrophy. Okay, so bedridden patients for long months or years, so that they can have no movement at all, that can cause disuse atrophy of the muscles. Okay, then there is a hypertrophy of the muscles. Hypertrophy, an increase in the size of the muscle fibers. It can occur in mechanical stress such as exercise, and there are classical disorders like left ventricular hypertrophy. The myocardial muscles in the left ventricle or atrium, or any kind of atrium or ventricle, they can be hypertrophy. Okay, so classically left ventricular hypertrophy, you will see many cases in your life. Then we have the hyperplasia. Hyperplasia is increase in the number of smooth muscle cells. Okay, so that was hypertrophy, is increase in size. Very important to differentiate between these two. Size, this is increase in number of the smooth muscle cells. Okay, for example, hyperplasia of the myometrium of the uterus during pregnancy, classical example. Okay, then 9th, like there can be a muscle injury, okay, and healing. Okay, so skeletal muscles, they have limited capacity for regeneration, and if a large portion of the muscle is damaged, it can be replaced by connective tissue during healing. Okay, so that is something which you should know about the clinical integration of the muscular system. Okay, so last but not the least, some basic important interesting facts to remember. I have projected only 2 slides for this before I go for thank you slide. Okay, so the total number of muscles in the body is approximately 400. Gluteus maximus is the largest muscle of the body. Sartorius, you will see all these lower limb muscles, is the longest muscle in the body. You will see that. Stapedius is the smallest muscle in the body. Plantaris muscle has the longest tendon, we already saw in the upper limb. Achilles tendon or tendoachilles in the lower limb, it is the largest tendon of the body. It is the most commonly ruptured tendon in the body, most exposed and most strong. You can see largest and strongest, you can say. Okay, so then we have the motor unit, which we discussed. It's a functional contractile unit of the muscle, and examples we already wrote, that extraocular muscles in the eyeball, they have the smallest motor unit, and muscles of the lower limb, the posture, for the posture maintenance, they have the largest motor unit. Then we have red muscle, or which are the slow twitch fibers. I already discussed the difference between the red fibers, white fibers. Out of this, red is more important. As I told you, clinically important, questions have also been asked. Marathon runners, this is the muscle twitch fibers which are well developed. Okay, then the skeletal muscle, it actually has few satellite cells. Okay, you don't need to go into too much detail, just for a orientation. Interesting fact to remember, they can repair small damages to the skeletal muscle, which can have repair. Compared to the cardiac muscle, the the satellite cells are absent, and hence the cardiac muscle cannot regenerate. Again, a very important point. Vestigial muscles of the body, suppose there is a palmaris brevis, which we discussed in the upper limb. Okay, auricle muscles around the ear pinna, we will discuss in head and neck region. Soleus, I told you, is a peripheral heart of the body which helps in the venous return. Suppose the blood has to come from the lower limb to the heart. Okay, so that is a very important thing which happens. We will study in detail in the lower limb section. Muscles used for IM injections, I have already discussed in image also in clinical integration in this class only. There is a concept of hybrid muscles, which we will discuss separately. I will make you write a list of hybrid muscles once we are done with the syllabus. There's a lot of diaphragms in the body, hybrid muscles in the body. There are a lot of things to discuss. You can follow my Telegram channel. I keep on posting such kind of lists also personally. Okay, so there are two different nerves, like the muscle, single muscle is supplied by two different nerves. Okay, suppose for example, we have already discussed the flexor digitorum profundus, FDP muscle. We discussed the medial half, lateral half, supplied by different nerves, median nerve and ulnar nerve. Then similarly the story is in adductor magnus and pectineus, which is in the lower limb, and digastric muscle in the head and neck region. Smooth muscles, they have highest regenerative capacity. Okay, smooth muscles, that is very much present in the entire body. We will discuss that at separate spaces. Then another important fact, most of the muscles, those are supplied by the nerves from their deeper aspect only, except the case in case of sartorius, which we will study in the lower limb thigh region, which is supplied from its superficial aspect. So nerve is supplying from the top only. So that's it about the muscular system. I have tried to cover maximum clinical and maximum keywords which you could understand. Okay, please stick to the notes. Okay, one is the cardiovascular system and one is the lymphatic system. Okay, so you will take them in maximum important questions which will be asked in your exams and viva and theory. Okay, so definitely I will try to cover maximum clinical also, so that you don't miss any important points. So without wasting any time, let's begin. So as per the competency based curriculum, you have to study these points mandatorily. Okay, so we will be discussing about the blood vascular and lymphatic system today. Okay, and also we will discuss about the circulation, pulmonary versus systemic circulation. Most of the things you already know from your biology classes. Okay, 11th 12th. So it's just I can say recapitulation or a new thing which you will just same things we will repeat, and some things we will build upon from the basics. Then differences between the arteries and veins, excellent and very important question. Okay, frequently asked in the exams, and this is again something which is histologically more relevant. Okay, so we will talk about it more in detail in histology. Okay, but I will give you some outline here so that you don't miss your general anatomy part. Then the differences between elastic muscular arteries and arterioles. Then about the portal system. Okay, we will discuss some examples, and the concept of anastomosis and what is collateral circulation with the significance of end arteries. We will discuss what is end arteries, okay, in the last part. And then we will talk about what is meta-arterioles, precapillary sphincters, arteriovenous anastomosis. So these words may seem new to you right now, but trust me, these are all under the competencies. So no matter what, you have to study them. Okay, so it's something which you must know. It's not good to know, it's must know facts. Then we will understand what is the difference between thrombosis, infarction, sorry, spelling is incorrect, infarction and aneurysm. Okay, so we will see the differences between these three entities also. What are those? So okay, so to begin with, let us introduce you to this cardiovascular system. Okay, so cardiovascular system, basically it consists of heart and blood vessels. Okay, cut short basic thing. If I want to show you these structures, we already know everything in 3D is available nowadays. How many people are online? Please give me a thumbs up. Let me see. We have good number who are studying general anatomy side by side. That is also one thing, a task actually, to study everything side by side. Give me a thumbs up to show you are online and you are reading things. So let us put some arteries. The cardiovascular system would include the arteries and veins. So this is the entire system which we are going to discuss about the cardiovascular system basically. Okay, you can see in this image, in this 3D model, you can see a lot of arteries and veins. Okay, very easy thing. If you remember the arteries, veins, most of the places they go hand in hand. Okay, so wherever you will hear a name of the artery, similarly there will be a name of the vein. Okay, so that way things become much easy for you in eventual course of time. So if we talk about this cardiovascular system, so as you all know, if I remove this sternum from here and if I just lower down the number of arteries in this model, okay, so you can see the main thing that is beating here, which is covered in the fibrous pericardium, and then the parietal layer. We will discuss that in thorax in detail. So this is the beating heart which you can see is pumping the blood. Okay, if I just add the veins and remove it layer by layer to keep some important veins in view. So this is the cardiovascular system. Okay, the nutshell basically the central pipeline which is actually coming inside the body. So again, very important. Okay, so the cardiovascular system, if I talk to you in introduction part, this consists of heart and the blood vessels. Okay, blood vessels include the arteries and veins. Okay, the heart actually collects the blood and pumps it into the blood vessels. Okay, this you know from your biology also. Okay, so blood vessels, what are those? Blood vessels are the tubular channels that provide passage for the blood circulation, simply put. Okay, and there are different types of blood vessels, as I told you. Arteries, which carry the blood away from the heart. Okay, veins. So this cardiovascular system actually includes the heart and blood vessels in nutshell. Okay, and if we talk about the blood vessels, these include the arteries. Okay, the arteries are actually carrying the blood away from the heart, simple. Okay, then veins. There are some exceptions, I will talk to you in a while when we will discuss the circulation. Okay, so veins they carry the blood towards the heart. Okay, again that is something which you know, because venous drainage from so many organs that is coming ultimately to the heart only, the superior vena cava, inferior vena cava. We will talk about it in circulation. Okay, then the connecting link, that is the capillaries. Okay, so this capillaries is something which connects the arteries and veins. So it's not that arteries is having some other blood and this blood will never go and unite with the veins blood. It's nothing like that. It's all interconnected. Okay, so this capillaries is the one which is connecting the arteries and veins and acts as a site of metabolic and gaseous exchange. Okay, this connects the artery and veins and also acts an important site of metabolic and gaseous exchange. Okay, so this is about the capillaries, okay, which you should know as a basic thing. So what are the functions of the cardiovascular system? These things are very basic, so you should not miss these topics initially, because later on you will never understand the bigger things once if you don't know the basics. So foundations, like if you build a building, so if you don't know how the bricks are being kept, okay, you will never understand how the building is made. Simple. So it is about your human body which you are understanding. So the functions include Number one, the most important function which you all know, that this cardiovascular system, it helps to carry the blood. Okay. Number two, exchange of nutrients. Exchange of nutrients. Okay. Even the waste products. Okay. And the gases with tissue. So this is variable in different places, different organs. Okay. Number three, the transport of substances. Okay, transport of various substances. If you inject some drug or something, that also transports, okay, to the bloodstream. The tumors can also transport, the cells can transport. Okay. Then the CVS, this actually regulates the blood pressure. Okay. Hypertension, you know those two entities. Number five, it directs the blood flow. Directs the blood flow to tissues. Okay. So that's about the functions of the cardiovascular system. Okay. So as I told you here, the cardiovascular system is actually consisting of some components. So one being the heart, one being the blood vessels, and also the another component which you can add, that is the blood itself. Okay. So these are the three important components, okay, which are there forming the entire cardiovascular system. So we'll talk about them one by one. Okay. So number one, that is about the blood. Okay. So we should know something about the blood to understand about the the composition, because you will see the you will get certain view of complete blood count. Okay. I will tell you in a while. That is blood, number one. So you will get to see clinical integration if I discuss. If you do a CBC, that is complete blood count of your, if you just give your blood sample and get a CBC done, you might have heard of this test. It is commonly done when you have fever or something. So you can check various parameters like hemoglobin level, the level of RBCs, WBCs, platelets. So these are all important things, clinically relevant. Okay. So you should understand the relevance of blood. So blood, what is blood? Actually, it is a specialized body fluid that circulates throughout the heart and blood vessels. Okay. There are certain characteristics which are similar with the connective tissue, because the blood is classified as a specialized connective tissue. So this is a specialized connective tissue. Okay. So there are certain I would say characteristics. What are those? The blood actually contains certain cells. Okay. Those includes the RBCs, the WBCs, the platelets. Then there is extracellular matrix around the cells, that is in the form of plasma. So you will see all these levels in the reports. Okay. Then instead of connective tissue fibers such as collagen, the blood contains soluble proteins like fibrinogen, okay, which actually later gets converted into insoluble fibers like fibrin. Okay. And the blood actually consists of, makes up, I can say, 8% of the total body weight. Okay. So this makes up 8% of total body weight. Okay. So let us discuss the composition. The composition of blood. Okay. So what does it include? So broadly speaking, there is number one, the plasma. Okay. we have something known as plasma. Not the plasma TV I am talking about, okay, it's the plasma, the extracellular matrix. Okay, so this has certain proteins, okay, like albumin, globulin and fibrinogen, okay, and even it has water and minerals. Okay, so you know blood transfusion is done, so in case if there is some element missing, so you can even give only plasma also, plasma infusion. Okay, so there is importance. Blood transfusion is a separate I would say branch nowadays. Okay, so transfusion medicine, that is separate branch, you can specialize in that branch. So that is about the plasma. Number 2, we have the blood cells. Now what are those blood cells? Number 1, we have the erythrocytes. Number 2, we have the WBCs, that is the white blood cells. Okay, and white blood cells includes the neutrophils, okay, the lymphocytes, and monocytes. You will see all these names on the CBC report. I suggest you to see the CBC report once in a while. Okay, eosinophils and basophils. Okay, then we have the platelets. Very important, all of you know in dengue or dengue, whatever you pronounce, there's a reduction in the number of platelets. Okay, so these are certain important cells, clinically relevant. The levels of these will be very important if you will study the medicine prof later on, what all cells are increased in what all disease disorders. So that is all important which you will study eventually through the course of your MBBS. Okay, so let us talk about them one by one in a very brief manner. Okay, so that you know something about it rather than being blank about it. Okay, so if you talk about the composition, okay, so I told you that includes the erythrocytes, that is the RBCs. Okay, now RBCs, you can say these are the disc shaped cells. Okay, disc shaped cells, those are the erythrocytes. I can write here only erythrocytes or RBCs. Okay, that is the red blood cells. These are disc shaped cells and they do not have a nuclei and mitochondria. Okay, so let us see 1-2 points about each. Number 1, the RBCs. Okay, so these are disc shaped cells. Disc shaped cells. Okay, and they do not have nuclei, don't have a nuclei and mitochondria. Very important point for this, you should understand this. Again, you will study more about this in physiology. Okay, and these RBCs, they actually have hemoglobin. Okay, hemoglobin level, you know, we check, they have hemoglobin that actually helps in carrying the oxygen. Okay, so this hemoglobin is the one which helps in carrying oxygen. Okay, then we have number 2 cells, that is the WBCs, that is the white blood cells, or you can say leukocytes. leukocytes, okay, RBCs or erythrocytes. Okay. Now these WBCs or leukocytes, they can be further divided into two categories. Okay, that is very important to understand, and that is asked in your exams also. Number one, that is the granulocytes. Okay. Now granulocytes, they have numerous cytoplasmic granules. Okay, as the name suggests, they have numerous cytoplasmic granules. Okay, for example, there are three examples in this. That is, number one, we have the neutrophils. I will show you images also in a while. Neutrophils, eosinophils, and basophils. Okay, and we have the other category, that is the agranulocytes. Okay, these agranulocytes, as the name suggests, A means there is absent. Okay, so they do not have, or you can say they do not have the cytoplasmic granules. Okay, so what are the classical examples? There are lymphocytes and monocytes. Lymphocytes and monocytes. Okay, simple. I hope now the classification is clear to you. Okay, that what is it, how it is. Okay, and before we begin the discussion about these, you should understand few things, that there are different cells. Okay, I told you, one is the erythrocytes, RBCs, one is the WBCs, and these are actually, all of these cells, the number of these cells are very important clinically. Okay, in certain disorders, certain cells, they specifically increase, and there are certain syndromes in which certain cells increase. Okay, so that will be taught to you during a course of your MBBS. Okay, you will hear them eventually, but right now you should understand granules are small, you can say, fragments which you can see in this. Okay, I will show you in the images, don't worry about granules. Okay, so this is one classification which you should remember for the WBCs, because that is the most confusing part out of all. Okay, I will talk to you about them in a while, or let us actually me just to take it this one. Yeah, so about this we will talk in a while. So talking about the lymphocytes, see, out of these we have certain cells, those are the lymphocytes. Okay, which are very important. So let me write something about them, because that is clinically also relevant, and exams 5 also they ask more about the lymphocytes. So lymphocytes, they can be grouped into further three types based on the presence of CD molecules, that is a cluster of differentiation. Okay, so these can be grouped into three types. Okay, into three types based on the presence of CD, that is cluster of differentiation. Cluster of differentiation molecules, CD molecules. Okay, you will hear them eventually in pathology prof also. Okay, second year. You will study them in detail actually. Okay, right now you just need to know the names and simple basic entities about them. So number one, we have, that is the T cells. T cells are responsible to maintain cell mediated immunity. I will talk about immunity also in the last part. Okay, but right now just remember this, that this are the T cells are responsible for cell mediated immunity. Then there are B cells, which are responsible, or you can say maintain the humoral immunity. I will talk about immunity later, don't worry. Okay, humoral immunity. Okay, so humoral immunity of the secreting antibodies basically. Okay, you can write of secreting antibodies. Okay, then third category we have, that is the natural killer cells, that is abbreviated, famous abbreviation NK cells. Okay, they destroy the antibody bound cells, as the name suggests, killer cells. Okay, so they destroy the antibody bound cells. Okay, and another point to remember, that T cells they mature in thymus. Okay, thymus. And B cells they differentiate in okay, in the bone marrow. Okay, in bone marrow. Okay, and they mature to form the plasma cells. Okay, and they mature to form the plasma cells. That actually plasma cells, they secrete the antibodies. Okay, so we have the name T cells thymus, B cells bone marrow, you can remember. Okay, very easy. I think all of these things are already heard previously also, it's just a recapitulation for some of the students. Okay, yes, okay, I will take care, no, don't worry. Actually I informed, but they did not write it, so don't worry. Okay, so lymphocytes, this is something which you should remember for lymphocytes. Similarly, let us note down some important points for another thing, that is the platelets. Okay, platelets. So what are platelets? Basically they are minute fragments of the cell. Okay, small amount of cytoplasm surrounded by the cell membrane. Okay, so in bone marrow, these platelets, the bone marrow, the megakaryocytes, they give rise to platelets. Okay, so remember another important point, in bone marrow. Okay, in bone marrow, the megakaryocytes, you will see the development of these cells in physiology again. Okay, so all these words will be taught to you there also. Megakaryocytes, they give rise to platelets. Okay. The schedule has already been updated in the application, so please check the application for the schedule. Okay, so there is nothing to miss out anything. If there is any change, it is very much updated in the application, so keep that application with you open. Okay, so megakaryocytes give rise to platelets and they stop bleeding as it is involved in the formation of blood clot. Okay, so platelets ka basic, they help in to stop bleeding okay, because they are involved in formation of blood clot. Again, that details of the blood clot formation and various intrinsic pathway, extrinsic pathway, all these things will be taught to you in pathology, second year of MBBS. Okay, so don't worry of all these details, but you should know basics. Okay, very basics. And this formation of blood clot is at the site of injury. Yeah, I will take up everything, don't worry. I hope you are loving the classes. Please give me some voting in this chat so that I can also get more motivated. If you love all the classes, the text, the notes, the planning of the classes, I will teach you everything. Okay, whatever is missed, I will take everything. Okay, so don't worry. So this is about the basic about the platelets. So if I talk about the functions, okay, so what are the functions of the platelets? Number one, they secrete a serotonin and thromboxane A2, okay, they secrete serotonin and thromboxane A2, okay. This causes vasoconstriction and reduces blood loss, okay, reduces vasoconstriction, okay, it reduces vasoconstriction and reduces blood loss. Okay, very important point. We will again don't have to go into details about this. All these will be covered in physiology or in pathology later on. So whatever I am teaching you right now, stick to that information. Don't dig into too many details. Okay, don't need to bother. Please trust me on this. Okay, it's totally wastage of your time if you go on reading about this right now. Okay, then there is something known as PDGF, that is platelet derived growth factor. Okay, it promotes the growth of cells at the site of injury basically. Okay, so this is nothing but a growth factor. Okay, it's a growth factor. Then number 3, okay, fibrinogen, that is converted to fibrin. Okay, so that is also using the platelets. So fibrinogen converted to fibrin at the site of injury. Okay, so that is something which you should understand in depth about the platelets, its functions, basic things. Okay, then similarly if we talk about the other things, that is the plasma. Okay, then there is something to discuss about plasma. The blood plasma, the component. So the plasma actually constitutes 55% amount of the blood. Okay, so this is 55% amount of the blood. So you can imagine how much important is plasma, and this is nothing but a yellow fluid. Okay, it's a yellow fluid, and it consists of, plasma contains, what does it contain? 91% water, okay, 7% proteins, okay, and 2% other solutes. Okay, so that's about the content. And plasma proteins, which I just wrote, this plasma proteins, it includes the albumin, as I told you initially, albumin, globulin and fibrinogen. Okay, so albumin, basically this albumin, this is mainly produced in liver. Okay, and this maintains the osmotic pressure of the blood. Okay, very important. Helps in the maintenance of osmotic pressure of the blood. Osmotic pressure. Okay, all these things are very basic. You have studied in half of the things in biology only previously. Okay, and then we have the globulins, which are basically the antibodies. Globulin, which is actually the antibodies and the complements. There is a complement system, which again you will study in physiology. Okay, these are mainly the part of immune system. Okay, so this is about the albumin and globulin. And if we discuss about the fibrinogen, the fibrinogen is something that is the clotting factor. Okay, so this is the clotting factor. Again, clotting mechanism you will study in physiology. Okay, so this is something which you should remember for the different kind of structures inside the blood. Okay, now we can go on to this table. Okay, so this table actually shows you important information which you should remember about the neutrophils, basophils, eosinophils. You can see this grain like structure inside all these three. Okay, these all, if we remember, I already told you, granulocytes. And then we have agranulocytes, which are monocytes and lymphocytes, we just discussed. So you can see lack of any grains like structure inside. Okay, so very importantly, if I talk to you about them, the neutrophils, it includes the nucleus. Okay, which is classically important. You will study more in detail on pathology prof. Okay, that is, the nucleus is having 3 to 5 lobes. Okay, this is a MCQ which has been asked. Okay, to identify how the neutrophils look like. The cytoplasm, it shows pink or reddish purple granules. Okay, again an important point. And the basic function of neutrophils is phagocytosis, eating up of the microorganism. Simple. Look at the basophils that have a nucleus which is segmented. Okay, it seems to be in a segments. Okay, and then the cytoplasm is more important for this basophil, that is, it is dark basophilic granules which contain histamine. Okay, so this is the MCQ, because the basic function of basophil is to release histamine and it promotes inflammation. Okay, so these are all you could say immune defense of the body. Okay, which are helping in all these things. Then you have eosinophil, classically, which is asked in the exams, that is the nucleus of the eosinophil, that is bilobed. Okay, please remember this. And again there will be dark eosinophilic granules. So this phagocytizes, that is, it eats up the antigen antibody complexes. Okay, and it induces the allergic reactions and asthma and attacks the parasites. Okay, so this is something about the eosinophil. Classically, which is asked regarding the other thing, that is a kidney shaped nucleus, about the monocytes. That is how you differentiate the monocyte from the rest of them. Okay, bean shaped or kidney shaped, you can say. It again phagocytizes, okay, and differentiates into macrophages. Very important. Okay, so monocytes, they you can say differentiate into later on into the mononuclear phagocytic cells. Those are nothing but macrophages. Okay, then lymphocytes, they have a round nucleus which you can very well appreciate. That is the reason I projected the images. Okay, you can see the PDF later on. I can move it a little bit here. You can see This is a rounded nucleus with thin rim of cytoplasm. Again, very important. Okay, and this has, I told you, discussed already in detail, T lymphocytes, B lymphocytes and NK cells. Okay, so that is something which you should remember about the different cells of the blood. Okay. If we talk about the clinical integration of whatever we have discussed, actually that is endless, but if I talk to you in very brief, the most important clinical integration. Also, please remember, any of the clinical things whatever you discuss have to be relevant. It should not be something rare disorder you write first and then, no, most common disorder first, the most common problem first, and then you can write if you remember the rare things. Okay, so number one important function of the blood as a whole, that is the immunization, or you can say immune function. Okay, immune function, or you can say immunity. Okay, or during vaccination or immunization, I can write it, that would be much better, you will remember later on. Immunization. Okay, so during the immunization or vaccination, if you know, you might have got some or the other vaccine in your body, like COVID vaccine also, they are the inactivated microorganisms or its parts, which is injected or either given orally or either given nasally, okay, into your body. Now what does it happen? It activates the B cells to form mature memory B cells, which remain in dormant phase in the spleen, lymph nodes and other places. We will discuss about the lymphoid organs in a while. So on exposure of the microorganism, like suppose COVID, if you get COVID infection, so on exposure of the microorganism or its antigen, these cells, which are the memory B cells, these cells get activated to form the plasma cells, and they produce antibodies which protect the body through humoral immunity. Okay, so this is some basic concept regarding immunization, vaccination, which you should read about in the textbooks, whatever you have. Okay, then blood can act as a route of spread. Okay, so blood as a route for spread. Now spread of what? Acts, I can say spread of something which is bad or something which is good also. Okay, so I can say route for spread, or I can say it acts as a vehicle, okay, for the spread of microorganisms, okay, various toxins. If you get bitten by a snake or something, the toxins can travel through the blood stream. Okay, cancer cells, etc. There can be endless things which can go inside the blood and can be either beneficial or lost to you. Okay, so that is about the clinical integration of the blood. So talking about the next component of the cardiovascular system, that is the heart. Okay, so heart you have already seen here. I am just showing again. This is the heart. Okay, the second component of the cardiovascular system, again very mesmerizing, intricate machinery. Have a look. If I just remove this epicardial area and if I remove the wall, see this beating heart with its musculature inside. It's very fascinating, this intricate machinery, how it works. We will discuss everything in detail in thoracic region. Okay, when we will take up heart in detail, I will tell you all these structures, what are these, what are the cusps known as, okay, where there are walls, there are some papillary muscles. We will talk about everything in detail. Okay, because that is the beauty of your MBBS syllabus. You have so many things to study, and so that you can become masters of any of the specific area. So that if you want to become a cardiothoracic surgeon later on, you can read so many textbooks mentioning the entire details. You can see the walls which are opening and closing in this. Okay, have a look how the beautifully the walls are opening and closing. Okay, you can see the cuspid walls. Okay, so that is the beautiful machinery which you have inside your body. Okay, similarly there is some interior of the atrium also. This is the atrial region which you can see in this area. This is the atrium. Okay, and you can see how this is the region from where the blood goes from atria to ventricle. Okay, so very beautiful machinery it is, I would say. Okay, you will study in detail and you will understand more things later on. So as you all know, the heart actually is a conical hollow muscular organ enclosed within its layer, that is a pericardium. Okay, it is about the size of a clenched fist of the individual. Okay, so it is just like an individual. If you look for your heart size, that is the size of the clenched fist. Okay, it consists of 4 chambers. I hope all of you know this. That is the right atrium. This will form the basis of the circulation, types of circulation we will discuss in a while. The right atrium, then we have the right ventricle, similarly we have the left atrium, and we have the left ventricle. Okay, and I told you the things which you know from your basic biology classes, that is that the right atrium, it receives the blood from the deoxygenated blood, I would say. Let me show you in 3D only, that will make much more sense to you. If I just remove the skeletal system, okay, if I just add the respiratory system, you can see how this is present. This heart is actually present between the 2 lungs, which you can appreciate, right? Here you can appreciate, and there are certain pulmonary arteries which are going, we will discuss in a while. So have this orientation. So first and foremost, there is something known as right atrium. Okay, I am telling you right now only because we will not repeat that again and again. So I am telling you first hand information. So right atrium, we begin the first station is right atrium. Okay, right atrium, as you can see, is having some connection, that is superior vena cava above and inferior vena cava below. So it receives the deoxygenated blood from the superior and inferior vena cava, and then it transports this blood into the right ventricle. Okay, the right ventricle, right atria से खून गया and then that is entering into the right ventricle. ठीक है, इस ventricle के अंदर घुस गए हम. ठीक है, so that is where the blood goes. Okay, from right atrium to right ventricle, जो मैंने काट के खोला हुआ ऊपर. ठीक है, then right ventricle से blood will pass to the lungs through the pulmonary artery. Now see, there is one opening which you can trace here. Okay, तो इसमें अगर हम देखेंगे, this is the pulmonary trunk which is actually splitting into 2, one in the right side, one in the left side, to the 2 lungs. Okay, so this this goes above, and then after it gets, the blood gets oxygenated in the lungs, then the blood comes in to the this chamber, that is the left atrium. See from the behind, this is the left atrium. Okay, if I just cut it, okay, that will not make better. So just have a look, this is the left atrium. Okay, and can you see these structures which are opening into the left atrium? Okay, so that is, there are 2 above, 2 vessels from above, 2 vessels from below, that is 4 pulmonary veins. Okay, which are actually entering into the left atrium, taking care of the oxygenated blood from the lungs. And then the blood goes from the left atrium, imagine on your body so that you will remember for your life. Okay, this is very basic, you can't skip this information. And then left atrium से जो blood है, that goes into the लेफ्ट वेंट्रिकल, ठीक है, जो इधर पड़ा हुआ है लेफ्ट वेंट्रिकल, इसको लेट मी जस्ट ओपन, कट ओपन, दिस इज द लेफ्ट वेंट्रिकल जिसमें अब हमारा खून आ चुका है, ठीक है, फ्रॉम द लेफ्ट एट्रियम. नाउ लेफ्ट वेंट्रिकल से द ब्लड सप्लाइज टू द एंटायर बॉडी थ्रू द अयोटा. सो हैव अ लुक, यहाँ से हमें अयोटा के अंदर खून भेजना है. सो इसमें खून आ चुका है, ठीक है, एंड देन इट गोज वाया दिस अयोटा. सो इसको हम थोड़ा सा टिल्ट करते हैं, यहाँ पर एक खून इस जो ऊपर बीटिंग सा दिख रहा है वहाँ से खून एंटर किया, एंड देन फाइनली वी गो इन. इसको हटा देते हैं, जस्ट लेट मी मूव. पैपिलरी मसल्स को मैंने हटा दिया है, ओह सॉरी, ठीक है. इसमें एक्चुअली कट ओपन में ना वो चीज़ दिख नहीं रही है. ओके, जस्ट मूविंग इट अ लिटिल बिट 3 डायमेंशनली, थोड़ा सा इधर घुमाते हैं. ऑगमेंटेड रियलिटी में बहुत इजी हो जाता है मूव करना, ठीक है. हैव अ लुक, इसमें जो यहाँ पर ही जो कस्प दिख रहे हैं, दिस इज एक्चुअली एंटरिंग इनटू दिस वेसल, जो कि कौन सी वेसल है, दैट इज द अयोटा, ठीक है, ये री अयोटा. सो असेंडिंग अयोटा पहले होगी, असेंडिंग अयोटा जिसके अंदर खून चला जाएगा, एंड देन असेंडिंग अयोटा से आयोटिक आर्च, दैट इज द आर्च ऑफ अयोटा, और आर्च ऑफ अयोटा इज द मेजर वेसल. तो ये आर्च ऑफ अयोटा एंड फर्दर जो ब्रांचेज है ये सब हम डिस्कस करेंगे ऑन द सेपरेट क्लास वेयर आई विल डिस्कस द मेजर वेसल्स ऑफ द बॉडी. 30 मिनट्स लेंगे, 3D में सारी चीज़ें देख लेंगे पूरी बॉडी की, ताकि बिफोर यू बिगिन द डायसेक्शन इन योर कॉलेजेस एक बेसिक फ्रेमवर्क पता होगा कि पानी कहाँ से आ रहा है. ठीक है, तो नलके में अगर घर में पानी आ रहा है तो पानी कौन सी मोटी पाइपलाइन से आ रहा है तो वो पता चल जाएगा. देन ओनली यू विल अंडरस्टैंड कि ब्रेकियल आर्टरी और इट्स रिलेशंस और वो सब. तो पहले पता तो लगे आया कहाँ से खून, ठीक है, लिम्स में. तो ये हम हेड एंड नेक में हम सब चीज़ डिस्कस करेंगे सेपरेटली इन दैट क्लास, ठीक है. तो अभी हम डिस्कशन को यहीं ख़त्म कर रहे हैं इन द 3D, दैट इज़ रिगार्डिंग द कि कैसे ब्लड फ्लो करता है. आई होप एवरीथिंग इज़ अंडरस्टैंडेबल टू यू. जो मैंने अभी डिस्कस किया, प्लीज़ गिव मी थम्स अप और एनीथिंग बट एवर यू कैन टू शो दैट यू हैव अंडरस्टूड, बिकॉज ये बहुत ज़्यादा ही बेसिक है और मुझे नहीं लगता कि किसी ने तुम्हें 3D में रोटेट करके ये पूरा सर्कुलेशन और चैम्बर्स बताए होंगे. आई डोंट थिंक सो, ठीक है. तो इस तरीके से यू कैन रिमेंबर, जो जैसे मैंने याद किया हुआ है हमेशा के लिए, ठीक है. सो फिर से 2D लाइफ में आ जाते हैं, बिकॉज हमारे एग्ज़ाम्स तो 2D में ही होंगे, 3D में तो हम थोड़ी देर के लिए रह सकते हैं, ठीक है. सो 2D में आते हैं वापस. अब 2D बहुत बोरिंग लगेगा, बट क्या कर सकते हैं, एग्ज़ाम्स में तो 2D में ही, एग्ज़ाम्स में तो आंसर तो 2D में ही लिखना पड़ेगा ना, ठीक है. सो यहाँ पर मैं एक लाइन लिख देता हूँ, डिटेल्स ऑफ द हार्ट will be covered in thorax, ठीक है. thorax एक्सट्रीमिटी में हम इसको डिटेल में डिस्कस करेंगे हार्ट को. तो अभी यहीं पर क्लोज कर देते हैं जितना मैंने बताया. सो हम नेक्स्ट एंटिटी पे आते हैं कार्डियोवैस्कुलर सिस्टम के, दैट इज द ब्लड वेसल्स. ठीक है, ब्लड वेसल्स. अब ब्लड वेसल्स में ब्रॉडली क्लासीफाई अगर हम करें, सो देयर आर आर्टरीज विच आर कैरिंग द ब्लड अवे फ्रॉम द हार्ट, कैपिलरीज विच आर नरिशिंग द टिश्यू, एंड वेन्स विच आर कैरिंग द ब्लड टूवर्ड्स द हार्ट. ठीक है, ये बेसिक इफ यू ऑल नो. सो ब्लड वेसल्स कैन बी क्लासिफाइड इनटू नंबर 1, दैट इज द आर्टरीज. arteries. Okay, so arteries में further we can divide into categories. Okay, जो कि हम भी डिस्कस करेंगे इवेंचुअली वन बाय वन, बट अभी जस्ट एक टू गेट एन ओरिएंटेशन की क्या क्या चीज़ें हम कवर करेंगे. दैट इज द इलास्टिक और द लार्ज आर्टरीज, ठीक है, which are also known as conducting arteries. We will discuss the meaning, don't worry. ठीक है. Then muscular arteries. Muscular arteries which are medium sized or you can say distributing arteries. ठीक है, डिस्ट्रीब्यूटिंग आर्टरीज हम डिस्कस करेंगे इनके बारे में. थर्ड इज द आर्टीरियोल्स. ओके, विच आर इंक्लूडिंग द, अच्छा यहाँ पर मैं लिख देता हूँ पीछे, ताकि जो लोग सिर्फ नोट्स देख के सोच रहे हैं कि हम एग्ज़ाम क्लियर कर जाएंगे, वीडियोस नहीं देखेंगे पूरी पूरी, तो उनके लिए ये टीज़र ठीक है, ताकि उनको याद रहे कि नोट्स के साथ लाइव क्लास या फिर रिकॉर्डेड क्लास भी देखनी है, ठीक है। सो आर्टीरियोल्स में वी हैव फर्दर टू थिंग्स, वन इज द टर्मिनल आर्टीरियोल्स एंड द मेटा आर्टीरियोल्स। हम डिस्कस करेंगे, याद होगा मेटा आर्टीरियोल्स मैंने बोला था एनएमसी कॉम्पिटेंसीज में भी था, सो हम डिस्कस करेंगे ये क्या चीज़ है, ठीक है। सो दिस इज समथिंग अबाउट द फर्स्ट कैटेगरी, दैट इज द आर्टरीज। सेकेंड कैटेगरी ये है हमारे पास, दैट इज द कैपिलरीज, ठीक है। कैपिलरीज के लिए लेट अस यूज अनदर कलर। Second, that is the capillaries. Okay. Now capillaries, they include three types. Number one, continuous capillaries. I will show you the images so that it gets more clear. Fenestrated, or you can say visceral capillaries. Number three, we have sinusoid or sinusoidal. Sinusoidal capillaries, ठीक है। सो दीज आर द कैपिलरीज जो कि आर्टरीज और वेन्स को कनेक्ट करती है, तो मैंने पर्पल में बना दिए ताकि याद रह जाए, ठीक है। देन वी हैव द थर्ड कैटेगरी, दैट इज नंबर 3, जो कि ब्लू से लिखेंगे हम, दैट इज वेन्स, ठीक है। वेन्स में वी हैव फर्दर नंबर 1, दैट इज द वेन्यूल्स, ओके। वेन्यूल्स में इंक्लूडिंग द पोस्ट कैपिलरी वेन्यूल्स, post capillary venules or muscular venules. एक सेकेंड, post capillary venules or the muscular venules. Then we have the small veins, okay. Then we have the medium sized veins, okay, and we have fourth category, that is the large veins, ठीक है। So large veins, small veins, medium sized veins, all these are the further splitting part of the veins which we will discuss eventually, ठीक है। तो इस फ्रेमवर्क में हम डिस्कस करेंगे। अब यही जो चीज़ मैंने डिस्कस करी अभी तक, वी कैन ऑल्सो पुट दिस अप इन अ डिफरेंट फॉर्मेट, ठीक है। क्लासिफिकेशन को हम एक अलग तरीके से भी प्रेजेंट कर सकते हैं, यू शुड नो दैट, दैट इज द फंक्शनल क्लासिफिकेशन, ओके। फंक्शनल क्लासिफिकेशन पूछ लेते हैं कभी कभी वाइवा में, ठीक है। सो यू शुड बी एबल टू नो व्हाट इज, बड़ी बेसिक चीज़ है, ठीक है। नंबर 1, दैट इज द डिस्ट्रीब्यूटिंग वेसल्स, नाम से पता लग रहा है, जो कि खून को डिस्ट्रीब्यूट करेगी, ठीक है। क्लासिकल एग्जाम्पल जो कि सबको समझ में आ ही रहा होगा, दैट इज द आर्टरीज, ठीक है। नंबर 2, वी हैव द रेजिस्टेंस वेसल्स, ओके, रेजिस्टेंस वेसल्स, ठीक है। रेजिस्टेंस वेसल्स में दैट इज अगेन देर आर सर्टन थिंग्स, दैट इज इंक्लूडिंग द आर्टीरियोल्स, ओके, arterioles with the precapillary sphincters. We will discuss about that in a separate image also. Okay, don't worry. Okay. सो व्हाट आर दीज रेजिस्टेंस वेसल्स? रेजिस्टेंस मतलब समझ में आ रहा है? रेजिस्टेंस मतलब कोई चीज़ तुम्हें रेजिस्ट कर रही है. जैसे फॉर एग्जांपल तुम्हें पढ़ने से क्या रोकता है, मुझे नहीं पता. रेजिस्टेंस क्या है मैं बताता हूँ. रेजिस्टेंस है प्रोक्रास्टिनेशन. आज क्यों अटेंड करनी है क्लास, कल अटेंड करेंगे, छोड़ो आज क्या करना है. सर तो पढ़ाते ही रहेंगे, क्लासेस तो चलती ही रहेंगी, हम एक दिन बैठेंगे, एक गोल्डन डे आएगा जब हम बैठेंगे और पढ़ेंगे. ये एक रेजिस्टेंस है जो तुम्हारे सबके अंदर है. ठीक है, सो दैट रेजिस्टेंस शुड नॉट बी देयर. अब रेजिस्टेंस वेसल्स का मतलब क्या हुआ? रेजिस्टेंस वेसल्स विच आर दे आर द मेन सोर्स ऑफ पेरिफेरल रेजिस्टेंस टू ब्लड फ्लो. अगेन ये फिजियोलॉजी का कंसेप्ट है, यू विल डिस्कस दैट मोर इन डिटेल इन फिजियोलॉजी. ठीक है, सो पेरिफेरल रेजिस्टेंस टू ब्लड फ्लो इज देयर ड्यू टू देयर नैरो ल्यूमेन. सो ल्यूमेन कहीं कहीं वेसल्स का कम है, इट प्रोवाइड्स रेजिस्टेंस टू द ब्लड फ्लो, एंड because of this narrow lumen there is resistance, or also around there is a surrounding smooth muscle around the vessel, so that also causes peripheral resistance to the blood flow, and this helps in regulating the diastolic pressure. I hope you know the systolic and diastolic pressure. 120/80 blood pressure होता है. ठीक है, so उसमें diastolic component जो है this is controlled by the resistance vessels, so you should know this very basic thing. ठीक है, then third category, that is the exchange vessels. ठीक है, लेन देन कर रही हैं, exchange vessels. now what are those? that includes, पर्पल से लिख लेते हैं because लेन देन चल रहा है, that is the capillaries. ठीक है, and sinusoids. ठीक है, एंड ऑल्सो प्री कैपिलरी वेन्यूल्स. हम डिस्कस करेंगे सारे वर्ड्स, डोंट वरी. प्री कैपिलरी वेन्यूल्स, वेन्यूल्स आर शॉर्टर वेन्स, वी विल डिस्कस इवेंचुअली. ठीक है, उसके बाद देन वी हैव फोर्थ कैटेगरी, दैट इज द रिजर्वॉयर और कैपेसिटेंस वेसल्स. नाम से पता लग रहा होगा, जो कि रिजर्वायर मतलब कि खून को अपने पास ज़्यादा टाइम के लिए रख रही हैं, दैट इज़ डायलेटेड. ठीक है, सो उसका ल्यूमेन भी देखेंगे हम इवेंचुअली, दैट इज़ लार्जर वेन्यूल्स एंड वेन्स. ठीक है, देन नंबर 5 दैट इज़ द शंट्स. शंट्स मतलब कि बेसिकली कनेक्शंस. okay, shunts is the connections. okay, so that is distributing का मतलब समझते हो? distributing मतलब कि खून डिस्ट्रीब्यूट करके लेके जाना, तो that is supplying, that is arteries. veins क्या कर रही हैं? ड्रेन कर रही हैं. ठीक है, खून को लेके आ रही हैं, तो वो खून दे नहीं रही हैं, वो खाना बांट नहीं रही हैं, वो खाना की प्लेट उठा रही हैं बेसिकली. ठीक है, सो यू कैन रिमेंबर दैट वे. सो शंट्स इज समथिंग that is connection. okay, we will discuss in a while. that is anastomosis. बहुत जगह पे anastomosis पढ़ोगे. ठीक है, which is important. अपर लिम्ब में भी हमने anastomosis डिस्कस किया था डिफरेंट जगह पे. ठीक है, सो ये एक फंक्शनल क्लासिफिकेशन है जो यू शुड रिमेंबर फॉर वाइवा एंड थ्योरी. अगेन हैव अ लुक एट दिस इमेज. ठीक है, जहाँ पे यू कैन सी द डायमीटर्स ऑफ ईच ऑफ दीज कॉरेस्पॉन्डिंग वेसल्स विच आर विजिबल हेयर. सो सबसे पहले हार्ट है, फर्स्ट स्टेशन हार्ट है हमारा यहाँ पे, लास्ट स्टेशन भी हार्ट है. ठीक है, सो पहले यू कैन अप्रिशिएट द फर्स्ट वन, दैट इज द लार्ज और द इलास्टिक आर्टरीज. ठीक है, विच हैव मोर देन 10 mm ऑफ डायमीटर. देन वी हैव मीडियम साइज्ड मस्कुलर आर्टरीज, स्मॉल आर्टरीज. देन फर्दर छोटे हो गए, दैट इज द आर्टीरियोल. और फिर पर्पल कलर से लिखा कनेक्शन हो गया बिटवीन द रेड एंड द ब्लू, कंबाइन करके पर्पल बन गया. सो दैट इज कैपिलरीज, सबसे छोटी छोटी कैपिलरी ब्लड है. देन वी हैव पोस्ट कैपिलरी वेन्यूल्स. नाम समझ में आ रहा होगा, वेन्यूल मतलब और छोटी वेन है, सबसे छोटी वेन है लेकिन कैपिलरी के जस्ट पास में, सो दैट इज पोस्ट कैपिलरी वेन्यूल. ठीक है, देन उसके बाद मस्कुलेचर आ जाएगी उसमें, दैट इज मस्कुलर वेन्यूल। फिर उसके बाद थोड़ी सी बड़ी, दैट इज स्मॉल वेन। फिर उससे थोड़ी सी बड़ी, दैट इज मीडियम साइज वेन। और लास्ट में लार्ज वेन जिसका डायमीटर मोर देन 10 mm है, जैसे लार्ज इलास्टिक आर्टरीज थी वैसे, ठीक है। वी स्टडी द एग्जाम्पल्स ऑल्सो। और फाइनली फिर हार्ट में। सो दिस इज द बेसिक थिंग विच यू शुड अंडरस्टैंड फॉर दिस नोमेनक्लेचर। एटलीस्ट नोमेनक्लेचर क्लियर होना चाहिए कहाँ पे कौन सी चीज़ है, ठीक है। Then have a look at this basic structure of the blood vessels. So blood vessels actually show three basic layers in their transverse section. Okay, so have a look at this image, beautiful image. तरह तरह की images मिल जाएंगे books में, you can find any textbook. And trust me, all these details what I am now going to tell you, these are more important in histology, that is the part of microscopic anatomy, ठीक है। तो अभी हम बहुत ही सुपरफिशियली इस टॉपिक को टच करेंगे, इवेंचुअली जो हम डिस्कस करना शुरू करेंगे द ट्यूनिका एंड ऑल, बट डिटेल में हम जाएंगे इन हिस्टोलॉजी, ठीक है। सो प्लीज़ रिमेंबर, मैं बहुत ज़्यादा डिटेल में नहीं जा रहा हूँ बिकॉज दैट इज़ नॉट द स्कोप ऑफ टुडेज क्लास। वो हिस्टोलॉजी का अलग से क्लास लगेगी, ठीक है। So blood vessels show these three basic layers which you can see, they are marked in this image also. Let me highlight. One is the tunica intima, tunica media and tunica adventitia, ठीक है। So tunica का basic मतलब क्या है? Tunica means tunica is equal to coating, okay, एक कोट पहना हुआ है समझ लो, ठीक है। वो कहाँ पे प्रेजेंट है उसके आगे नाम उस हिसाब से पड़ गया। सो प्रेजेंस एंड थिकनेस ऑफ दीज लेयर्स इट डिपेंड्स अपॉन द साइज एंड टाइप ऑफ द ब्लड वेसल, ठीक है। सो जैसे कि ट्यूनिका इंटिमा है विच यू कैन सी इन दिस इमेज, आई एम जूमिंग इन अ लिटिल बिट। ट्यूनिका इंटिमा को देखते हैं, हैव अ लुक। सो दैट इज द इनर मोस्ट लेयर विच यू कैन सी इन दिस इमेज, ठीक है। इसमें लिख देते हैं, यू कैन रिमेंबर लेटर, दिस इज द innermost layer of the blood vessel. Okay, it consists of the endothelium जो भी हम डिस्कस करेंगे थोड़ा सा डिटेल में, ठीक है। एंड देन सब एंडोथीलियल कनेक्टिव टिश्यू, ठीक है। एंडोथीलियम के जस्ट नीचे, मतलब ऑब्वियसली कट सेक्शन है तो यू कैन इमेजिन 3 डायमेंशनली कैसे दिखेगा ये, ठीक है। एंड देन वी हैव द इंटरनल इलास्टिक लेमाइना, ओके, दैट इज फेनेस्ट्रेटेड इन दिस केस, ओके। फेनेस्ट्रेटेड मतलब कि पंचर्ड है, ठीक है, जगह जगह पे, ठीक है। देयर इज सम स्पेसिस इन बिटवीन, ठीक है। सो दिस इज हैविंग इंटरनल इलास्टिक लेमाइना। सो दीज आर ऑल द लेयर्स फ्रॉम इनसाइड टू आउटवर्ड्स, ठीक है, जो अभी मैंने डिस्कस करी, ओके। इंपॉर्टेंट लेयर्स जो कि डिस्कस करेंगे बाद में भी। अब एंडोथीलियम इज द वन विच एक्चुअली कंसिस्ट ऑफ द एपिथीलियम। सो उसके अंदर फॉर एग्जाम्पल अ ब्लड वेसल की अगर हम बात करें, दैट हैज़ अ सिंपल स्क्वैमस एपिथेलियम, ठीक है। सो इंटरनल इलास्टिक लेमाइना जो यहाँ पर बना हुआ है, फेनेस्ट्रेटेड भी शो कर रहे हैं, इट कंसिस्ट ऑफ मेनी फेनेस्ट्रेटेड इलास्टिक शीट्स एंड दीज फेनेस्ट्रेशंस एक्चुअली परमिट द ट्रांसमिशन ऑफ न्यूट्रिएंट्स टू द आउटर वॉल ऑफ द ब्लड वेसल्स फ्रॉम इट्स ल्यूमेन। तो अगर ये प्रेजेंट नहीं होगा, छेक नहीं होंगे इसके अंदर, तो अंदर से न्यूट्रिएंट कैसे ऑब्जॉर्ब होकर बाहर जाएंगे? ऑब्वियसली वी नीड सम कनेक्शन। सो दिस इज द इंटरनल इलास्टिक लेमाइना, ठीक है, बड़े इंपॉर्टेंट है। देन डिस्कसिंग अबाउट द ट्यूनिका मीडिया, हैव अ लुक। ट्यूनिका मीडिया में क्या क्या चीज़ें आ गई? दैट इज एक्चुअली द मिडल लेयर। पहली चीज, ट्यूनिका मीडिया इज द मिडल लेयर, ठीक है। लेमाइना इज अ लेयर कवरिंग, शीट लाइक कवरिंग, ठीक है। सो मिडल लेयर, अब मिडल लेयर ऑफ ब्लड वेसल इट कंसिस्ट ऑफ कंसेंट्रिक लेयर्स, सर्कुलर लेयर्स और स्पाइरली ओरिएंटेड स्मूथ मसल्स। अब बड़ा इंपॉर्टेंट है, इसमें स्मूथ मसल सेल्स आ जाते हैं यहाँ पर, दैट इज वाई दिस बिकम्स एन एग्जाम्पल ऑफ स्मूथ मसल सेल्स, ठीक है। सो देयर इज स्मूथ मसल्स and it's thicker and it contains more smooth muscles than that of veins, okay. So I can say external elastic lamina, there is something known as external elastic lamina in this tunica media. So comparative अगर हम देखें इन दोनों को, just have a look, यहाँ पर internal elastic lamina है और यहाँ पर external है, तो दो elastic lamina है अलग अलग layers में। तो ये again वाइवा का क्वेश्चन है, ठीक है। So external elastic lamina, it separates the tunica media from the next layer, that is the tunica adventitia. तो स्मूथ मसल सेल्स ऑफ ट्यूनिका मीडिया दे कैन प्रोड्यूस कंट्रैक्शन एंड रिलैक्सेशन अंडर ऑटोनॉमिक न्यूरोनल कंट्रोल, ठीक है, वो हम नर्वस सिस्टम में पढ़ेंगे, ठीक है. देन वी हैव द ट्यूनिका एडवेंटिशिया, दैट इज द लास्ट लेयर विच यू कैन सी हियर, दैट इज दिस इज द आउटर मोस्ट लेयर, ठीक है, ये आउटर मोस्ट लेयर है, एंड कनेक्टिव टिश्यू लेयर ऑफ द ब्लड वेसल्स, ठीक है. सो दिस इज समथिंग विच यू शुड नो अबाउट द different layers of the blood vessels, basic structure. Have a look at this flow chart, ठीक है. I am not writing it, I have projected it because it is, again we will talk about it in detail in histology. तो अभी यहाँ पर जब डिटेल्स नहीं बात करनी है तो we are just telling you an outlook, brief outlook. तो मैंने एक printed flow chart रखा है just to have a revision point of view from this, ठीक है. So have a look, we have talked about the wall of the blood vessel with its 3 different layers, okay, जो हमने अभी डिस्कस करी, and these are the different aspects of them. तो जो अभी मैंने डिस्कस कर ली है that is it, and जो रह गया we will talk in histology, ठीक है. देन हम आ जाते हैं नेक्स्ट चीज़ पे, दैट इज द एंडोथीलियम, ठीक है. अभी एंडोथीलियम ने देखा था कहाँ पे था, ठीक है, सबसे अंदर की साइड पे था एंडोथीलियम. यू कैन सी इन दिस इमेज ऑल्सो एंडोथीलियल सेल्स होंगे, ठीक है. सो एंडोथीलियम इज नथिंग बट अ लाइनिंग एपिथीलियम ऑफ द इंटरनल सरफेस ऑफ द कार्डियोवैस्कुलर सिस्टम, ठीक है. सो इट इज अ लाइनिंग एपिथीलियम of internal surface of cardiovascular system. So okay, so this is something which you should understand about the endothelium कि वो है कहाँ पे basically, ठीक है. अब उसके functions, there are certain functions of endothelium which you should remember. Number 1, that is it provides a smooth surface. So it provides a smooth surface which is non-adherent for flowing the blood columns, ठीक है. blood columns इसके अंदर से जाएंगे. Number 2, it acts as a selective permeability barrier, ठीक है. So that means it allows the movement of selected substances across it through simple diffusion, pinocytosis, receptor mediated endocytosis, ये सब पढ़ा होगा बायोलॉजी में. Transport of substances mainly depends upon its size and the charge, ठीक है. Again that will be discussed in detail in physiology. Number 3, we have again pathology में भी डिस्कस होगा ये, ठीक है. रिलीज ऑफ वॉन विलिब्रेंड फैक्टर, ठीक है. दिस इज नथिंग बट अ प्लाज्मिनोजन एक्टिवेटर इनहिबिटर, ठीक है. अगेन इसकी डिटेल में नहीं जाना है, इट विल बी टॉक टू यू इन पैथोलॉजी, ठीक है. सो अभी मैं नाम लिख के छोड़ रहा हूँ, दैट इज अ वॉन विलिब्रेंड फैक्टर, ठीक है. So in case of damaged endothelium, this would release the von Willebrand factor which induces the platelet aggregation and clot formation, ठीक है. So that is the role of von Willebrand factor. Number 4, release of nitric oxide and prostacyclins. एंड प्रोस्टासाइक्लिन्स, तो ये बेसिकली क्या है, वेजोडायलेटर एजेंट्स हैं, ठीक है, हेल्प इन वेजोडायलेटेशन. नंबर 5, इट हेल्प्स इन रिलीज ऑफ एंडोथेलिन एंड एस एंजाइम, ठीक है. इसके बारे में अगेन फिजियोलॉजी में क्लियरली डिस्कस होगा, दैट इज द एंजियोटेंसिन कन्वर्टिंग एंजाइम. दीज आर वेजोकंस्ट्रिक्टर एजेंट्स. So with the help of vasodilator and vasoconstrictor agents, the endothelium actually controls the blood flow through the vessels. ठीक है. Number 6, that is the hormone synthesis. So it synthesizes and secretes many growth factors such as the colony stimulating factors, the fibroblast growth factors, प्लेटलेट डिराइव्ड ग्रोथ फैक्टर PDGF जो भी हमने डिस्कस किया था लास्ट स्लाइड्स में. ठीक है. नंबर 7, इट कॉजेज द रिलीज ऑफ EDRF. ये सब स्टैंडर्डाइज्ड एब्रीविएशंस हैं, इनको गूगल पे भी सर्च करोगे यू विल गेट अ लॉट ऑफ डिटेल्स. ये सब कुछ पैथोलॉजी में पढ़ाएंगे डिटेल में. रॉबिन्स पैथोलॉजी में एक बुक है, बहुत ही इंपॉर्टेंट है, वो पढ़ोगे शिद्दत से अच्छे से सब समझ में आएगा. So release of EDRF, that is endothelial derived relaxing factor. ठीक है. Again it helps in producing vasodilatation with the help of nitric oxide again. Okay. Then it helps in the last function, synthesis of type 4 collagen fibers. कोलाजन के भी टाइप्स होते हैं, वो बाद में पढ़ोगे हिस्टोलॉजी में अगेन. ठीक है. सो टाइप 4 कोलाजन फाइबर्स जो है दोज आर रिस्पॉन्सिबल फॉर द फॉर्मेशन ऑफ बेसल लेमाइना. ठीक है. यहाँ पर एक बेसल लेमाइना बना हुआ है इस डायग्राम में, इसलिए मैंने प्रोजेक्ट किया हुआ है इसमें. तो बेसल लेमाइना का फॉर्मेशन इज बाय दिस 8th पॉइंट. ठीक है. टाइप 4 कोलाजन फाइबर्स. ओके. सो दिस इज अबाउट द एंडोथेलियम विच यू शुड नो. ठीक है. देन वी कम ऑन टू द आर्टरीज. So arteries basically they carry the blood away from the heart. We already discussed. They are thick walled vessels. ठीक है. They are thick walled vessels. Okay. They have smaller or round lumen as compared to veins. Smaller or you can say round lumen as compared to veins. ठीक है. Very important, they do not have valves. ठीक है. Then there is something important about the न्यूरोवैस्कुलर बंडल. ठीक है. सो न्यूरोवैस्कुलर बंडल that means the arteries along with the accompanying veins and nerves, they form the neurovascular bundle. Okay, which is just something which is formed by the artery. Okay, without artery that neurovascular bundle is incomplete. Okay. So that is about the basic thing about the arteries. So as we discussed previously, there were different nomenclature which we used. Okay, one was the elastic or the large arteries. Okay, I told you one was the elastic or the large arteries. Okay, so that includes multiple layers of vascular smooth muscles, okay, and elastic lamellae in the tunica media. Diameter we already discussed. So what are the classical examples of this elastic or large arteries? The aorta, which we just showed you, pulmonary trunks, okay, the brachiocephalic arteries, the common carotid arteries in the neck region, the subclavian artery which is the main supply to the upper limb, okay, common iliacs which are actually bifurcating into external and internal iliacs, okay, pulmonary artery which I just told you, pulmonary trunks splitting further. So these are all elastic or the large arteries. Okay. Then we have number 2, that is the muscular arteries. Muscular arteries, or you can say medium sized arteries. इन सब का डिटेल्स we will discuss in histology. ठीक है. So it includes, नाम से पता लग रहा है मस्क्यूलर, so that means यहाँ पर मसल्स थोड़ी ज़्यादा होंगी. ठीक है. So more smooth muscles and less elastic lamellae. ठीक है. डायमीटर भी इसका 2 से 10 मिलीमीटर्स होगा. प्रोमिनेंट फीचर ऑफ मस्कुलर आर्टरीज इज द प्रेजेंस ऑफ ग्रेटर नंबर ऑफ स्मूथ मसल्स, इसलिए इसका नाम मस्कुलर आर्टरी है, सिंपल, ठीक है। एंड बिकॉज ऑफ लेस अमाउंट ऑफ इलास्टिक मटेरियल इन ट्यूनिका मीडिया द इंटरनल इलास्टिक लमाइना कैन बी इजिली आइडेंटिफाइड, ठीक है। अब इसका क्लासिकल एग्जाम्पल मस्कुलर आर्टरी का ब्रेकियल आर्टरी, अपर लिम्ब में हमने पढ़ा था ब्रेकियल आर्टरी, ऐसे ही थाइज में फिमोरल आर्टरी, ठीक है, और अदर आर्टरीज, ठीक है। सो इफ़ वी जस्ट नीड टू राइट रिमेंबर एनी फ्यू एग्जाम्पल्स, तो यहाँ पर मैं लिख देता हूँ आयोटा, पल्मोनरी ट्रंक, ठीक है, और भी बहुत सारे एग्जाम्पल्स हैं, ठीक है, बट ये 2 एग्जाम्पल्स याद कर लो मिनिमम, ठीक है। एंड अगर मस्कुलर आर्टरीज की बात करें तो ब्रेकियल आर्टरी, ब्रेकियल आर्टरी और फीमोरल आर्टरी। अगर कुछ मिस आउट हो रहा है तो प्लीज़ रेफर टू द रिकॉर्डिंग्स, ठीक है, बिकॉज अभी बहुत सारी चीज़ें कवर करनी है। सो ब्रेकियल आर्टरी और फीमोरल आर्टरी, ठीक है, कुछ नहीं है, बेसिक सी चीज़ है। इलास्टिक आर्टरी में देयर इज़ मल्टीपल लेयर ऑफ स्मूथ मसल सेल्स एंड इलास्टिक लैमेले, ठीक है, और उसमें इलास्टिक में स्मूथ मसल्स की जो लेयर है दैट इज़ रिलेटिवली लेस, मस्कुलर में स्मूथ मसल्स का कंटेंट ज़्यादा है और इलास्टिक मटेरियल कम है, दैट इज़ द बेसिक्स बिटवीन द टू, ठीक है। सो नाम से ही पता लग रहा है, हिंट मिल रहा है बेसिकली, ठीक है। नंबर 3 दैट इज़ द आर्टीरियोल्स, ठीक है, स्मॉलेस्ट डिविजन्स ऑफ द आर्टरीज, ओके, दे हैव ओनली सिंगल लेयर ऑफ स्मूथ मसल्स एंड डायमीटर इज 10 to 100 माइक्रोमीटर्स, ठीक है। सो हैव अ लुक एट दिस इमेज, ठीक है, ये हिस्टोलॉजिकल इमेजेस हैं, अगेन हम डिटेल में डिस्कस करेंगे तब, ठीक है। यहाँ पर देख सकते हैं, यहाँ पर ट्यूनिका इंटिमा सबसे अंदर की तरफ, ठीक है, ट्यूनिका मीडिया ये पूरी की पूरी, एंड देन ट्यूनिका एक्सटर्ना ये पूरी की पूरी, ठीक है। देन यहाँ पर एक वेवी लाइन के फॉर्म में दिख रहा है, दिस इज द इंटरनल इलास्टिक लमाइना, ठीक है, जो कि इजीली विजिबल है, और यहाँ पर ये न्यूक्लियस दिख रहे हैं, दीज आर द न्यूक्लियस ऑफ द स्मूथ मसल सेल्स, ठीक है। कंपेयर कर लो इसको मीडियम साइज वेन से, तो देखोगे कि यहाँ पर कोलैप्स ल्यूमेन होगा, ठीक है, इतना रिजिड नहीं होगा यहाँ पर, ठीक है। और if you see this, okay, so that's about the basic things about some words which we have discussed, and also as I told you resistance vessels के बारे में बात कर चुके हैं हम लोग, that was helping in the diastolic pressure, ठीक है। there are something known as terminal arterioles, ठीक है। so यहाँ पर एक word था terminal arterioles, टर्मिनल आर्टेरियोल्स हैव डायमीटर लेस देन 50 माइक्रोमीटर, ठीक है। सो दैट इज द टर्मिनल आर्टेरियोल्स, ठीक है, डायमीटर लेस देन 50 माइक्रोमीटर। अच्छा, देन देयर आर सर्टन अदर आर्टेरियोल्स दैट इज द मेटा आर्टेरियोल्स। मेटा आर्टेरियोल्स, अब ये मेटा आर्टेरियोल्स क्या भला है? द स्मूथ मसल्स इन दिस मेटा आर्टेरियोल्स, ये आर्टेरियोल्स ही है बेसिकली, छोटी आर्टरीज हैं, ठीक है। द स्मूथ मसल्स इन द मेटा आर्टेरियोल्स दे आर रिप्लेस्ड बाय डिसकॉन्टिन्यूअस नॉन कॉन्ट्रैक्टाइल सेल्स, ओके। सो दोज आर नोन एज पेरिसाइट्स और रोगेट सेल्स, ठीक है। इसको हम अलग से देख लेते हैं, याद रहेगा स्टार मार्क करके, बिकॉज मेटा आर्टेरियोल्स, मेटा आर्टेरियोल्स, ठीक है, these are in this meta arterioles the smooth muscles replaced by discontinuous non-contractile cells, those are known as the pericytes और रोगेट सेल्स, ठीक है। दिस इज नथिंग बट डिसकॉन्टिन्यूस नॉन कॉन्ट्रैक्टाइल सेल्स, ठीक है। सो डिस्टली the meta arterioles they form the capillary plexuses. ठीक है, so that is something about the meta arterioles. So have a look at this slide. I think most of the things we already know, हमने भी डिस्कस भी किया हुआ पहले, मैंने इंस्टाग्राम पे रील भी बना रखी है इसकी, पेरिफेरल पल्सेशंस ऑफ द बॉडी. अब उसमें नंबर 1 इज द रेडियल, ब्रेकियल, कैरोटिड, डॉर्सालिस पेडिस, पोस्टीरियर टेबल, पॉप्लिटियल. ठीक है, जो कि हम सीक्वेंस में लिखी हुई है मैंने, विच आर ईजिली पैल्पेबल. सबसे आसान पैल्पेबल जो है सबसे ऊपर है, और सबसे मुश्किल पैल्पेशन जिसका है दैट इज़ द लास्ट वन. ठीक है, सो आर्टीरियल पल्सेशन इज़ वेरी इंपॉर्टेंट. ये हम जैसे जैसे रीजन वाइज डिस्कस करेंगे, हम सारी चीज़ें वी विल डिस्कस इन दैट वे. सो रिदमिक एक्सपेंशन and contraction of the arterial walls as the blood is injected from the heart into the arteries, okay, during each heartbeat. Okay, so some arteries can be felt through the skin and they are very important part of clinical examination. ठीक है, तो हम इनका क्या देखेंगे, arteries का presence और absence, pulsations are absent or present, rhythm कैसा है, रेट कैसा है, फास्ट है कि कम है, पल्स में हम रेडियल पल्स में सारे कैरेक्टरिस्टिक्स देखते हैं, स्ट्रेंथ देखते हैं, एम्पलीट्यूड देखते हैं, वी सी सो मेनी स्ट्रक्चर्स, सो मेनी थिंग्स. सो पल्स का पूरा एग्जामिनेशन सिखाया जाएगा मेडिसिन प्रॉफ में डिटेल में. सो देयर आर सो मेनी फैक्टर्स विच यू कैन जस्ट पुट योर फिंगर्स एंड चेक इन द पेशेंट. ठीक है, सो ये साइट्स हैं और जहाँ जहाँ यू विल पैल्पेट दिस आर्टरीज. सो आई थिंक ऑल ऑफ यू ऑलरेडी नो हाफ ऑफ देम. सो इफ़ नॉट वी विल डिस्कस देम रीजन वाइज. ठीक है, सो घबराने की बात नहीं है. देन वी टॉक अबाउट द कैपिलरीज. सो कैपिलरीज में इट्स अ नेटवर्क ऑफ वेसल्स इन द टिश्यू एंड दे आर द साइट्स ऑफ एक्सचेंज ऑफ न्यूट्रिएंट्स. ओके, सो इट कंसिस्ट ऑफ एंडोथीलियम एंड बेसल लेमाइना. एंड इस केस में कैपिलरीज में देयर इज नो ट्यूनिका मीडिया एंड ट्यूनिका एडवेंटिशिया. ओके, वेरी इंपॉर्टेंट, कैपिलरीज नो tunica media and tunica adventitia. हालांकि हम ये डिस्कस बाद में डिटेल में भी करेंगे. ओके, सो इन सर्टन कैपिलरीज द पेरीसाइट्स वो रॉकेट सेल्स जो थे दे आर ऑल्सो प्रेजेंट. ठीक है, वो एक एक्स्ट्रा पॉइंट है, यू कैन रिमेंबर. अब क्लासिफिकेशन 3 कैटेगरीज में हमने इसको डिवाइड कर दिया, 1, 2 एंड 3. ठीक है, सो दिस इज क्लासिफाइड इनटू 3 ग्रुप्स बेस्ड ऑन द कॉन्टिन्यूटी ऑफ द वॉल एंड बेसल लेमाइना. ठीक है, सो नाम से पता रहा है कंटिन्यूअस, यानी कि दीज आर हैविंग कंटिन्यूअस एंडोथेलियल सेल्स एंड बेसल लेमाइना. सो क्लासिकल एग्जांपल्स कंटिन्यूअस कैपिलरीज का दैट इज फाउंड इन द कनेक्टिव टिश्यू. ठीक है, found in the connective tissue, muscles, okay, the skin, lungs. ठीक है, skin, lungs and the central nervous system. ठीक है, so these are certain places where you will find these capillaries, continuous capillaries. फिर होंगी fenestrated, जिसका दूसरा नाम है visceral capillaries. ठीक है, हमने लिखा था पहले भी, fenestrated or visceral capillaries. So these have endothelial cells जिसमें there are numerous circular openings, छेक होंगे. fenestration का literal meaning है aperture और you can say pores. ठीक है, इसमें लिख लेते हैं साइड पे. fenestrated means apertures और pores. ठीक है, सो बेसल लेमाइना लेकिन इस केस में कॉन्टीन्यूअस होता है एंड इट कवर्स द एंटायर कैपिलरी. सो इसको मैं हाईलाइट कर देता हूँ बिकॉज ये पूछा भी जाता है. कॉन्टीन्यूअस बेसल लेमाइना, बेसल लेमाइना फेनेस्ट्रेटेड में भी कंटिन्यूअस होता है, ये भी एक क्वेश्चन है जो पूछते हैं. ठीक है, सो प्लीज़ रिमेंबर. सो अब इसका क्लासिकल एग्जाम्पल ये कहाँ पे मिलेगा, सॉरी, इसका एग्जाम्पल ये मिलेगा हमें रीनल ग्लोमेरुलाई में. ठीक है, पैंक्रियाज, ओके, द एंडोक्राइन ग्लैंड्स, ठीक है, एंड गॉल ब्लैडर okay, intestinal villi, okay, intestinal villi, and न्यूट्रिएंट्स एक्सचेंज नहीं, देखो हर चीज़ का एक्सचेंज न्यूट्रिएंट्स का फंक्शन नहीं है, और भी फंक्शंस हैं, ठीक है, जो हमने बहुत लिस्ट डिस्कस करी थी, सबके अपने अपने फंक्शन हैं। ज़रूरी नहीं है कि सबसे न्यूट्रिएंट्स पास करने, डिपेंड करेगा कहाँ पे क्या चीज़ का रेलेवेंस है, ठीक है। सो देयर आर ऑल्सो डिफरेंट काइंड ऑफ अदर वेज टू एब्जॉर्ब द न्यूट्रिएंट्स। सो जस्ट रिमेंबर दिस, फेनेस्ट्रेट कैपिलरी कहाँ कहाँ प्रेजेंट होगी, इंटेस्टाइनल विलाई, कोरॉइड प्लेक्सस हम पढ़ेंगे वेंट्रिकल्स में, ठीक है, ब्रेन में, and then ciliary processes in the eye, again all these are locations where you find the fenestrated capillaries. फिर last में we have the discontinuous or sinusoidal capillaries. So fenestrated endothelial cells, and they have a very important point to remember, that is the discontinuous, नाम से पता लग रहा है discontinuous basal lamina, ठीक है, यहाँ पर basal lamina भी discontinuous है, please remember this, and this is the question कि इन बाकी दोनों में continuous है, बिकॉज फेनेस्ट्रेशन से दोनों में ही है, ठीक है। सो डिसकॉन्टिन्यूस और साइनोसाइडल कैपिलरीज, सबसे अच्छा एग्जाम्पल द लिवर, ओके, सो द एग्जाम्पल लोकेशन इज द लिवर, ठीक है। इन लिवर द साइनोसाइडल वॉल, इट शोज स्पेसिफिक स्पेशल सेल्स, ओके, लाइक द कफर सेल्स, ओके, कफर सेल्स जो हम डिस्कस करेंगे लिवर में स्पेसिफिकली, अगेन हिस्टोलॉजी का ही पार्ट है ये, ठीक है। दीज आर फेगोसिटिक मैक्रोफेजेस, कफर सेल्स, एंड वी विल डिस्कस अबाउट इटो सेल्स, ITO सेल्स, इटो सेल्स, ठीक है, जो विटामिन ए स्टोरिंग सेल्स भी कहते हैं, ठीक है। सो दीज आर इटो सेल्स। तो ये हो गए डिफरेंट काइंड ऑफ हमारे कैपिलरीज जो कि वी डिस्कस्ड, ठीक है। सो कैपिलरीज का बेसिक काम क्या है बॉडी में, दैट इज द टू सी द ब्लड फ्लो, ओके। सो इसको हम देख लेते हैं, यही सेम चीज़ जो मैंने डिस्कस करी, यू कैन सी इन दिस फॉर्म, इन अ फ्लो चार्ट फॉर्म ऑल्सो टू रिकैप्चुलेट लेटर ऑन, ओके। सो फंक्शंस क्या है कैपिलरीज के, द ब्लड फ्लोज थ्रू द साइनोसॉइड्स इज एक्चुअली स्लगिश, एंड दैट प्रोवाइड्स सफिशिएंट टाइम for the exchange of large molecules between the blood and tissue fluid, okay. So that is the role of sinusoids. Classical example liver है, spleen, lymph nodes, bone marrow, endocrine glands, so okay, like adrenal cortex, hypophysis cerebri, parathyroid gland, carotid bodies. So all of these are present in the locations for the sinusoids, okay, again very important, ठीक है। So साइनोसॉइड्स का एग्जाम्पल लोकेशंस लिख लेते हैं यहाँ पर साइड से, बिकॉज कुछ ऑथर्स कुछ टेक्स्ट बुक्स में देखोगे साइनोसॉइड को एक सेपरेट ग्रुप ऑफ वेसल्स भी मानते हैं, मतलब इतना इंपॉर्टेंट और एक अलग चीज़ है, तो इसको हम अलग से ही लिख लेते हैं, साइनोसॉइड्स के लोकेशंस, ठीक है। दैट इंक्लूड्स लिवर, स्प्लीन, ठीक है, लिम्फ नोड्स, bone marrow, okay, endocrine glands like adrenal cortex, ठीक है, and parathyroid gland, ठीक है, giving the parathormone, okay, parathyroid gland, PT इसे लिख देते हैं, parathyroid gland, ठीक है। even the carotid bodies, okay, physio biochemistry notes, हाँ ठीक है, they will do, no problem, okay, राइट। सो कैपिलरीज का फ्लो चार्ट देख लिया हम सब ने, सेम चीज़ है जो हमने डिस्कस करी, इमेज फॉर्म में ज़्यादा अच्छे से याद रहता है, आई होप, राइट। फिर हम बात करते हैं वेन्स की, ठीक है। अब वेन्स में दे एक्चुअली कैरी द ब्लड टुवर्ड्स द हार्ट, राइट। सो फंक्शंस ऑफ द वेन्स, so they are actually thin walled as compared to the previous vessels, okay, they are thin walled, and they allow the union of capillaries or small veins, and their lumen is actually larger or irregular. You can say larger and irregular lumen than arteries. ठीक है. They again provide unidirectional blood flow. They provide unidirectional blood flow. Okay, and large veins are actually surrounded by dead space. ये हम thorax में डिस्कस करेंगे. ठीक है, ये डेड स्पेस कहाँ पे आती है, क्या इंपॉर्टेंस है इसकी. बिकॉज डेड स्पेस इज द वन विच परमिट्स द लार्ज वेन्स एक्सपेंशन ड्यूरिंग द इंक्रीज वीनस रिटर्न. ठीक है, सो इसलिए उनका ये चीज़ इंपॉर्टेंस हो जाती है वहाँ पे. ठीक है, देन क्लासिफिकेशन या ग्रुप्स अगर हम बात करें, सो नंबर 1 हमने डिस्कस किया था, दैट इज द वेन्स को अगर हम डिवाइड कर रहे हैं, दैट इज इनटू द वेन्यूल्स, नंबर 1. ठीक है, बेस्ड ऑन द साइज ओनली, बेस्ड ऑन द साइज हमने डिवाइड किया है. इसको लिख देते हैं, बेस्ड ऑन द साइज. बेस्ड ऑन द साइज हमने डिवाइड किया था वेन्यूल्स में. वेन्यूल्स में फर्दर वी हैड पोस्ट कैपिलरी वेन्यूल्स. ठीक है, एंड वी हैड द मस्कुलर वेन्यूल्स. ठीक है, सो द पोस्ट कैपिलरी venules, they receive the blood. Venules basically are receiving the blood from the capillaries only, right? We saw in that flow chart if you remember. And डेड स्पेस के बारे में हम डिस्कस करेंगे, डोंट वरी. इन थोरैक्स हम डिस्कस करेंगे. खाली स्पेस है जहाँ पे वो वेन को एंगॉर्ज करने के लिए भगवान ने एक स्पेस दिया है. ठीक है, अगर वो स्पेस नहीं होगी तो वरना वो जब वेन में खून भरेगा तो फिर वो नेबरिंग स्ट्रक्चर को कंप्रेस करेगी, दबेगी वो बाकी आसपास की चीज़ें. ठीक है, तो उसके लिए एक स्पेस दी है. हम साइनसेस डिस्कस करेंगे, ट्रांसफर साइनस, ऑब्लिक साइनस, हम थोरैक्स में तो हम डिस्कस करेंगे, समझ में आएगा. तो वेन्यूल्स में हमने डिवाइड किया था पोस्ट कैपिलरी वेन्यूल्स विच रिसीव द ब्लड फ्रॉम द कैपिलरी. ओके, दे आर लाइन्ड बाय एंडोथेलियम एंड पेरिसाइट्स. मस्कुलर वेन्यूल्स में दे आर अगेन लाइन्ड बाय एंडोथेलियम, बट मस्कुलर में वर्ड मस्कुलर आ गया मतलब कि 1 to 2 लेयर्स ऑफ स्मूथ मसल भी है, एंड दे आर सराउंडेड बाय थिक लेयर ऑफ कनेक्टिव टिश्यू. ठीक है, देन सेकंड कैटेगरी हमारी थी स्मॉल वेन्स. ठीक है, विच ड्रेन द ब्लड फ्रॉम द मस्कुलर वेन्स, वेन्यूल्स, सॉरी मस्कुलर वेन्यूल्स. ठीक है, देन वी हैड द मीडियम साइज्ड वेन्स, and lastly we had the large veins. ठीक है, so the medium sized veins, they accompany the medium sized arteries. Simple. Radial vein, tibial vein, popliteal vein, ये सारे examples हैं medium sized veins के. Large veins, tunica adventitia इसमें thickest होती है. It consists of longitudinally arranged smooth muscle cells. ठीक है, एग्जाम्पल्स है लार्ज वेन्स के, द सुपीरियर वेना कावा, इन्फीरियर वेना कावा हमने देखा था इमेज में भी. ठीक है, मतलब 3D में देखा था हमने. अब हैव अ लुक एट दिस इमेज, जहाँ पर कनेक्शन देख सकते हैं हम लोग बिटवीन द आर्टीरियोल एंड द वेन्यूल. ठीक है, बीच में कैपिलरी का प्लेक्सस है, माया जाल दिख रहा है. ठीक है, अब इस केस में यहाँ पर एक वर्ड आ गया प्री कैपिलरी स्फिंक्टर, जो NMC कॉम्पिटेंसी में भी था इफ यू रिमेंबर. ठीक है, स्फिंक्टर मतलब कोई ऐसी चीज़ जो उसको कंट्रोल करेगा. ठीक है, स्फिंक्टर वेन्स में वॉल्स हाँ कहीं कहीं प्रेजेंट है, कहीं कहीं एब्सेंट है. देयर आर सो मेनी एग्जांपल्स, वो हम डिस्कस करेंगे इवेंचुअली. ठीक है, हिस्टो में डिटेल में पढ़ोगे इसको, सो आई एम नॉट डाइविंग इनटू टू मच इनटू दिस टॉपिक. वॉल्स है कहाँ नहीं है, एवरीथिंग विल बी रीजन वाइज कवर्ड, एंड डिटेल्स में लिस्ट वगैरह एंड एवरीथिंग यू कैन गेट इन द हिस्टोलॉजी बुक्स. ओके, डिफ्योर है हिस्टोलॉजी की स्टैंडर्ड टेक्स्ट बुक, उसको पढ़ सकते हो फॉर द हिस्टोलॉजी क्लासेस. सो यहाँ पर एक आ गया प्री कैपिलरी स्फिंक्टर, यानी कैपिलरी से पहले एक स्फिंक्टर है, यानी कि जो उसको रोक रहा है. सो रिलैक्स जब होगा स्फिंक्टर तो ये खून जो है आगे कैपिलरी प्लेक्सस में चला जाएगा और फैल जाएगा और फिर कनेक्ट कर जाएगा वेन्यूल में, ठीक है। जब ये स्फिंक्टर्स जो हैं क्लोज्ड हो गए, बंद हो गए, सो कंट्रैक्टेड है स्फिंक्टर्स, तो ये ब्लड जो है दैट इज़ नॉट पासिंग टू द कैपिलरी प्लेक्सस, ठीक है। एक थोरोफेयर चैनल तो है बट दैट इज़ नॉट सफिशिएंट, तो एक कैपिलरी प्लेक्सस में जो खून दौड़ रहा है वो नहीं पहुंच पाएगा अगर ये स्फिंक्टर जो है क्लोज हो जाए, ठीक है। सो दैट इज सम बेसिक थिंग विच यू कैन रिमेंबर। फिर आ जाओ इस मेन इंपॉर्टेंट स्लाइड पे जो कि बार बार एग्जाम में पूछी जाती है, द डिफरेंसेस बिटवीन द आर्टरी वर्सेस वेन्स, ठीक है, जो एग्जाम का बड़ा इंपॉर्टेंट क्वेश्चन है। अगेन ग्रॉस का नहीं है, ये आएगा हिस्टोलॉजी में, ठीक है, तो हिस्टोलॉजी में इंपॉर्टेंट आ जाएगा। सो नाम से ही पता लग रहा है आर्टरी वेन, दिस इज थिकर देन द वेन, ठीक है, मोटी सी आर्टरी होगी, ठीक है, आर्टरी, एंड देन वेन जो होगी वो थिन सी बना दोगे, ठीक है, थिन वेन होगी कंपैरेटिवली, कोलैप्स ल्यूमेन होगा, इरेगुलर सा कोलैप्स सा ल्यूमेन होगा, ठीक है, और ओवल सर्कुलर जो ल्यूमेन होगा पेटेंट होगा, दैट इज आर्टरी का ल्यूमेन। इंटरनल एलास्टिक लमाइना हमने बात ऑलरेडी कर ली थी, वेन में एब्सेंट होगा, ठीक है। ट्यूनिका मीडिया इस केस में थिकर होगी वेन्स में, इसमें थिनर होगी। ट्यूनिका एडवेंटिशिया कंसिस्ट ऑफ कनेक्टिव टिश्यू एंड इन दिस केस कंसिस्ट ऑफ लॉन्गिट्यूडनल स्मूथ मसल सेल्स एंड इलास्टिक फाइबर्स, ठीक है, इस तरीके से अरेंज्ड होगा। अगेन हिस्टोलॉजी में डिटेल में पढ़ेंगे, ठीक है, इसके लिए बॉदर मत करो अभी। लेयर्स सारी की सारी वेल डिफाइंड है इस केस में आर्टरी में, लेकिन स्मॉल और मीडियम साइज वेन्स जो हमने डिस्कस किया उसमें जो लेयर्स हैं वेसल्स की दैट इज़ नॉट वेरी क्लियरली एविडेंट, ठीक है। सो एक ये चीज़ है जो याद रख सकते हैं हम लोग। देन द डिफरेंस बिटवीन द कैपिलरीज एंड साइनोसॉइड्स, ठीक है। अब यहाँ पर क्या चीज़ आ गई, कैपिलरीज का साइज छोटा है एज कम्पेयर टू साइनोसॉइड्स। ये सर्कुलर से ल्यूमेन, कैपिलरीज का ल्यूमेन जो है वो सर्कुलर होगा, रेगुलर होगा। ये इरेगुलर साइनोसॉइड्स का जैसे से ल्यूमेन मिलेगा, मैटरनल साइनोसॉइड्स मिलेंगे, एम्ब्रियोलॉजी स्टार्ट होगी, पता लगेगा। मैटरनल साइड पे कुछ स्पेसेस होती है, साइनोसॉइड्स होते हैं, ब्लड फिल्ड स्पेसेस होते हैं जो कि एम्ब्रियोलॉजी में कुछ वीक्स में डेवलपमेंट में देखोगे आफ्टर द इम्प्लांटेशन, प्लेसेंटा में भी देखोगे, ठीक है। देन एंडोथीलियम लाइनिंग होगी यहाँ पर कैपिलरीज में, और यहाँ पर एंडोथीलियल सेल्स होंगे विद फ्यू फेगोसिटिक सेल्स, ठीक है, साइनोसॉइड्स में। बेसल लमाइना इसमें कॉन्टिन्यूस होगा, इसमें डिसकॉन्टिन्यूस होगा, जो हमने लास्ट वैरायटी ऑफ कैपिलरी में डिस्कस किया था। क्लासिकल एग्जाम्पल्स ये हमने ऑलरेडी डिस्कस कर लिए, कहाँ कहाँ प्रेजेंट होंगी कैपिलरीज, और डिफरेंट वैरायटीज़ हैं कैपिलरीज में भी, बट साइनोसॉइड्स जो हैं वो लिवर, स्प्लीन, लिम्फ नोड और बोन मैरो में क्लासिकली मिलेंगे। सो ये क्लासिकल एग्जाम्पल्स ज़रूर याद रखना है, बिकॉज वाइवा में पूछे जाते हैं कि साइनोसॉइडल ऑर्गन्स कौन से हैं, या साइनोसॉइडल स्पेसेस या साइनोसॉइड्स कहाँ कहाँ मिलेंगे। तो हिपैटिक साइनोसॉइड तो कभी मत भूलना, वो लिवर के चैप्टर में डिटेल में पढ़ेंगे हम, ठीक है, ओके। देन दैट इज अबाउट द क्लिनिकल इंटीग्रेशन। सो अभी हम बहुत चीज़ें डिस्कस करी, इस सब में से बड़ा इंपॉर्टेंट क्लिनिकल पॉइंट्स निकल के आते हैं, ठीक है। सो मैं की पॉइंट्स लिख रहा हूँ। नंबर 1 दैट इज द फंक्शन ऑफ इलास्टिक आर्टरीज as a diastolic pump, ठीक है। सो वेंट्रिकुलर सिस्टोल, इसको समझो, ये फिजियोलॉजी में भी डिस्कस होगा। वेंट्रिकुलर सिस्टोल के केस में, यानी कि कंट्रैक्शन के केस में वेंट्रिकल्स का, द इलास्टिक आर्टरीज दे डायलेट टू एक्वायर अ सडन रश ऑफ ब्लड फ्रॉम द एट्रिया, ठीक है, टू एकोमोडेट द ब्लड। अब ड्यूरिंग द वेंट्रिकुलर डायस्टॉल, जब वेंट्रिकल कॉन्ट्रैक्ट करने के बाद जब रिलैक्स करेगा, डायस्टॉल होगा, रिलैक्स करेगा, सो ये जो वेसल्स है दे विल हैव एन इलास्टिक रिकॉइल फीचर, ठीक है, जिसमें दीज आर्टरीज विल पुश द ब्लड इनटू द मीडियम साइज्ड आर्टरीज एंड मेंटेन अ कंटिन्यूअस ब्लड फ्लो। सो इसका मतलब क्या हुआ, इलास्टिक आर्टरीज विल पंप द ब्लड इवन ड्यूरिंग डायस्टॉल ऑफ द वेंट्रिकल्स। अगेन वेरी इंपॉर्टेंट पॉइंट, ठीक है। So elastic arteries are acting as a diastolic pump, ठीक है। Number 2, there is entity which you already know, that is hypertension, ठीक है। So it is sustained diastolic pressure above 90 mm of mercury और sustained systolic pressure above 140 mm of mercury, ठीक है। तो क्लासिकल डिस्क्रिप्शन है, दैट इज 140 above about 140 by 90 मिलीमीटर्स ऑफ मर्क्यूरी से ज़्यादा, ठीक है। इसके डिटेल्स हाइपरटेंशन की मेडिसिन प्रॉफ में पढ़ोगे, ठीक है। 120/80 नॉर्मल मान के चलते हैं, 130 तक हम नॉर्मल मान लेते हैं, ठीक है। सो ये मोस्टली किस में मिलता है? एल्डरली पीपल में, बिकॉज इंक्रीज वैस्कुलर रेजिस्टेंस, एथेरोस्क्लेरोटिक चेंजेस हो जाते हैं, वैस्कुलर स्मूथ मसल्स भी इंक्रीज हो जाते हैं, देन डिक्रीज्ड अमाउंट ऑफ इलास्टिक फाइबर्स, इंक्रीज्ड अमाउंट ऑफ कोलाजन फाइबर्स in the vessel walls, so it affects most commonly the elderly, ठीक है। नंबर 3 we have varicose veins, ठीक है। So these are abnormally dilated veins, especially seen in the veins of lower limb, again in older people because failure of the valves. तो डिक्रीज्ड वैस्कुलर स्मूथ मसल टोन एंड प्रोलॉन्ग्ड स्टैंडिंग, जो लंबे लंबे समय से खड़े रहते हैं, दैट कैन ऑल्सो बी अ प्रॉब्लम, ठीक है। देन वी डिस्कस समथिंग अबाउट द वीनस वॉल्स, जो कि लोग पूछ भी रहे थे, ठीक है, अबाउट द वीनस वॉल्स. So to maintain a unidirectional blood flow towards the heart, veins have walls. Okay, veins above the heart actually they are so these walls are actually helping to maintain the blood flow against the gravity. Okay, and from superficial to deep veins. तो lower limb में हम इसको डिटेल में पढ़ेंगे, वेरिकोज वेन्स और ये सब चीज़ें, ठीक है. एंड सोच के देखो, इमेजिन करो, खून जो है लोअर लिम्ब में तुम पहुंचा तो दोगे आर्टरीज के थ्रू, बट इट नीड्स समथिंग टू ब्रिंग बैक द ब्लड अगेंस्ट द ग्रेविटी टू द हार्ट. सो वेन्स के थ्रू जो वीनस ड्रेनेज मिल रहा है लोअर लिम्ब का, दैट इज एक्सट्रीमली इंपॉर्टेंट, ठीक है. तो उसमें ब्लड फ्लो जो होता है दैट इज वेरी इंपॉर्टेंट. सो वॉल्स नियर द टर्मिनेशन ऑफ इंटरनल जुगुलर वेन नेक में, सबक्लेवियन वेन, ठीक है, यहाँ पर फीमोरल वेन्स थाई में, they prevent the venous blood black flow during increased intrathoracic pressure, जैसे कि इंस्पिरेशन, ठीक है, कफिंग और ड्यूरिंग इंक्रीज्ड इंट्रा एब्डोमिनल प्रेशर जैसे कि डेफिकेशन. सो इन सब केसेस में यू नीड द वॉल्स, वरना ब्लड फ्लो हैम्पर होगा, ठीक है. बट देयर आर सर्टन स्पेसिफिक साइट्स विच यू कैन रिमेंबर. सो देयर आर सर्टन वेन्स विच डू नॉट हैव वॉल्स इन देयर ल्यूमेन. Okay, so remember some veins which do not have walls, veins without walls in lumen. Okay, and then we will discuss veins which do not have muscular tissue in their wall. Okay, so veins without muscular tissue in their walls. ठीक है. तो ये दो कैटेगरीज में हमें वेन्स के नाम याद रखने हैं, ठीक है, विच इज़ इम्पॉर्टेंट. सो यहाँ पर हमारे बड़े सारे एग्जाम्पल्स हैं. नंबर 1 द सुपीरियर वेना कावा एंड इन्फीरियर वेना कावा, ठीक है. देन हिपैटिक वेन्स, पोर्टल वेन्स, hepatic and portal veins, ठीक है. then renal veins, ठीक है. then uterine veins, uterine and ovarian veins, ठीक है. then pulmonary veins and facial veins, ठीक है. We will discuss them region wise, ठीक है, जहाँ जहाँ जो जो important होगी. Then veins without the presence of any muscular tissue in their wall, very important, dural venous sinuses. Head neck में हम separate chapter है जो हम discuss करेंगे. Pial veins, pia matter, ठीक है, brain में ही again. Then retinal veins, ठीक है. Then we have veins of the erectile tissue, veins of erectile tissue in penis. Okay, so of penis, ठीक है. एंड लास्ट में वेन्स ऑफ द स्पॉन्जी बोन. ठीक है. So these are certain things about the venous walls which you should remember. And another important point जो कि again वाइवा का सबसे important question है, इसको लिख लेते हैं अलग से. Various factors which help in venous return. आई में, हाँ, रेटिनल वेन आई में. फैक्टर्स हेल्पिंग इन venous return. Okay, so number 1 we have the Vis-a-Turgo. ठीक है, Vis-a-Turgo effect, that is the forward push of blood from behind by the blood pumped by the heart. ठीक है, सिंपल. इसके बारे में डिटेल में हम पढ़ेंगे लोअर लिम्ब में, सो घबराने की ज़रूरत नहीं है, बहुत जगह पे हम पढ़ेंगे Vis-a-Turgo इफेक्ट. ठीक है. देन नेगेटिव इंट्रा thoracic pressure. ठीक है. So the blood is sucked into the heart from all the major veins of the body due to this. Okay. Number 3 we have gravity. Gravity helps in the venous return from the upper part of the body. Okay, simple. Number 4 muscle contractions. So this helps to press the veins passing deep or through the substance of the muscles. So it again will help in the venous return only. So example, very important example in fact, that is the contraction of the calf muscle, soleus. Okay, it helps in the venous return from the lower limb, and that is why it is known as, soleus is known as the peripheral heart. ठीक है, तो 2 हार्ट बता दिए मैंने आज. ठीक है, एक मेन हार्ट और एक पेरिफेरल हार्ट जो लोअर लिम्ब में. नंबर 5 द आर्टीरियल पल्सेशंस. ये सब वाई में पूछे जाते हैं, सो प्लीज़ अंडरस्टैंड देम एंड रिमेंबर पॉइंट वाइज. ठीक है, अपने शब्दों में एक्सप्लेन कर सकते हो. Arterial pulsations, so most of the veins they are accompanied by the arteries. Okay, so these arterial pulsations they drive the venous blood towards the heart basically. Okay, then the 6th point which we have already discussed, that is the venous valves. So they prevent the backflow of the blood and maintain unidirectional blood flow. ठीक है, simple. So इस veins का जो हमने valves वगैरह वाला point discuss किया, इन सब का clinical integration क्या हुआ? Clinical. So number 1 there are certain sites of venipuncture. अब ये क्या चीज़ है? वेन को पंक्चर किया, मतलब वेन को हमने काट के ओपन किया. सो इट कैन बी डन फॉर कलेक्शन ऑफ ब्लड सैंपल्स. सुपरफिशियल वेन्स नॉर्मली हम टैप करके कॉमनली यूज़ कर सकते हैं फॉर वेनिपंक्चर. हम वेन से ग्राफ्टिंग भी करते हैं. ठीक है, इन द लोअर लिम्ब, वो हम लोअर लिम्ब में डिस्कस करेंगे. देन वेरी इंपॉर्टेंट एंटिटी जो कि बहुत सारे केसेस देखोगे वार्ड्स में, सर्जरी प्रॉफ में, वेरिकोज वेन्स. हम लोअर लिम्ब में अच्छे से डिस्कस करेंगे इस टॉपिक को. दीज आर डायलेटेड टॉर्चुअस वेन्स. सो कंटिन्यूस स्टैंडिंग फॉर लॉन्ग पीरियड में इंड्यूस वेरिकोज वेन्स विच इज कॉज्ड बाय अगेन वीकनिंग ऑफ दीज वीनस वॉल्स ओनली, वीकनेस ऑफ वॉल्स ऑफ द वेन्स. ठीक है, सो इट रिजल्ट्स इन पूलिंग ऑफ द ब्लड इन द वेन्स. वेन्स में खून फूली जाएंगी वेन्स. ठीक है, सो इट कैन अकर कॉमनली इन द वेन्स ऑफ द लोअर लिम्ब, स्पेशली स्पीकिंग द ग्रेट सेफिनस वेन. ठीक है, बड़ी इंपॉर्टेंट है, हम लोअर लिम्ब में अच्छे से डिस्कस करेंगे. इट कैन ऑल्सो अकर इन द लोअर एंड ऑफ द ईसोफेगस और इन द एनल कैनाल ऑल्सो. ठीक है, सो ये एक चीज़ है जो कि यू शुड रिमेंबर. ओके, देन हम आ जाते हैं नेक्स्ट टॉपिक पे, दैट इज द एनास्टमोसिस. ठीक है। एनास्टेमोसिस का मतलब है बेसिकली लिटरल मीनिंग है कम्युनिकेशन बिटवीन द नेबरिंग वेसल्स थ्रू अ कोलैटरल चैनल। ठीक है, ये वर्ड्स आए थे एनएमसी की लाइंस में इफ़ यू रिमेंबर। एनास्टेमोसिस कोलैटरल, कोलैटरल मतलब कि साइड पे, साइड वाले, साइडवेज, मतलब अगर तुम्हें एक जगह से दूसरी जगह जाना है, एक सिंपल रास्ता है, लेकिन देयर इज़ अ कोलैटरल चैनल, एक और रास्ता भी है जाने का। ठीक है, वो अगर तुम्हें रास्ता ब्लॉक दिख रहा है तो तुम दूसरे साइड से जा सकते हो अपने डेस्टिनेशन में पहुंचने के लिए। सो दैट इज़ कोलैटरल्स। ठीक है, सो और पिक्चर भी देखोगे, कुछ पिक्चर्स में भी दिखाया है कोलैटरल डैमेज, मतलब कि पिक्चर का नाम भी है शायद कोलैटरल डैमेज, मतलब कि जो मेन टारगेट पे हमें बॉम्ब ब्लास्ट करना था, लेकिन उसके साथ वाले एरियाज में भी धूल मिट्टी उड़ी और बॉम्ब ब्लास्ट के इफेक्ट्स आ गए। सो दैट इज कोलैटरल डैमेज। ठीक है, हाँ दैट इज ट्रू, यू आर राइट। पुलिसमैन्स में भी होता है ये, हम वेरिकोज वेन सेपरेटली डिस्कस करेंगे लोअर लिम्ब में अच्छे से डिटेल में, क्योंकि बहुत इंपॉर्टेंट है। ठीक है, सो एनास अभी तो बस ये बताओ कि है क्या। वेरिकोज वेन भी एक चिड़िया का नाम है, बस अभी तो यही पता करना है फिलहाल के लिए। ठीक है, एग्जाम्स के लिए फिलहाल अभी तुमसे कोई एक्सपेक्ट नहीं करेगा कि तुम्हें ए टू जेड पूरा पता हो। ठीक है, सो एनास्टेमोसिस का मतलब समझ में आया। सो देयर आर 3 टाइप्स ऑफ एनास्टेमोसिस। ठीक है, नंबर 1, arterial anastomosis, then venous anastomosis, and then arteriovenous. arteriovenous। ठीक है, अब आर्टीरियल एनास्टोमोसिस नाम से पता लग रहा है बिटवीन कम्युनिकेशन बिटवीन द 2 आर्टरीज। अब ये एक्चुअली में जो हो सकता है पोटेंशियल या एक्चुअल एनास्टोमोसिस भी कहते हैं इसे। सो आर्टीरियल एनास्टोमोसिस फर्दर हम डिवाइड कर सकते हैं। आर्टीरियल एनास्टोमोसिस कैन बी फर्दर 2 टाइप्स, दैट इज द एक्चुअल एंड देन देयर इज अ पोटेंशियल आर्टीरियल एनास्टोमोसिस। ठीक है, सो इसको स्प्लिट कर लेते हैं इंटू 2। आर्टीरियल को 2 में डिवाइड किया, एक्चुअल एंड पोटेंशियल। ठीक है, एक्चुअल में भी फर्दर 2 टाइप्स हैं। नंबर 1 दैट इज द एंड टू एंड एनास्टोमोसिस और दूसरा है कन्वर्जेंट एनास्टोमोसिस। ठीक है, ओके, एंड टू एंड मतलब आर्टरीज एंड टू एंड आपस में कनेक्टेड है। सो दैट मीन्स पामर आर्चेस हमने डिस्कस किया था अपर लिम्ब में, सिमिलरली पैर में प्लांटर आर्चेस, सर्कल ऑफ विलिस हम ब्रेन में पढ़ेंगे अच्छे से डिटेल में। ठीक है, सो वहाँ पर एंड टू एंड एनास्टोमोसिस हो रहा है। ठीक है, लेबियल ब्रांचेस ऑफ द फेशियल आर्टरी। ठीक है, यहाँ पर भी एंड टू एंड एनास्टोमोसिस है, बहुत जगह हम पढ़ेंगे एनास्टोमोसिस, सब जगह है बहुत जगह, लेकिन दैट इज वेरी इंपॉर्टेंट ऑल्सो। ओके, देन कन्वर्जेंट एनास्टोमोसिस, दैट मीन्स 2 आर्टरीज दे जॉइन टू फॉर्म अ लार्जर आर्टरी। ठीक है, फॉर एग्जाम्पल द वर्टिब्रल आर्टरीज दे जॉइन टू फॉर्म अ लार्जर बेसिलर आर्टरी। ठीक है, हम यहाँ पर देख सकते हैं, इफ यू नोटिस दिस, इसको हम हटाएं, सिस्टम में जाते हैं, जस्ट हैव अ लुक, इसको हम यहाँ पर आर्टीरियल सिस्टम, सॉरी यहाँ पर जो हमारी आर्टरीज थी, मेजर आर्टरीज जो मोटी मोटी हैं उनकी हम बात कर रहे हैं। सो यहाँ पर ये जो आर्टरी जा रही है दैट इज़ द वर्टिब्रल आर्टरी। ठीक है, वर्टिब्रल आर्टरी को हम अंदर जाके स्कल के अंदर घुस जाते हैं। सो देखेंगे यहाँ पर जो आर्टरीज है दोनों साइड की, लेफ्ट और राइट वर्टिब्रल आर्टरीज ने यूनाइट कर दिया टू फॉर्म द, देखोगे यहाँ पर क्या हुआ, ये एक साइड की वर्टिब्रल आर्टरी दूसरी साइड की दोनों यूनाइट करके बेसर आर्टरी बन गई। सो दिस इज कन्वर्जेंट एनास्टोमोसिस, 2 आर्टरीज ने आपस में यूनाइट किया टू फॉर्म अ लार्जर अनदर थर्ड आर्टरी दैट इज द बेसलर आर्टरी। इसको अच्छे से हम न्यूरो एनाटॉमी में पढ़ेंगे बिकॉज बहुत इंपॉर्टेंट है ये। ठीक है, ओके, सो दैट इज कन्वर्जेंट, याद रहेगा। देन वी हैव पोटेंशियल आर्टेरियल एनास्टोमोसिस बिटवीन द टर्मिनल आर्टेरियोल्स। ठीक है, सो इन सच एनास्टोमोसिस कोलैटरल चैनल्स दे डायलेट ग्रेजुअली ओवर अ पीरियड। सो सडन occlusion of the main artery, the potential anastomosis may fail to compensate the loss of blood supply. For example, anastomosis in the coronary arteries. ठीक है, सो ये जो है बिटवीन द टर्मिनल आर्टीरियोल्स। ठीक है, क्लासिकल एग्जाम्पल है इसका एनास्टोमोसिस ऑफ द कोरोनरी आर्टरीज, हार्ट में। ठीक है, सिंपल। देन वीनस एनास्टोमोसिस, दैट इज कम्युनिकेशन बिटवीन द एडजेसेंट वेन्स. फॉर एग्जाम्पल डॉर्सल आर्चेज होती है हैंड और फुट में, हमने देखी थी अपर लिम्ब में. ठीक है, बहुत सारा वीनस कनेक्शंस हैं. हमने 3D में लास्ट में रीकैप भी किया था अपर लिम्ब का, उसको ज़रूर देखना, उससे बहुत सारी चीज़ें क्लियर होंगी. ठीक है, देन वी हैव द आर्टीरियो वीनस कम्युनिकेशन एनास्टोमोसिस शंट्स. ठीक है, सो इसको हम कह सकते हैं शंट्स, आर्टीरियो वीनस एनास्टोमोसिस या शंट्स. सो ये बेसिकली नाम से पता लग रहा है आर्टीरियो वीनस यानी कि आर्टरी और वेन के बीच में कम्युनिकेशन. सो इट हेल्प्स टू सप्लाई द ब्लड टू द ऑर्गन एज पर द नीड. So shunt vessel they prevent or permit the entry of blood as per the requirements. For example, the skin of the nose, the lips, external ear, mucous membrane of the nose, erectile tissue of the sexual organs, the tongue, okay, the tongue and the tip of the fingers, the nail beds, okay, all these regions are having arteriovenous anastomosis or shunts. ठीक है, so that is something which you should remember. Okay, then हम discuss करते हैं another important entity, that is the end arteries. Okay, end arteries किसे कहते हैं? So end arteries are the arteries or we can say the branches which do not anastomose with the adjacent arteries. ओके, सो दोज आर नोन एज एंड आर्टरीज. सो इसके बड़े क्लासिकल एग्जाम्पल्स हैं जो कि पूछे भी जाते हैं वाइवा में. सो प्लीज रिमेंबर देम. नंबर 1 दैट इज अ सेंट्रल आर्टरी ऑफ रेटिना. सेंट्रल आर्टरी ऑफ रेटिना. ठीक है, देन लैब्रिंथाइन आर्टरी ऑफ ईयर. ठीक है, then central branches, so central branches of the cerebral arteries. ठीक है, and then vasa recta of the mesenteric arteries. ये सब हम पढ़ेंगे. ठीक है, एब्डोमेन में आ जाएंगी वाजा रेक्टा जो कि वेन्स हैं एकम्पनिंग कर रही हैं आर्टरीज को हम पढ़ेंगे. मिजेंट्रिक आर्टरीज, मिजेंट्री इज ऑल अबाउट द इंटेस्टाइन्स वाली पास में हम आर्टरीज पढ़ेंगे डिटेल में. ठीक है, सुपीरियर मिजेंट्रिक आर्टरी, इन्फीरियर मिजेंट्रिक आर्टरी, ये सब हम पढ़ेंगे. ठीक है, देन द वेरियस आर्टरीज ऑफ स्प्लीन, किडनी, ठीक है, लंग्स एंड मेटाफिसिस ऑफ लॉन्ग बोन्स. मेटाफिसिस ऑफ लॉन्ग बोन्स. ठीक है, सो दीज आर द क्लासिकल एग्जाम्पल्स ऑफ एंड आर्टरीज जो कि सबको याद रखनी चाहिए फॉर वाइवा. ठीक है, सो क्यों इंपॉर्टेंट है एंड आर्टरी? मैं रिपीट करता हूँ, एंड आर्टरीज और आर्टरीज विच और यू कैन से द आर्टरीज और देयर ब्रांचेस विच डू नॉट एनास्टमोज विद एनी एडजेसेंट आर्टरीज, यानी खत्म हो गई, लास्ट आर्टरी है, दैट इज एंड आर्टरी. ठीक है, सो इफ द एंड आर्टरी इज ब्लॉक्ड, मान लो कोई थ्रोम्बस आके फंस गया वहाँ पे, ब्लॉक कर दिया, सो द एरिया सप्लाइड बाय सच आर्टरी विल अंडरगो इस्कीमिया एंड नेक्रोसिस. सो दैट इज इंपॉर्टेंट, द क्लिनिकल इंपॉर्टेंस ऑफ द डिफरेंट आर्टरीज. ठीक है, सो दैट इज समथिंग विच यू शुड रिमेंबर. अभी हम डिस्कस करेंगे वाजा रेक्टा वगैरह रीजन वाइज डिस्कस करेंगे. अभी डिटेल में बात करेंगे तो टाइम क्लास का ख़त्म होता जाएगा. ठीक है, सो दीज आर द एंड आर्टरीज विच आर सप्लाइड. सो विच इज़ वेरी इंपॉर्टेंट, अगर वो ब्लॉक हो जाती है तो उस पार्ट का जो एरिया है दैट विल गो इस्कीमिया एंड नेक्रोसिस. ठीक है, सो देन वी टॉक अबाउट द नेक्स्ट टॉपिक इन CVS ओनली, दैट इज़ द टाइप्स ऑफ सर्क्यूलेशन. अब ये वाला टॉपिक थोड़ा सा आसान हो जाएगा बिकॉज हमने ऑलरेडी सब कुछ डिस्कस कर लिया है. सो इट्स जस्ट अ रिकैप नाउ. ठीक है, ओके. नहीं, हार्ट के केस में थोड़ा सा डिफरेंट केस सिनेरियो है. हार्ट में देर इज़ अनदर एंटिटी जो कि हम कह सकते हैं देर आर फंक्शनल एंड आर्टरीज. जो क्वेश्चन पूछ रहे हो हार्ट अटैक में, देर इज समथिंग नोन एज फंक्शनल एंड आर्टरीज. ये भी कहीं लिख लो अगर चाहो तो. देर इज अ कंसेप्ट ऑफ फंक्शनल एंड आर्टरीज, हमने पूछा तो आई कैन रिकलेक्ट नाउ, आई कैन टेल यू। फंक्शनल एंड आर्टरीज का मतलब क्या हुआ? इन केस ऑफ कोरोनरी आर्टरीज, जैसा कि यू आर आस्किंग, ठीक है, इन केस ऑफ कोरोनरी आर्टरीज और एंड ऑल्सो द सेंट्रल ब्रांचेस ऑफ द सेरिब्रल आर्टरी, जो मैंने ऊपर लिखा है, इन दोनों केसेस में देर इज अ पोटेंशियल एनास्टोमोसिस, जो अभी हमने डिस्कस किया था। सो इसका मतलब अगर इफ देर इज अ सडन ब्लॉकेज ऑफ दीज आर्टरीज, सो दीज आर्टरीज आर नॉट कैपेबल ऑफ डेवलपमेंट ऑफ कोलैटरल सर्कुलेशन, तो इसलिए इन आर्टरीज को हम फंक्शनल एंड आर्टरीज कहते हैं। मतलब असली में दीज आर एक्टिंग एज एंड आर्टरीज फंक्शनली, ओके, बिकॉज ब्लॉकेज हो गया तो कोलैटरल सर्कुलेशन बन नहीं पाता, इसलिए हार्ट में अगर कोई एरिया ब्लॉक हो जाता है सो दैट लीड्स टू मायोकार्डियल इन्फाक्शन, मायोकार्डियम का इन्फाक्शन हो जाता है, ठीक है। सो टाइप्स ऑफ सर्कुलेशन, तो वेरियस टाइप्स हैं, जैसे कि पहला टाइप हम डिस्कस करें, दैट इज अ सिस्टमिक सर्कुलेशन। नंबर 2 वी हैव द पल्मोनरी सर्कुलेशन, ठीक है। नंबर 3 दैट इज द पोर्टल सर्कुलेशन। नंबर 4 दैट इज द फीटल सर्कुलेशन, ठीक है, विच इज ड्यूरिंग एम्ब्रियोनिक लाइफ, ठीक है। सो दीज आर सर्टन सर्कुलेशंस। अब इसमें मेरे ख्याल से इफ वी कैन रिकलेक्ट, हमने ऑलरेडी ये सब डिस्कस कर लिया है, सिस्टमिक और पल्मोनरी। सो सिस्टमिक क्या है? सर्कुलेशन ऑफ द ब्लड इजेक्टेड फ्रॉम द लेफ्ट वेंट्रिकल थ्रू द बॉडी विच हैज ओनली वन सेट ऑफ कैपिलरीज। सो लेफ्ट वेंट्रिकल से आयोटा, आयोटा से आर्टरीज, फिर कैपिलरीज, फिर वेन्स पूरी बॉडी में, एंड देन वेना कावा से खून फिर से चढ़ जाएगा राइट एट्रियम में, ठीक है। सो सिस्टमिक सर्कुलेशन हमने 3D में कवर कर लिया था, ठीक है। एंड ये हमने डिस्कस करा था सिस्टमिक और पल्मोनरी सर्कुलेशन, ठीक है, फिर रिमेंबर। सो सिस्टमिक सर्कुलेशन में बेसिकली ऑक्सीजनेटेड ब्लड है जो हार्ट से टिश्यू तक जा रहा है, ठीक है। पल्मोनरी सर्कुलेशन में ट्रांसपोर्ट ऑफ द डीऑक्सीजनेटेड ब्लड फ्रॉम द राइट वेंट्रिकल टू द लंग्स एंड टू ब्रिंग बैक द ऑक्सीजनेटेड ब्लड फ्रॉम द लंग्स टू द लेफ्ट एट्रियम, ठीक है, जो हमने डिस्कस किया था। सो राइट वेंट्रिकल से पल्मोनरी ट्रंक में, फिर पल्मोनरी आर्टरीज, फिर कैपिलरीज इन द लंग्स, ऑक्सीजनेटेड हुआ ब्लड, फिर 4 पल्मोनरी वेन्स, और उसके बाद खून गया लेफ्ट एट्रियम में। सो ये जो पिक्चर थी दैट वाज पल्मोनरी सर्कुलेशन। अगेन दिस इज कैरिंग डीऑक्सीजनेटेड ब्लड, तो हमने डिस्कस कर लिया था। अब आ जाते हैं पोर्टल सर्कुलेशन पे, जो हमने डिस्कस नहीं किया था, ठीक है। सो पोर्टल सर्कुलेशन दैट इज अ सर्कुलेशन इन विच द ब्लड फ्लोज थ्रू 2 consecutive capillary networks बिफोर रिटर्निंग टू द हार्ट, ठीक है। सो जैसे फॉर एग्जाम्पल पोर्टल वेन है, ठीक है, सो लिवर में। सो हार्ट इज गोइंग हार्ट फर्स्ट स्टेशन है, लास्ट स्टेशन अगेन हार्ट है, तो हार्ट से आर्टरीज में ब्लड अगेन फर्स्ट कैपिलरी नेटवर्क के थ्रू पोर्टल वेन में गया, पोर्टल वेन से अगेन सेकंड कैपिलरी नेटवर्क में गया, फिर वेन्स के थ्रू अगेन हार्ट में चला गया। सो इस केस में अगर हम बात करें हिपैटिक पोर्टल सर्कुलेशन की, तो नंबर 1, 2 एंड 3 इसके 3 आर्म्स बना लो। सो नंबर 1 वी हैव द हिपैटिक पोर्टल सिस्टम हर सर्कुलेशन, हिपैटिक पोर्टल सर्कुलेशन, ठीक है, जिसमें इट इज प्रेजेंट इन द लिवर, ठीक है। सो फंक्शन क्या होगा? न्यूट्रिएंट्स एब्जॉर्ब्ड इन द इंटेस्टाइन, दे आर मॉडिफाइड एंड स्टोर्ड इन द लिवर ड्यूरिंग दिस सर्कुलेशन, ठीक है। सेकेंड है हमारा हाइपोफिजियल पोर्टल सिस्टम, ठीक है। इसमें से यहाँ पोर्टल हटा से लिखा ही हुआ है, ठीक है। सो हाइपोफिजियल पोर्टल सिस्टम या सर्कुलेशन, तो ये कहाँ पे होगा? हाइपोफिजियल वर्ड आ गया, दैट मीन्स पिट्यूटरी, ठीक है, दैट मीन्स पिट्यूटरी। हाइपोफिसिस इज द अदर वर्ड फॉर पिट्यूटरी, ये तो डिस्कस किया होगा 11th-12th में पढ़ा हुआ हमने, ठीक है। सो इसका फंक्शन क्या है? टू ट्रांसफर द स्टिम्युलेटरी और इनहिबिटरी हार्मोन्स ऑफ द हाइपोथैलेमस, जो हायर सेंटर है, टू द पिट्यूटरी फॉर कंट्रोलिंग इट्स हार्मोनल सिक्रेशन। याद होगा थायराइड स्टिम्युलेटिंग हार्मोन TSH, याद होगा, ठीक है। सो इस तरीके के हार्मोन्स, कोई स्टिम्युलेटरी है, कोई इनहिबिटरी है, सो दोज आर ऑल द फंक्शंस फॉर दिस सर्कुलेशन। देन वी हैव द रीनल पोर्टल सर्कुलेशन। रीनल नाम से पता लग रहा है किडनी में होगा। सो रीनल इट हेल्प्स टू मेंटेन द रिक्वायर्ड इलेक्ट्रोलाइट बैलेंस, दे फर्स्ट एंटर इनटू द लिवर, दैट इज समथिंग विच इज़ यू विल अंडरस्टैंड व्हेन यू विल डिस्कस लिवर. ओके, सो ये अगेन फिजियोलॉजी में जब पढ़ोगे हेपेटिक सिस्टम तो यू विल अंडरस्टैंड एवरीथिंग इन डिटेल, सारे ऑर्गन्स का फंक्शन क्या क्या चीज़ें होती हैं. तो फिजियोलॉजी एनाटमी दोनों साथ साथ पढ़ना है, ठीक है, उसको छोड़ के नहीं चलना है कि वो बाद में पढ़ेंगे. सो पोर्टल में, रीनल में, इट हेल्प्स टू मेंटेन द रिक्वायर्ड इलेक्ट्रोलाइट बैलेंस एंड टू ऑल्सो एलिमिनेट द वेस्ट प्रोडक्ट्स. ठीक है, वेरी इंपॉर्टेंट, वेस्ट प्रोडक्ट्स भी रिमूव करता है. ठीक है, एंड देन फीटल सर्कुलेशन. फीटल सर्कुलेशन के लिए इस इमेज को देख सकते हैं सब लोग फॉर द फीटल सर्कुलेशन. ठीक है, फीटल सर्कुलेशन में डेवलपिंग फीटस इज एक्चुअली रिसीविंग द न्यूट्रिशन फ्रॉम द प्लेसेंटा ओनली, एंड द फीटस इज एक्चुअली डिपेंडेंट ऑन द मदर फॉर सर्टन न्यूट्रिएंट्स एंड ऑक्सीजन इनटेक. ऑल्सो कार्बन डाइऑक्साइड और वेस्ट प्रोडक्ट्स का एक्सक्रीशन, ये भी वो डिपेंडेंट है मदर के ऊपर. ओके, ऑब्वियस सी बात है. अब यहाँ पर अगर इफ़ यू नोटिस देयर आर सर्टन different special structures which are in the fetal circulation which are very important. You will read in embryology actually. अभी मैं यहाँ पर बहुत डिटेल में नहीं जा सकता बिकॉज वो टाइम एक्सीड कर जाएगा, बट अभी ये समझ लो कि दिस विल बी डिस्कस्ड, फीटल सर्कुलेशन पूरा डिस्कस होगा एम्ब्रोलॉजी में अगेन. ठीक है, सो स्पेशल स्ट्रक्चर्स में अगर हम देखें तो यहाँ पर पहला स्पेशल स्ट्रक्चर जो है दैट इज़ द प्लेसेंटा ओनली. ठीक है, डिफरेंट कलर यूज़ करना चाहिए, आई थिंक बेटर रहेगा. प्लेसेंटा हो गया. ठीक है, प्लेसेंटा इज अ साइट ऑफ एक्सचेंज ऑफ सब्सटेंसेस बिटवीन द मदर एंड फीटस. ठीक है, एंड देन वी हैव द अम्बिलिकल वेन. ठीक है, विच इज कैरिंग द न्यूट्रिएंट्स एंड ऑक्सीजन टू द फीटस. ओके, देन वी हैव द अम्बिलिकल आर्टरीज यहाँ पर. ठीक है, which are actually carrying the waste products and carbon dioxide away from the fetus. ठीक है, and then we have the foramen ovale. ये सारे इंपॉर्टेंट फीचर्स है जो कि वहाँ पढ़ोगे डिटेल में. ठीक है, फोरामेन ओवेल यहाँ पर भी है और फोरामेन ओवेल स्कल में भी पढ़ेंगे, हेड एंड नेक में 2 जगह है, यहाँ पर याद रखना फीटल सर्कुलेशन अलग है. सो फोरामेन ओवेल हेल्प्स द ब्लड टू बाईपास द लंग्स. ठीक है, सो देख सकते हैं यहाँ पर एरो भी मार्क हुआ हुआ है. ठीक है, तो यहाँ पर थोड़ी सी मिक्सिंग होती है. फीटल सर्कुलेशन में ब्लड थोड़ा सा ऑक्सीजन डीऑक्सीजन मिक्स हो जाता है, जबकि एडल्ट लाइफ में ऐसा नहीं है. सो फोरामेन ओवेल इट हेल्प्स द ब्लड टू बाईपास द लंग्स. इट ट्रांसमिट्स मोस्ट ऑफ द ब्लड फ्रॉम द राइट एट्रियम टू द लेफ्ट एट्रियम, मतलब नीचे नहीं, साइड में एट्रियम, इंटर एट्रियल ट्रांसफर हो रहा है फोरामेन ओवेल के थ्रू, एरो के थ्रू देख सकते हैं सब लोग इस इमेज में. Then we have another important structure that is the ductus venosus. अब ये क्या बोला है? Ductus venosus transmits the oxygenated blood from the umbilical vein, जो नीचे दिख रही है लाल में, umbilical vein and left branch of the portal vein. ठीक है, जो इसमें बनी नहीं हुई है, but there is portal vein also, left branch होगी उसकी. ठीक है, which transmits the blood to the inferior vena cava and thus the blood bypasses the liver. ठीक है, तो लिवर को देख सकते हो, कोई भी अंदर नहीं जा रहा, लिवर को बाईपास करता हुआ निकल गया. दैट इज डक्टस वेनोसस का रोल. देन वी हैव डक्टस आर्टीरियोसस. ठीक है, इसमें देख सकते हैं दिस इज द डक्टस आर्टीरियोसस विच इज एक्चुअली हेल्पिंग द ब्लड टू बाईपास द फीटल लंग्स. ठीक है, तो यहाँ पर लंग्स ही बाईपास हो सकते हैं ब्लड में, ब्लड. सो दैट इज इट ट्रांसमिट्स द ब्लड फ्रॉम द लेफ्ट पल्मोनरी आर्टरी टू द आयोटा, डायरेक्ट आयोटा में खून भेज देगा. ठीक है, तो बहुत मिक्सिंग है, देख सकते हो पूरा एकदम खिचड़ी पकी हुई है. फीटल सर्कुलेशन में मिक्सिंग ही मिक्सिंग हो रहा है. कहाँ कहाँ क्या मिक्सिंग हो रही है वो एम्ब्रियोलॉजी की बुक्स में डिटेल में पढ़ सकते हैं सब लोग. ठीक है, सो दिस इज जस्ट अ रिकैप टू अंडरस्टैंड द डिफरेंसेस बिटवीन द सिस्टमिक एंड द पल्मोनरी सर्कुलेशन. मैंने इसको नोट्स में डाल दिया है. एवरीथिंग इज सेम एज वी हैव डिस्कस्ड. इसको अच्छे से यू कैन रिवाइज बिकॉज क्वेश्चंस आते हैं इसके ऊपर. सो आई हैव पुट दिस एज अ टेबल. Similarly, a different table for blood vascular system versus lymphatic system. इसको you can go through and read out the things because ये बहुत ही basic चीज़ें हम already discuss कर चुके हैं. So don't need to waste any further time on this. Okay. Then before we go on further, इसमें यहीं पर हम एक और चीज़ discuss कर लेते थे quickly. That was the NMC की competency also. Before we go to the next topic, the clinical. अब क्लिनिकल में बड़े इंपॉर्टेंट वर्ड आ जाते हैं जो कि कॉम्पिटेंसी में है. दैट इज़ नंबर 1 थ्रोम्बोसिस. ये बार बार जगह जगह बुक्स में और तुम्हारे क्लासेस में ये वर्ड सुनने को मिलेगा किसी ना किसी से. सो दिस मीनिंग यू शुड अंडरस्टैंड कि थ्रोम्बोसिस होता क्या है. थ्रोम्बोसिस इज बेसिकली अ मेडिकल कंडीशन कैरेक्टराइज्ड बाय द फॉर्मेशन ऑफ अ ब्लड क्लॉट. यानी कि थ्रोम्बस। तो थ्रोम्बस का बनना इज थ्रोम्बोसिस। कहाँ पे बनेगा? इनसाइड द ब्लड वेसल, सिंपल, ठीक है, एक साधारण भाषा में। अब ये करेगा क्या? ब्लड क्लॉट है तो ऑब्स्ट्रक्ट करेगा पूरा या फिर पार्शली ब्लॉक करेगा एक अफेक्टेड ब्लड वेसल को। सो नॉर्मल ब्लड फ्लो जो है हमारा अफेक्ट हो जाएगा, डिसरप्ट हो जाएगा। सो ये कहाँ कहाँ हो सकता है थ्रोम्बोसिस? आर्टरीज में भी हो सकता है, वेन्स में भी हो सकता है। कैवर्नस साइनस थ्रोम्बोसिस हम पढ़ेंगे हेड नेक में, शॉर्ट नोट आता है, बड़ा इंपॉर्टेंट है। आर्टरीज में ब्लॉकेज हो जाता है, ये तो पता होगा, आर्टरीज में ब्लॉकेज हो जाता है। सो दैट इज अगेन इट कैन अकर इन आर्टरीज और वेन्स। अब थ्रोम्बस इट कैन डिसलॉज फ्रॉम इट्स ओरिजिनल, जो ब्लॉक क्लॉट था वो अपनी जगह से खिसक के कहीं और जा सकता है। सो दैट कैन फॉर्म एम्बोलस, ठीक है। और एम्बोलस का बन के आगे चले जाना, ब्लॉक करना फर्दर, दैट इज एम्बोलिज्म। अब वो दिस एम्बोलिज्म कैन एक्चुअली पोटेंशियली ब्लॉक द स्मॉलर ब्लड वेसल्स कहीं पे भी पूरी बॉडी में। सो इट कैन कॉज सीरियस कॉम्प्लिकेशन, इंस्टेंट डेथ भी हो सकती है पेशेंट की, सुना भी होगा, पल्मोनरी एम्बोलिज्म इज द कॉज ऑफ डेथ इन दैट पर्सन, ठीक है। सो पल्मोनरी एम्बोलिज्म हो सकता है, एग्जाम्पल पल्मोनरी एम्बोलिज्म और स्ट्रोक, ठीक है। स्ट्रोक इज नथिंग बट सेरिब्रोवैस्कुलर एक्सीडेंट, CVA, दैट इज सेरिब्रोवैस्कुलर एक्सीडेंट, ठीक है, सेरिब्रल वेसल्स का एक्सीडेंट, दैट इज CVA। एक चैप्टर है मेडिसिन के प्रॉफ में, अच्छे से पढ़ोगे डिटेल में, ठीक है। सो अब इसका कॉज क्या है? थ्रोम्बोसिस होता क्यों है, ठीक है। थ्रोम्बोसिस के कॉजेज क्या क्या में माने जाएंगे? नंबर 1, एंडोथीलियल डैमेज। एंडोथीलियम हमने डिस्कस किया था, वो डैमेज हो सकता है कैसे? इंजरी से, ट्रॉमा, सर्जरी या फिर इन्फ्लामेशन। तो इस केसेस से एंडोथीलियल में डैमेज हो सकता है। देन देयर कैन बी स्टासिस और ब्लड फ्लो डिस्टर्बेंस, ब्लड फ्लो डिस्टर्बेंस, प्रोलॉन्ग्ड इमोबिलिटी, एग्जाम्पल लॉन्ग पीरियड्स ऑफ बेड रेस्ट या फिर एयर ट्रैवल, कंजेस्टिव हार्ट फेलियर, वीनस इंसफिशिएंसीज, इस केसेस में ये प्रॉब्लम हो सकती है। देन सर्टन हाइपर कोएगुलेबिलिटी डिसऑर्डर्स, ओके, हाइपर कोएगुलेबिलिटी डिसऑर्डर्स, इंक्रीज्ड टेंडेंसी टू क्लॉट, ब्लड क्लॉट, ठीक है। देन वेसल वॉल इंजरी, ठीक है, वेसल वॉल इंजरी, 1 2 3 4, हाँ ठीक है। सो वेसल वॉल इंजरी, ठीक है, इसमें जैसे कि एथेरोस्क्लेरोसिस में हो सकता है, ठीक है। सो दिस इज समथिंग अबाउट थ्रोम्बोसिस। देन सेकेंड एंटिटी है हमारे पास, NMC कॉम्पिटेंसी में भी है, इसलिए हम डिस्कस कर रहे हैं डिटेल में थोड़ा सा, दैट इज द इन्फार्क्शन, ठीक है। इसकी डिटेल्स पैथोलॉजी में पढ़ोगे, ठीक है, सब क्या है, क्या चीज़ें हैं, कैसे है। इन्फार्क्शन मतलब टिश्यू का डेथ ड्यू टू इनएडिक्वेट ब्लड सप्लाई टू द अफेक्टेड एरिया, सिंपल। क्यों होगा ये, कब होगा? कॉज्ड बाय आर्टरी का ब्लॉकेज या रप्चर या मैकेनिकल कंप्रेशन या फिर वेजो कंस्ट्रिक्शन, ठीक है। द रिजल्टिंग डेड टिश्यू और लीजन इज नोन एज इन्फार्क्ट, ठीक है। सो मायोकार्डियल इन्फार्क्शन सुना होगा क्लासिकली, ठीक है। अब इसमें कॉजेज क्या क्या आ जाएंगे? कॉजेज में एथेरोस्क्लेरोसिस, अगेन एथेरोस्क्लेरोसिस जो वर्ड है इसकी डिस्क्रिप्शन डिटेल में अगेन पैथोलॉजी प्रॉफ में आएगी। देन थ्रोम्बोसिस, ठीक है, इटसेल्फ इज अ कॉज ऑफ इन्फाक्शन। एम्बोलिज्म, ठीक है, वेजोस्पाज्म, ठीक है, वेसल्स में स्पाज्म, इन्फ्लामेशन और इवन ट्रॉमा। समझ में आ रहा है? प्लीज गिव मी थम्स अप और ओके इफ यू आर एबल टू अंडरस्टैंड द थिंग्स। थोड़ी सी टेक्निकल, थोड़ी सी मुश्किल नए नए वर्ड्स आ रहे हैं, बट यू हैव टू कोप अप बिकॉज मेडिकल में सब कुछ इंपॉर्टेंट है, जो जो पढ़ सकते हो जितना पढ़ सकते हो, बिकॉज मरीज़ कभी भी किसी भी चीज़ का आएगा। और ये वर्ड्स का मतलब ही नहीं पता है तो आगे डिस्कशन भी नहीं कर पाओगे किसी सीनियर के साथ क्लिनिक्स में। बेसिकली एन्यूरिज्म, एन्यूरिज्म का लिटरल मीनिंग है सैक लाइक डायलेटेशन ऑफ द आर्टीरियल वॉल, सिंपल, ठीक है। आर्टीरियल की वॉल जो है वो सैक लाइक डायलेटेशन है उसमें, ठीक है, दैट इज द aneurysm. Okay, so that can happen because of its weakness, so it is associated with the replacement of elastic fibers with the collagen fibers, ठीक है। ये मोस्ट कॉमनली ओल्ड एज में दिखता है, ठीक है, बिकॉज ऑफ एथेरोस्क्लेरोसिस, सिफिलिस या फिर मार्फन सिंड्रोम पढ़ेंगे बाद में, ठीक है। सो दिस इज नथिंग बट sac like dilatation, okay, of arterial wall. ओके सिंपल। सो इन सब चीज़ों का जो हमने डिस्कस किया अभी तक, ठीक है, उन सब का क्लिनिकल इंटीग्रेशन में आ जाता है दैट इज द DVT, डीप वेन थ्रोम्बोसिस। तो क्या होता है, इन मीडियम साइज्ड वेन्स स्पेशली लोअर लिम्ब में थ्रोम्बस जो है वो फॉर्म कर सकता है। स्पेशली पेशेंट्स जो प्रोलॉन्ग बेड रेस्ट पे हैं या ऑर्थोपेडिक्स के केसेस है, फ्रैक्चर के केसेस पड़े हैं, कास्ट लगा के एडमिटेड है वार्ड्स में ट्रीटमेंट ऑफ फ्रैक्चर से केसेस में। सो पार्ट्स ऑफ सच क्लॉट्स कैन गेट सेपरेटेड एंड एंटर द पल्मोनरी सर्कुलेशन एंड पल्मोनरी एम्बोलिज्म कर सकते हैं। इवन डीप वेन्स में थ्रोम्बोसिस कर सकते हैं। सिंपल, इट्स अ वेरी सीरियस डिसीज़, ठीक है, जो कि अगर ये सेट इन हो जाता है, सर्जरी में पढ़ोगे इसको डिटेल में, तो बड़ी प्रॉब्लम है, पेशेंट की डेथ भी हो सकती है, बचा भी नहीं पाओगे, ठीक है। देन देर इज समथिंग नोन एज थ्रोम्बोएंजाइटिस ऑब्लिटरेंस, ठीक है, इसका दूसरा नाम है बर्जर्स डिसीज, ठीक है। ये क्या है, रिकरिंग प्रोग्रेसिव इन्फ्लामेशन एंड थ्रोम्बोसिस यानी क्लॉटिंग ऑफ स्मॉल और मीडियम साइज्ड आर्टरीज या वेन्स ऑफ हैंड और फीट। थ्रोम्बो मतलब थ्रोम्बस, एंजाइटिस मतलब वेसल्स, ऑब्लिटरेंस मतलब ब्लॉकेज, ठीक है। सिंपल, इसको मतलब अगर पकड़ोगे, यूजुअली ये लोअर लिम्स में मिलता है, ठीक है, और ये मिलता है टोबैको यूजर्स में और स्मोकर्स में, ठीक है। एंड मेन सिम्टम होगा पेन in the affected areas. So that's it about the cardiovascular system. So thank you so much for this. I hope the discussion was fruitful and you understood some things out of this topic. Next topic पे हम आ जाते हैं quickly without wasting time. That is the lymphatic system. So lymphatic system, let's begin the lymphatic system. अब lymphatic system में we have again certain competencies to discuss, ठीक है। So we will talk about certain components and functions of the lymphatic system, ठीक है। We will describe the structure of the lymph capillaries and mechanism of lymph circulation. We will also understand the concept of lymphedema and spread of tumors. सब thrombosis है, okay, actually I agree, सब मुश्किल लगेगा, but क्या कर सकते हो, you have to you know रीड इट अगेन एंड अगेन। एक बार में समझ नहीं आएगा, आई अंडरस्टैंड, थोड़ा सा टफ है, चीज़ें बहुत सारी हैं। द मोर यू स्टडी डीपली द मोर यू विल अंडरस्टैंड, ठीक है। तो एक बार में नहीं आएगा, यू हैव टू रीड इट अगेन एंड अगेन, ठीक है। वेलकम टू MBBS। अभी तक तुम सोच रहे थे 11th-12th की पढ़ाई है, वो तो 2-3 बार 10 बार रिविज़न करके जाते थे, ठीक है, लेकिन अब यहाँ रिविज़न का कोर्स ही नहीं कंप्लीट होगा, MBBS में इतना सिलेबस है, ठीक है। So explaining the concept of lymphedema and spread of tumors via the lymphatics and venous system, ठीक है, ये सारे हमारे important competencies हैं lymphatics में, ठीक है। So let us dive into this topic, lymphatic system, okay। अब lymphatics के लिए हम ग्रीन पकड़ लेते हैं। lymphatic system, ठीक। So it consists of an extensive network of lymph vessels that drains the extracellular fluid and acts as an accessory system to the venous system. भाई आर्टरीज से खून हम लेके जा रहे हैं, ऑक्सीजन ब्लड, डीऑक्सीजन ब्लड हम वीनस ड्रेनेज के थ्रू लेके जा रहे हैं, वापस लेके आ रहे हैं, तो हमें ये सिस्टम चाहिए ही क्यों? ठीक है, खुद सोच के देखो, हमें तीसरा सिस्टम क्यों चाहिए? हमने ऑलरेडी देखा था 3D में, यहाँ पर अगर हम ऑब्जर्व करें, इसको सबको हटाए, एक बार दोबारा देखो, यहाँ पर हमारे पूरी बॉडी में यहाँ पर वीनस सिस्टम था, आर्टीरियल सिस्टम था, ऑलरेडी इतना सब कुछ था, पूरा मायाजाल था। अब हमने यहाँ पर एक लिम्फेटिक सिस्टम एक और लगा दिया, बताओ, ग्रीन कलर का लिम्फेटिक सिस्टम भी लगा दिया। इसका पूरा काम क्या है? हर जगह देखो लिम्फेटिक्स रन कर रहे हैं, ढेर सारी जगह पे, ठीक है। सो अब इसको हम डिस्कस करेंगे इवेंचुअली क्या है ये रेलेवेंस, ठीक है। इसमें देखोगे यहाँ पर थाइमस ग्लैंड दिखेगा, ठीक है, दिस इज थाइमस ग्लैंड, ओके। सो हम भी डिस्कस करेंगे सेपरेटली लिम्फॉइड ऑर्गन्स वगैरह। अब देखो कि हर जगह लिम्फेटिक्स ग्रीन ग्रीन नेटवर्क तुम्हें हर जगह दिखेगा, पूरी बॉडी में मल्टीपल जगह पे रन करता हुआ दिखेगा। कुछ नोड्यूलर से स्ट्रक्चर्स दिखेंगे, कुछ लिम्फ नोड्स हैं, ठीक है, दीज आर लिम्फ नोड्स, ठीक है, जगह जगह पे है बॉडी में जहाँ से वो लिम्फेटिक ड्रेनेज लेके आ रहे हैं। और एक चीज़ और नोटिस करो यहाँ पर, मैं इसमें अगर जूम इन करूँ, जस्ट लेट मी शो यू हेयर, ये हमारा जो ग्रीन चैनल था, जो ग्रीन सा नेटवर्क था, थोरेसिक डक्ट है, इधर हम आएंगे दोबारा वापस। थोरेसिक डक्ट जो ग्रीन वाला है वो ओपन किस में कर रहा है? अरे ये कैसे हो गया? ये तो वेन में चला गया। मतलब कि जो एक्सेसरी सिस्टम है, लिम्फेटिक सिस्टम, दिस इज एक्चुअली ड्रेनिंग इनटू द वीनस सिस्टम ओनली। तो अल्टीमेट जो नाली है दैट इज द वीनस सिस्टम, ठीक है, वीनस ड्रेनेज, ड्रेनेज मेन चैनल वीनस ड्रेनेज ही है। तो लिम्फेटिक ड्रेनेज भी है जो अल्टीमेटली लिम्फेटिक ड्रेनेज भी वीनस ड्रेनेज में जा रही है, ठीक है। सो ये एक पॉइंट सबको याद रखना है कि ये वेन्स में ही जाएगा, ठीक है। यहाँ पर एक इस तरफ देख रहे हो, एक इस तरफ देख रहे हो, राइट साइड पे राइट लिम्फेटिक डक्ट है और लेफ्ट साइड पे थोरेसिक डक्ट है जो कि इंटरनल जुगुलर वेन में ड्रेन कर रही है, ठीक है। अभी हम बाद में डिस्कस करेंगे, ठीक है, सेपरेटली कि क्या क्या चीज़ें हैं। ब्रेकियोसेफेरिक वेन, सॉरी, ब्रेकियोसेफेरिक वेन अभी हम डिस्कस करेंगे, लेट मी गो थ्रू सेपरेटली। सो टॉकिंग अबाउट द लिम्फेटिक सिस्टम, अब दिस इज एन extensive network of lymph vessels which I just told you that drains the extracellular fluid, okay. So it drains the extracellular fluid, okay, and it acts as an accessory system, accessory to venous system, venous system, ठीक है, accessory to venous system. So what are the functions? As you can understand now, it drains the, मैं बताए तो orally, I hope that is understandable क्योंकि वो basic सी चीज़ है. So it helps to drain the excess extracellular fluid to the venous system. It filters the absorbed fluid and material, ठीक है. It provides the defense mechanism against the disease causing microorganisms, ठीक है. So have a look at this image, ठीक है. You can understand few things, that is the components of the lymphatic system. Let us talk about the components of this lymphatic system. So what are the components? Number one, that is the lymph itself. Number two, that is lymph capillaries and lymph vessels. Lymph capillaries and lymph vessels. We will study one by one कि क्या क्या चीजें हैं. Then lymphoid organs. Okay. Number 4, we have the epithelio lymphoid system. ठीक है. Number 5, we have the bone marrow. ठीक है. So these are the different components of the lymphatic system जो कि you all should know. ठीक है. So इस image में भी you can see few of the components. Number 1, you can see the lymph which is actually flowing through green color, ठीक है. देन lymph कैपिलरीज दिख रही हैं इस इमेज में, lymph vessels दिख रही हैं, ठीक है. हम बात करेंगे वन बाय वन कि क्या चीज़ें कैसे कनेक्टेड है. एंड देन वी हैव द लिम्फॉइड ऑर्गन्स जो कि इसमें नहीं दिख रहे हैं बट देयर आर लिम्फॉइड ऑर्गन्स जो हम डिस्कस करेंगे. देन लिम्फ नोड्स, जैसे फॉर एग्जांपल लिम्फ नोड्स इज अ लिम्फॉइड ऑर्गन, ठीक है, जो हम डिस्कस करेंगे. देन वी हैव द लिम्फेटिक डक्ट्स, ठीक है, जो कि अगेन चैनल्स हैं जो हम डिस्कस करेंगे इन अ वाइल. ओके, सो दैट इज अबाउट द कंपोनेंट्स विच यू शुड अंडरस्टैंड, ठीक है. So talking about each of these one by one, number one, that is the lymph. ठीक है. अब lymph is a fluid that flows through the lymphatic vessels and lymph nodes. It is pale. Please give me thumbs up or something. हो कि चले गए हो सब लोग चैट में, please give me something. आई डोंट सी योर फेसेस, पता नहीं सो गए हो या चले गए हो, बिकॉज थोड़ी सी क्लास लेंदी है आई नो, बट इट्स बेनिफिशियल फॉर ऑल ऑफ यू ओनली बिकॉज जनरल एनाटमी वरना स्किप हो जाती है. यू डोंट स्टडी सो मेनी थिंग्स. जनरल एनाटमी में बहुत कुछ है. इफ़ यू स्टडी दिस प्रॉपरली मैनी थिंग्स विल बी क्लियर, ठीक है. सो प्लीज़ शो योर प्रेजेंस इफ़ यू आर देयर. ओनली हैंडफुल ऑफ स्टूडेंट्स, तो मुझे स्टूडेंट्स के नाम भी याद हो गए हैं, ठीक है, जो चैट में रिलेटिवली मैसेजेस करते रहते हैं, बट मोस्ट ऑफ देम जस्ट अटेंडिंग. सो थोड़ा सा गिव समथिंग इन द चैट सो दैट आई नो देयर आर न्यू फेसेस, न्यू पीपल इन द चैट. रहोगे तो सीखोगे वरना कुछ नहीं सीखने को मिलेगा. लिम्फ, सो इट इज़ अ पेल क्लियर वाटरी फ्लूइड, ठीक है, सिंपल. इट इज अ पेल क्लियर watery fluid, okay, that is generated from the transurates, that is the extracellular fluid, and contains the plasma proteins, ठीक है. It also contains white blood cells, predominantly lymphocytes, ठीक है. अब it also contains large fat molecules known as chylomicrons. अगेन ये फिजियोलॉजी में पढ़ोगे इसके बारे में डिटेल में, ठीक है. काइलोमाइक्रॉन्स, मैं कीवर्ड्स मेंशन कर रहा हूँ ताकि यू नो व्हाट टू रीड एंड व्हाट टू अंडरस्टैंड. वीडियो भी देख लोगे तो यू विल अंडरस्टैंड अगेन एंड अगेन थिंग्स. सो लार्ज फैट मॉलिक्यूल्स है काइलोमाइक्रॉन्स विच आर एब्जॉर्ब्ड फ्रॉम द इंटेस्टाइन्स, ठीक है. सच लिम्फ कंटेनिंग लार्ज अमाउंट ऑफ फैट मॉलिक्यूल्स, इट लुक्स सिमिलर टू मिल्क एंड हेंस दिस इज नोन एज काइल, ठीक है. एब्डोमेन सर्जरी प्रॉफ में इसके बारे में डिटेल में पढ़ोगे काइल, ठीक है. Lymph can also contain cancerous cells, viruses, bacteria and even foreign material. So basically ये सारी चीज़ें भी lymphatic route के थ्रू spread कर सकता है, ठीक है. So that is again very 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 important. Clinical entity एक इससे लिंक है, that is the lymphedema, okay. Lymphedema, एडिमा मतलब स्वेलिंग, ठीक है. सो एडिमा स्वेलिंग और लिम्फ मतलब हमें पता है. तो एक्यूमुलेशन ऑफ एक्सेस लिम्फेटिक फ्लूइड इन द टिश्यू, इट लीड्स टू स्वेलिंग. अब ये कहाँ पर मिलता है? क्लासिकली लिम्ब्स में मिलेगा. इट अकर्स टू द फेलियर ऑफ लिम्फेटिक ड्रेनेज. कॉमन कॉजेज क्या होंगे, जैसे कि नाम भी सुना होगा शायद सबने, फाइलेरियासिस, एलिफेंटियासिस कहते थे, याद है. इन्फेक्शन बाय अ पैरासाइट दैट ग्रोज एंड ब्लॉक्स द लिम्फेटिक वेसल्स. सो ये हो सकता है कॉमन कॉज ऑफ लिम्फेडिमा. या फिर और भी तरह के इन्फेक्शंस, या फिर ट्रॉमा, कैंसर सेल्स, ठीक है, या फिर सर्जरीज, ठीक है. So this is something about the lymph which you should remember. Then talking further about the second entity, that is the lymph capillaries. Lymph capillaries, they begin in the tissue as blind ended sacs, okay. So similar to the endothelium in the blood capillaries जो हमने डिस्कस किया था, lymphatic capillaries are lined by lymphatic endothelium, ठीक है, देयर इज अ लिम्फेटिक एंडोथीलियम lining these capillaries. ठीक है, these lymphatic capillaries, these lymph capillaries, they are actually more permeable than blood capillaries, so they permit entry to absorb larger lipid molecules in the intestines. Okay, then talking about the next category, that is the lymph vessels. ठीक है, लिम्फ वेसल्स में एक्चुअली द यू कैन से लिम्फ कैपिलरीज हम जो डिस्कस कर रहे थे, लिम्फ कैपिलरीज के बाद लिम्फ कैपिलरीज में एक और चीज़ है, बिफोर आई सॉरी लिम्फ कैपिलरीज में एक चीज़ रह गई है. लिम्फ कैपिलरीज, they are actually absent in certain sites which you can remember, absent in they are absent at. So what are those? So lymphedema मैंने कहा था accumulation of excess lymphatic fluid in the tissue leading to swelling. ठीक है, simple meaning है. Absent at epidermis. Okay, cornea, cartilage. Okay, और hairs आ जाएंगे. Then we have nails. ठीक है, then splenic pulp, bone marrow, choroid जो हम न्यूरोएनाटमी में पढ़ेंगे. ठीक है, ये सब हम डिस्कस करेंगे बाद में. इंटरनल ईयर, ओके, meninges and any kind of nervous tissue. ठीक है, सिंपल. then there is something known as I can say the concept of lymphatic drainage, which you should understand as a basic term. Okay, so have a look. यहाँ पर क्या हुआ, there are certain tissue cells जो कि tissue spaces होंगी. यहाँ पर extra cellular spaces में lymphatic capillaries रन कर रही हैं. ठीक है, जो कि lymph को लेके जा रही हैं, extra cellular fluid को through the lymph vessels with walls and then it's going into the lymph node. तो यहाँ पर जो enter कर रहा है channel, so lymph capillaries are carrying the lymph towards the lymph nodes through the afferent channels. So यहाँ पर जो ये channel है, यहाँ पर जो ये channel बना, that is the afferent lymph vessels, जो कि इस डायरेक्शन में लिम्फ को लेके जा रही है इनटू द लिम्फ नोड. ठीक है, और फिर उसके बाद हमारे आए इफरेंट्स. ठीक है, जो कि लिम्फ एक्चुअली लीव्स द लिम्फ नोड्स थ्रू द इफरेंट्स. सो इफरेंट लिम्फ वेसल्स. ओके, तो ये एक बेसिक कॉन्सेप्ट है लिम्फेटिक ड्रेनेज का. पूरी बॉडी में बहुत जगह पढ़ोगे लिम्फेटिक ड्रेनेज. तो एक बेसिक कॉन्सेप्ट पता होना चाहिए लिम्फेटिक ड्रेनेज के बारे में. ठीक है, सो अब एक और इमेज देख लेते हैं इसके बाद. हाँ, हैव अ लुक. यहाँ पर ये दिख रहा है बीडेड सा अपीयरेंस. इस केस में एक बीड लाइक अपीयरेंस सा लग रहा है. ठीक है, सो बेसिकली द लार्जर लिम्फ वेसल्स दे हैव बीडेड अपीयरेंस. ओके, you can remember this. Larger lymph vessels, they have beaded appearance. ये बड़ा इंपॉर्टेंट वाइवा का क्वेश्चन है, सो प्लीज रिमेंबर दिस. ठीक है, जो HODs होते हैं दे कीप ऑन आस्किंग दिस बेसिक क्वेश्चन, तो ये पता होना चाहिए. ठीक है, दीज हैव बीडेड अपीयरेंस बिकॉज. नाउ वाई? बिकॉज द ड्यू टू द प्रेजेंस ऑफ न्यूमरस वॉल्स बेसिकली. ओके, ड्यू टू presence of numerous valves, okay, within their lumen. Right, which actually helps to maintain, which maintains a unidirectional flow. ये बहुत ही इंपॉर्टेंट क्वेश्चन है वाइवा का, सो प्लीज रिमेंबर दिस. ये एक्सटर्नल एग्जामिनर्स जो आते हैं दे कीप ऑन आस्किंग दिस क्वेश्चंस लिम्फेटिक्स के बारे में, ठीक है. सो मैं पहले से ही बता के चल रहा हूँ, सो थोड़ा ध्यान रखना. बहुत सालों से मैं देख रहा हूँ एग्जाम्स होते हुए, कंडक्ट होते हुए, सो आई नो व्हाट दे कीप ऑन आस्किंग, ठीक है. सो प्लीज़ पे अटेंशन टू दिस. देन इसी इमेज में हम देख लेते हैं एक और चीज़ बिफोर वी गो टू दैट, ठीक है. सो lymphatic vessels, they bring the lymph to the series of lymph nodes in the entire body, ठीक है. These nodes, they filter the fluid to remove the foreign particles and microorganisms, and smaller lymph vessels, they merge to form larger lymph vessels. Simple story, ठीक है. So larger lymph vessels जो अभी हमने इतनी कहानी कर रहे हैं, larger lymph vessels, that includes certain trunks, okay. What are those? Larger lymph vessels, okay. What are those? Number one, thoracic duct, ठीक है. Right lymphatic duct, okay. Then we have jugular lymph trunk on both the sides, left and right, ठीक है. Then subclavian trunk, ठीक है. सबक्लेवियन ट्रंक, अगेन लेफ्ट एंड राइट साइड. देन ब्रोंकोमीडियस्टाइनल ट्रंक, ठीक है, अगेन लेफ्ट एंड राइट साइड, ठीक है. इंटेस्टाइनल ट्रंक्स, ओके. देन देयर आर इंटेस्टाइनल लिम्फ ट्रंक्स, ठीक है, इंटेस्टाइन्स के पास. देन वी हैव लंबर लिम्फ ट्रंक्स. सो दीज आर सर्टन एग्जाम्पल्स of larger lymph vessels. Sorry, it includes, ठीक है. सो एक डायग्रामेटिक रिप्रेजेंटेशन है ताकि यू कैन रिमेंबर इमेज वाइज, ठीक है, कहाँ कहाँ क्या है. इनके ट्रंक्स के नाम पता हो, दैट इज मोर देन सफिशिएंट, ठीक है. नाम से भी हिंट लग रहा है कि कहाँ पे जा रहे हैं, ठीक है. सो दैट इज ऑल्सो समथिंग टू रिमेंबर. देन फर्दर हम जाते हैं नेक्स्ट इमेज पे. इसी इमेज में अगर देखोगे ध्यान से, जस्ट ट्रेसिंग इट आउट, यहाँ पर ये दिख रहा है ये चीज़ विच इज़ गोइंग दिस वे, दिस इज़ द थोरेसिक डक्ट, ठीक है, जो बड़ी इंपॉर्टेंट है. इस पे क्वेश्चन भी आता है शॉर्ट नोट के नाम पे, सो दैट इज समथिंग टू बी डिस्कस्ड, ठीक है. द थोरेसिक डक्ट, ठीक है. अब इसके बारे में कुछ चीज़ जाननी है, ठीक है. लेट मी शो यू थोरेसिक डक्ट अगेन, ओके. एप्पल पेंसिल. सर ऑन एवरेज फर्स्ट ईयर में कितनी बार सिलेबस रिवाइज होता है एंड हम अपना पूरा दम लगाकर कितनी बार रिविज़न कर सकते हैं? बड़ा मुश्किल है ये रिवीजन कर पाना. करके देखो, ट्राई करो. एक स्टेज टेस्ट आएगा, उसमें मुझे प्लीज़ फीडबैक देना कि कितनी बार रिवाइज करके गए हो. सिलेबस कंप्लीट कर लोगे, बहुत बड़ी बात हो जाएगी. MBBS में ये हार्ड बिटर ट्रुथ है, ठीक है. सिलेबस कंप्लीट ही नहीं होता. क्यों नहीं कंप्लीट होता? बिकॉज इतना सारी चीज़ें हैं पढ़ने को. अब उसका सबसे अच्छा तरीका होता है कुछ इंपॉर्टेंट टॉपिक्स पहले करके बैठ जाओ, अच्छे से रिवाइज कर लो, याद कर लो, रिवाइज कर लो, बार बार समझ लो, रिवाइज कर लो, पढ़ लो इंपॉर्टेंट टॉपिक्स को ज़्यादा बार, ठीक है. और बाकी पूरे सिलेबस को, जो कि नेवर एंडिंग सिलेबस है, उसको एक बार रीडिंग ज़रूर लगाने की कोशिश करो, क्योंकि कभी कभी एग्जाम में वाइवा में कुछ भी पूछ लेते हैं रिमोटली, तो अगर बेसिक्स नहीं पता होंगे तो साफ़ हो जाएगा सब कुछ, ठीक है. सो अब हम एक्चुअली थोरेसिक डक्ट को देखना चाह रहे थे. थोरेसिक डक्ट को मैंने आइसोलेट किया है, जस्ट हैव अ लुक. ये इस रीजन में इस तरीके से रन कर रही है. सो थोरेसिक डक्ट is a largest lymphatic vessel in the body. इट इज़ अबाउट 45 सेंटीमीटर लॉन्ग एंड 5 मिलीमीटर वाइड। ठीक है, ये एक इम्पॉर्टेंट चीज़ है। ठीक है, इसी की बीडेड अपीयरेंस होती है, जो अभी हमने डिस्कस किया, बीड्स के फॉर्म में ये लाई करती है। ये पोजीशन देख लो कहाँ पे है ये। ठीक है, एंड ये बनती कहाँ से है, कैसे बनती है, इसको देख लेते हैं हम। थोड़ा सा लिम्फेटिक्स को कम करते हैं इसमें। वेन्स जो काम की हैं थोड़ी सी रख लेते हैं मेन। ठीक है, ओके। सो जो हमारी थोरेसिक डक्ट है, ठीक है, जो कि हमारी इस साइड पे लाई कर रही है। ठीक है, इसको हम अगर जस्ट वेट 1 सेकेंड, फेड अदर्स, राइट, इसमें से हमें हार्ट भी हटाना ही पड़ेगा। ठीक है, थाइमस को भी हटा देते हैं। ओके, सो यहाँ पर ऑब्जर्व करो सब लोग, दिस इज समथिंग दैट इज द थोरेसिक डक्ट। ठीक है, जो कि यहाँ लाई कर रही है इस रीजन में। अब दिस थोरेसिक डक्ट बिगिंस एज अ कॉन्टिन्यूशन ऑफ अपर एंड ऑफ सिस्टर्ना काइली। अब ये क्या चीज़ है, इसको देख लो, नीचे की तरफ जाते हैं सबसे नीचे। यहाँ पर एक्चुअली नीचे से बिगिनिंग हो रही है। ठीक है, ऑपोजिट है। हम आर्टरीज में बोलते थे ना, ऊपर से शुरू हो रही थी, ओरिजिन स्टार्टिंग पॉइंट था, ऐसा नहीं है। थोरेसिक डक्ट में नीचे से शुरू हो रही है एंड स्टार्टिंग पॉइंट है ये वाला डायलेटेड सा पार्ट दिख रहा है, दिस इज द सिस्टर्ना काइली। ठीक है, सो इसके बारे में हम बाद में डिस्कस करेंगे डिटेल में, सिस्टर्ना काइली के बारे में। ठीक है, सो दिस इज समथिंग नोन एज सिस्टर्ना काइली। ओके, जो कि एक सैक्युलर डायलिटेशन दिख रहा है लिम्फेटिक टिश्यू का। ओके, विच इज़ फॉर्म्ड बाय द यूनियन ऑफ सर्टेन ट्रंक्स। ठीक है, इसको डिटेल में बाद में पढ़ोगे व्हेन वी विल डिस्कस द एब्डोमेन। एब्डोमेन में सिस्टर्ना काइली सेपरेटली हम डिस्कस करेंगे। ठीक है, सो ये स्टार्टिंग पॉइंट हो गया इस थोरेसिक डक्ट के लिए। ठीक है, सो फॉर्मेशन यू कैन से थोरेसिक डक्ट बिगिंस एज अ कॉन्टिन्यूशन ऑफ द अपर एंड ऑफ द सिस्टर्ना काइली। कहाँ पे, एट द लोअर बॉर्डर ऑफ द एट द लोअर बॉर्डर ऑफ द 12 थोरेसिक वर्टिब्रा। ठीक है, इस रीजन में लमसम मिलेगा। ठीक है, एंड इट एंटर्स दी थोरेसिक कैविटी। थोरेसिक डक्ट जो है, नाम से ही पता लग रहा है, थोरेसिक डक्ट थोरेसिक कैविटी में एंटर कर रही है। ठीक है, एंड असेंड्स अपवर्ड्स। ओके, टर्मिनेशन कहाँ था, हमने देख ही लिया था, इट टर्मिनेट्स और ओपन्स एट द लेफ्ट जुगुलो सबक्लेवियन एंगल। ठीक है, जंक्शन ऑफ दी, इसको हम देख लेते हैं, वेन्स में डाल देते हैं। ठीक है, देखोगे यहाँ पर ये ओपन हो रही है, कहाँ पे, एट द जुगुलो सबक्लेवियन, यानी कि जंक्शन ऑफ दी लेफ्ट जुगुलर इंटरनल जुगुलर वेन एंड लेफ्ट सबक्लेवियन वेन। सो ये एंगल है जहाँ पे ये ओपन हो रही है। ठीक है, सबक्लेवियन वेन और इंटरनल जुगुलर वेन के एंगल पे। ठीक है, ये टर्मिनेशन और स्टार्टिंग पॉइंट याद हो गया, सिस्टर्ना काइली और जुगुलो सबक्लेवियन एंगल। ठीक है, सब उसके बाद हम आ जाते हैं एरिया ऑफ ड्रेनेज पे, जो कि पूछा जाता है थ्योरी में। ठीक है, एंड वाइवा में भी। ओके, सो थोरेसिक डक्ट हमने कहा दिस इज द लार्जेस्ट लिम्फेटिक वेसल। largest lymphatic vessel. Okay, it is 45 centimeter in length. Okay, shown in 3D, ताकि जो नोट्स वाले बच्चे हैं उनको हम थोड़ा सा जला देते हैं क्योंकि वो लोग सिर्फ नोट्स की बेसिस सोचते हैं कि नोट्स देख लेते हैं, छोड़ो क्लास क्या देखनी है, तो पता रहेगा उनको कि क्या मिस कर रहे हैं अगर वो वीडियोस नहीं देख रहे हैं। एंड इट इज़ 5 मिलीमीटर वाइड। ओके, एंड इट हैज़ अ बीडेड अपीयरेंस, और बीडेड क्यों है वो हमने डिस्कस कर लिया था अभी थोड़ी देर पहले। इट हैज़ अ बीडेड अपीयरेंस, ठीक है, ड्यू टू द प्रेजेंस ऑफ न्यूमरस वॉल्स, जो हमने डिस्कस किया। ठीक है, वेरी इंपॉर्टेंट वाइवा क्वेश्चन। ठीक है, फॉर्मेशन में वी डिस्कस्ड, फॉर्मेशन में स्टार्टिंग या बिगिनिंग पॉइंट बिगिंस एट द सिस्टर्ना काइली, स्केमेटिक में भी दिख रहा है यहाँ पर सिस्टर्ना काइली, ठीक है, एंड टर्मिनेट्स एट द जुगलो सबक्लेवियन एंगल, जुगलो सबक्लेवियन एंगल, ठीक है, राइट। अब बड़ा इंपॉर्टेंट क्वेश्चन है कि पूरी बॉडी में से कौन सा एरिया ये ड्रेन करता है, ठीक है। सो एरियाज ऑफ ड्रेनेज इज एक्सट्रीमली इंपॉर्टेंट, सो प्लीज रिमेंबर थोरेसिक डक्ट के लिए, सो इट ड्रेन्स all the parts, I can just write areas of drainage. अब इस इमेज पे आ जाते हैं, हैव अ लुक एट द एरियाज ऑफ ड्रेनेज, ठीक है। सो यहाँ पर बड़ा इंपॉर्टेंट कंसेप्ट है जो कि अगेन वाइवा का भी क्वेश्चन है। थोरेसिक डक्ट जो है बॉडी में ज़्यादा एरिया ड्रेन कर रही है एज कंपेयर टू द राइट थोरेसिक डक्ट, सॉरी राइट लिम्फेटिक डक्ट, ठीक है। हाँ, जुगलो सबक्लेवियन एंगल पे एंड करेगी जो भी हमने डिस्कस किया। तो थोरेसिक डक्ट देख सकते हैं इस बॉडी में पूरा, थोरेसिक डक्ट इज ड्रेनिंग द लिम्फ फ्रॉम ऑल द पार्ट्स ऑफ द बॉडी एक्सेप्ट, अब एक्सेप्ट में ये सारे लिखे हुए हैं यहाँ पर, दैट इज द राइट ऑफ द हेड एंड नेक, राइट अपर लिम, राइट चेस्ट वॉल, राइट लंग एंड राइट पार्ट ऑफ द हार्ट, ठीक है, राइट साइड ऑफ द हार्ट एंड राइट सरफेस ऑफ द हाफ ऑफ द लिवर, ठीक है। सो ये एक्सेप्शनल केस है, ये वाले पार्ट छोड़ के बाकी पूरी बॉडी जो है थोरेसिक डक्ट ड्रेनेज कर रही है, सिंपल, ठीक है। अब तो जो एक्सेप्शन है उसके बारे में थोड़ा सा ब्रीफली बात कर लेते हैं, दैट इज द राइट लिम्फेटिक डक्ट, इसका नाम ही यही है, तो कन्फ्यूजन ही नहीं होगा कि ये किस साइड पे है ये, ठीक है, कि राइट साइड है कि लेफ्ट साइड है, दिस इज ऑन द राइट साइड और वो था लेफ्ट साइड पे, ठीक है। अब दिस इज अ लार्ज लिम्फेटिक डक्ट प्रेजेंट ऑन द राइट साइड एट द रूट ऑफ द नेक, इट इज अबाउट 1 सेंटीमीटर लॉन्ग, इसको देख लो 3D में, कहाँ गया, दिस इज राइट लिम्फेटिक डक्ट, इसको मैं आइसोलेट करूंगा बस इतनी सी है, ये देखो छोटी सी, दिस इज द राइट लिम्फेटिक डक्ट, ठीक है। तो याद रहेगा सबको कितनी बड़ी है ये, 1 सेंटीमीटर, ठीक है। सो ये जो फॉर्म हो रही है दिस राइट लिम्फेटिक डक्ट, ये कैसे कैसे बन रही है, ठीक है, ओह सॉरी, कैसे कैसे बन रही है। सो इट इज फॉर्म्ड बाय द यूनियन ऑफ द राइट सबक्लेवियन ट्रंक, द राइट जुगुलर ट्रंक, ओके, एंड जो नीचे की तरफ दिख रहा है दैट इज द राइट ब्रोंको मीडियस्टाइनल ट्रंक, ठीक है। सो इट इज फॉर्म्ड बाय द यूनियन ऑफ राइट ब्रोंको मीडियस्टाइनल ट्रंक, ओके। सो मेन ट्रंक्स तो यही हैं जो बना रहे हैं इसको, देयर आर अदर थिंग्स ऑल्सो, बट ये कुछ ट्रंक्स हैं जो डिफरेंट रीजन से आ रही हैं और वो यूनाइट करके बना रही हैं राइट लिम्फेटिक डक्ट, ठीक है। और ये टर्मिनेट कहाँ कर रही है, सेम स्टोरी, लेकिन अब ये राइट साइड पे है, ये याद रखना है। तो राइट जुगलो सबक्लेवियन एंगल, तो यानी कि राइट सबक्लेवियन वेन और राइट इंटरनल जुगुलर वेन के एंगल पे एंड कर रही है, ठीक है। एक एंगल बन रहा है इसमें, ब्रेकियोसेफेलिक वेन में ड्रेन करने से पहले यहाँ एक एंगल बन रहा है, उस एंगल पे ड्रेन कर रही है, ठीक है। सो दिस राइट लिम्फेटिक डक्ट इज एक्चुअली टर्मिनेटिंग, और यू कैन से पहले तो फॉर्म्ड बाय, हमने ग्रीन कलर यूज किया, ठीक है, फॉर्मेशन that is by union of, और भी ट्रंक्स हैं लेकिन जो इंपॉर्टेंट वाली हैं एग्जाम के लिए याद रखने के लिए वो याद रख लो, दैट इज द राइट जुगुलर ट्रंक, नंबर 2 राइट सबक्लेवियन ट्रंक, नंबर 3 the right bronchomediastinal trunk, ठीक है। एंड टर्मिनेशन मैंने वहाँ पे लिख दिया जुगलो सबक्लेवियन एंगल, ये कौन सा था, लेफ्ट साइड, लेफ्ट जुगलो सबक्लेवियन एंगल था थोरैसिक डक्ट के लिए, ठीक है। दिस वाज द लेफ्ट जुगलो सबक्लेवियन एंगल, और इसमें टर्मिनेशन में राइट जुगलो सबक्लेवियन एंगल, ठीक है। मैंने 3D में दिखाई दिया, अगेन आई कैन राइट दिस हेयर, शोन इन 3D, ठीक है, ताकि हम रिवाइज कर सके बाद में। ओके, सो एरियाज ऑफ ड्रेनेज में तो स्पेसिफिक हो गए, जो एक्सेप्शन था वो यहाँ पर एरियाज हो गए, दैट इज राइट साइड ऑफ दिस ऑल दीज थिंग्स जो हमने डिस्कस किया, ठीक है। सो ये सबको याद रखना है। देन एक कॉन्सेप्ट है बिफोर वी गो फर्दर इनटू, ओके, लिम्फेटिक्स में ही एक और कॉन्सेप्ट है, दैट इज द लिम्फ वेसल्स can be divided into two categories, that is number one the superficial lymph vessels, ठीक है, and deep, ठीक है। so this is basically the lymph vessels that are subdivided into superficial and deep according to the locations, ठीक है। superficial present in superficial fascia, deep जो है deep present deep to deep fascia, so they are mostly accompanying the blood vessels only, deep वाले, ठीक है। अब factors कुछ है जो कि help करेंगे lymphatic drainage में, that I am not writing, वो समझ मतलब you can understand। skeletal muscle contractions होंगे, वो pressure बनाएंगे lymphatic vessels में, ठीक है। valves होंगे lymphatic vessels में which will maintain the unidirectional blood flow। Contraction of smooth muscles in the wall of the lymph vessels can also be the cause for helping in the lymphatic drainage, ठीक है। So just write the heading here, that is the factors helping in lymphatic drainage, ठीक है। So that would include the contraction of smooth muscles in the wall of lymph vessels, pulsations of the adjacent arteries, ठीक है। नेगेटिव इंट्राथोरेसिक प्रेशर होगा जो कि क्रिएट होगा ड्यूरिंग रेस्पिरेशन, डायफ्राम की मूवमेंट होती है ड्यूरिंग रेस्पिरेशन, वो भी लिम्फेटिक ड्रेनेज को हेल्प करेगा। लिम्स को एलिवेट रखना ग्रेविटी के अगेंस्ट, दैट इज ऑल्सो वन डिफरेंट थिंग टू रिमेंबर। उसके बाद हम आ जाते हैं into the next topic, that is the lymphoid organs, ठीक है, बड़ा इंपॉर्टेंट है, प्लीज पे अटेंशन नाउ। ये वाइवा में थ्योरी में सब में पूछा जाता है lymphoid organs के बारे में, ठीक है। MCQs भी भर भर के आते हैं इस टॉपिक से। सो lymphoid organs basically they are made of lymphoid tissue। अब lymphatic tissue is specialized form of connective tissue, उसमें इम्यून सेल्स हैं, लिम्फोसाइट्स, प्लाज्मा सेल्स, एंड मेशवर्क है रेटिकुलर फाइबर्स एंड सेल्स का, ठीक है। सो देयर आर सर्टन प्राइमरी लिम्फॉइड ऑर्गन्स एंड सेकेंडरी लिम्फॉइड ऑर्गन्स। तो एक फ्लो चार्ट बना लो इजीली याद रखने के लिए। ठीक है, सो नंबर वन वी हैव द प्राइमरी लिम्फॉइड ऑर्गन्स and we have the secondary, ठीक है। सो प्राइमरी में हमारे आ जाते हैं the organs which actually convert the stem cells into the immunocompetent immature cells, okay। so they convert the stem cells into the immunocompetent or immature cells, ठीक है। convert the stem cells into immunocompetent cells, ठीक है। इसके एग्जाम्पल्स में आ जाते हैं, वी हैव नंबर वन थाइमस। अगेन ये सब चीज़ें हम हिस्टोलॉजी में डिस्कस करेंगे डिटेल में। थाइमस एंड बोन मैरो, Okay, then we have another, secondary, that is site for activation and proliferation. It is site for activation and proliferation of the immunocompetent cells. Immunocompetent cells. ठीक है, क्लासिकल एग्जाम्पल्स इसके हो गए, दैट इज द स्प्लीन, लिम्फ नोड्स, ठीक है, टॉन्सिल, अपेंडिक्स एंड इवन माल्ट. माल्ट के बारे में बात करेंगे, दैट इज म्यूकोजा एसोसिएटेड लिम्फोइड टिश्यू. ठीक है, अभी हम डिस्कस करेंगे बाद में. तो इन सारों में से हम जो डिटेल में तुम्हें पढ़ाते हैं, विच डिस्कस एवरीथिंग इन डिटेल इन हिस्टोलॉजी स्पेसिफिकली. अभी तो हम सिर्फ क्रॉस में बात कर रहे हैं जनरल एनाटॉमी में, बट जो बाद में डिटेल में पढ़ोगे दैट इज रिगार्डिंग द थाइमस, स्प्लीन, लिम्फ नोड्स एंड टॉन्सिल. ये 4 इंपॉर्टेंट लिम्फॉइड टिश्यूज़ हैं जो कि वाइवा में, थ्योरी में, स्पॉटिंग में सब जगह पूछे जाएंगे. एंड ऑल्सो वी हैव अपेंडिक्स जो कि हम एब्डोमिनल रीजन में डिस्कस करेंगे. ठीक है, सो दीज आर सर्टन इंपॉर्टेंट लिम्फॉइड ऑर्गन्स विच यू शुड नो. सो प्राइमरी लिम्फॉइड ऑर्गन्स जो मैंने लिखा है यहाँ पे, दे आर एक्चुअली ऑल्सो कॉल्ड एज सेंट्रल लिम्फॉइड ऑर्गन्स. ठीक है, इसका दूसरा नाम है प्राइमरी और सेंट्रल लिम्फॉइड ऑर्गन्स. ठीक है, these organs actually produce the immature lymphocytes from the stem cells or immature cells. Secondary वाले जो है, they are providing exposure to the foreign antigens and convert immature lymphocytes into the active lymphocytes. तो activation और proliferation जो है वो सारा काम secondary का है. ठीक है, जो हमने अभी डिस्कस किया. Then even ileum, जो duodenum jejunum ileum है, ileum के अंदर Pierce patches होते हैं. That is also the example of secondary lymphoid organ. ठीक है, सो यू कैन रिमेंबर दैट ऑल्सो. सो ये एक चीज़ समझ में आई बेसिक सा. ठीक है, देन वी मेक एन अदर फ्लो चार्ट फॉर समथिंग डिफरेंट, दैट इज द लिम्फॉइड टिश्यू. लिम्फॉइड टिश्यू. ठीक है, अब लिम्फॉइड टिश्यू को हम 2 चीज़ों में डिवाइड कर सकते हैं. ठीक है, number 1, that is diffuse lymphoid tissue, and number 2 we have dense lymphoid tissue. We have dense lymphoid tissue. Okay, अब diffuse lymphoid tissue that is not enclosed by a capsule. Okay, not enclosed by capsule. Okay, for example, the lymphoid distributed I didn't get your question, please reframe your query. Okay, lymphocytes distributed in the malt. Okay, so that is the lymphocytes in malt, that is mucosa associated lymphoid tissue. ठीक है, dense में क्या होता है, it is enclosed within capsule. Enclosed within capsule. Example, lymph nodes, okay, tonsil, thymus and spleen. ठीक है, ये सब एग्जाम्पल्स हैं फॉर द डिफ्यूज एंड डेंस. ठीक है, सो ये कुछ याद रख सकते हो. अब कुछ कुछ टेक्स्ट बुक्स में, मतलब कुछ कुछ बुक्स में यू विल ऑल्सो, मैं बता के चल रहा हूँ पहले बिकॉज कन्फ्यूजन होगा वरना, कुछ टेक्स्ट बुक्स में माल्ट जो है, जो यहाँ लिखा है मैंने डिफ्यूज़ में, कुछ कुछ उन टेक्स्ट बुक्स में इसको डेंस में भी लिखा हुआ है, ठीक है। सो बिकॉज लिम्फॉइड टिश्यू जो है दैट कैन बी एसोसिएटेड विद म्यूकोजा, सो इसको कहते हैं म्यूकोजा एसोसिएटेड लिम्फॉइड टिश्यू। इलियम मोस्ट कॉमन साइट है माल्ट के लिए, जैसे कि पियर्स पैचेस वगैरह, ठीक है। और कुछ कुछ टेक्स्ट बुक्स में डेंस में भी लिखा हुआ है, तो इतना कंफ्यूज नहीं होना है, दैट इज़ ऑल्सो एक्सेप्टेबल। बट फिलहाल जो मैंने स्टैंडर्ड टेक्स्ट बुक्स में देखा है दैट इज़ द डिफ्यूज लिम्फॉइड टिश्यू, ठीक है। सो नो कंट्रोवर्सी, प्लीज राइट इट इन डिफ्यूज, क्लासिकल एग्जाम्पल, ठीक है। देन हम आ जाते हैं यहाँ पर फर्स्ट पे, वन बाय वन क्विकली डिस्कस कर लेते हैं। नंबर 1 वी हैव द, नहीं लिम्फोसाइट्स अलग चीज़ है, वो एक कंपोनेंट है, लिम्फ एक अलग चीज़ है जो अभी हमने डिस्कस करी, ठीक है। ओके, तो फर्स्ट इज द लिम्फेटिक फॉलिकल और लिम्फेटिक नोड्यूल विच यू कैन सी इन दिस इमेज, ठीक है। सो इसमें क्या होता है, इट इज़ अ वेल सर्कमस्क्राइब्ड कंसेंट्रेशन ऑफ लिम्फेटिक सेल्स, ढेर सारे लिम्फेटिक सेल्स हैं, ठीक है। ओके, इन दिस इमेज यू कैन सी ढेर सारे लिम्फेटिक सेल्स हैं। एंड लिम्फेटिक नोड्यूल इट इज़ नॉट सराउंडेड बाय अ कैप्सूल, ठीक है, स्फेरिकल होगा, वॉइड भी हो सकता है। दे आर प्रेजेंट इन ऑल डेंस लिम्फॉइड टिश्यूज एक्सेप्ट थाइमस। अब लिम्फॉइड नोड्यूल्स जो है समझ में आया क्या बेसिक चीज़ है, इसमें सेंटर में एक चीज़ याद रखनी है कि देयर इज़ अ जर्मिनल सेंटर, ठीक है, बिल्कुल एकदम बीचों बीच यहाँ पर लाइटली स्टेन्ड एरिया है, दैट इज़ अ जर्मिनल सेंटर। इसको अगेन हिस्टोलॉजी में हम डिटेल में पढ़ेंगे, ठीक है, वी विल डिस्कस दिस एवरीथिंग इन डिटेल इन हिस्टोलॉजी। देन वी हैव द नेक्स्ट कैटेगरी दैट इज द लिम्फ नोड्स, लिम्फ नोड्स, ठीक है। सो स्मॉल किडनी शेप्ड स्ट्रक्चर्स होंगे विच फिल्टर द लिम्फ, मैंने 3D में भी दिखाया था, ठीक है। देयर आर अबाउट 450 लिम्फ नोड्स इन द एंटायर ह्यूमन बॉडी, आउट ऑफ विच 60 to 70 नोड्स आर इन हेड एंड नेक एंड अपर लिम्ब रीजन ओनली, और 100 जो है वो थोरैसिक रीजन में है, और 250 के आसपास एब्डोमेन में, पेल्विस में, लोअर लिम्ब में है। सो इतना ज़्यादा वास्ट नंबर ऑफ लिम्फ नोड्स है। यू कैन सी सर्टन एग्जाम्पल्स ऑफ लिम्फ नोड्स प्रेजेंट इन द एंटायर बॉडी इन दिस इमेज, ठीक है। देन सो यहाँ पर कुछ मेन लिम्फ नोड्स हैं जो कि दिखाए हुए हैं। एक्सिलरी लिम्फ नोड्स दिख रहे हैं जो अपर लिम्ब में, इग्वाइनल लिम्फ नोड्स लोअर लिम्ब में मिल जाएंगे, ठीक है। यहाँ पर यू कैन सी एक्सिलरी लिम्फ नोड्स, इंग्वाइनल लिम्फ नोड्स, ठीक है, इन द लोअर लिम्ब। सर्वाइकल लिम्फ नोड्स जो कि हेड नेक में बहुत इंपॉर्टेंट है, हम पढ़ेंगे डिटेल में। मीडियस्टाइनल लिम्फ नोड्स थोरैसिक रीजन में है, ठीक है। आयोटिक लिम्फ नोड्स हैं एब्डोमिनल रीजन में, मेन सेंट्रल लिम्फ नोड्स है जहाँ पर सारा लिम्फ जाके डिपॉजिट होगा। देन वी हैव इलियक ग्रुप ऑफ लिम्फ नोड्स इन द पेल्विक रीजन, ठीक है। ऐसे सुपरफिशियल ग्रुप होगा कुछ, ऐसे कुछ डीप होगा, ठीक है। सुपरफिशियल विल बी अरेंज्ड इन द सुपरफिशियल फेशिया अलोंग द वेन्स, जैसे इंटरजुगुलर वेन के अराउंड कुछ मिल जाएंगे लिम्फ नोड्स। लिम्फ नोड्स डीप में भी लोकेटेड हो सकते हैं, डीप फेशिया के डीप में मिल जाएंगे। सो दे आर लाइंग अलोंग द आर्टरीज, तो डीप में आर्टरीज होती हैं तो वहाँ मिलेंगे। सुपरफिशियल जो नोड्स होंगे दोज विल ड्रेन इनटू द डीप नोड्स, ठीक है। तो ये एक इंपॉर्टेंट फीचर है जो कि यू शुड नो अबाउट द लिम्फ नोड्स एज अ होल, ठीक है। सो प्लीज रिमेंबर दिस, ओके। देन उसके बाद हम आ जाते हैं another image, see this is a flow chart depicting the entire structure of the lymph node, ठीक है। सो बिफोर वी गो इन सीट, एक चीज़ मैं सबको पहले ही बता रहा हूँ, ये टॉपिक पूरा का पूरा हिस्टोलॉजी में कवर्ड है, ठीक है। सो इसको चाहे जनरल एनाटॉमी बुक से पढ़ो या बेटर रहेगा हिस्टोलॉजी के टेक्स्ट बुक से पढ़ो, ठीक है, वहाँ पर डिटेल में ऑथेंटिक चीज़ें मिलेंगी, ठीक है। सो मैंने एक फ्लो चार्ट यहाँ रखा है बहुत डिटेल में हम नहीं जाएंगे सो बहुत डिटेल में हमें डिस्कस नहीं करना है, ठीक है। जो इसके मेन फीचर्स हैं वो इस फ्लो चार्ट से देख सकते हैं, दैट इज़ द कैप्सूल, फिर पेरेन्काइमा होगा जो फर्दर स्प्लिट हो जाता है कॉर्टेक्स और मेडुला में। कॉर्टेक्स में भी ऑटो नोडुलर कॉर्टेक्स और पैरा कॉर्टेक्स, ठीक है। देन बीच में रेटिकुलर नेटवर्क है एंड वी हैव सर्टन साइनसेस जो कि सब कैप्सुलर, ट्रिबेक्युलर, मेडुलरी साइनसेस, ये हम डिटेल में डिस्कस करेंगे जब हम इस तरह का हिस्टोलॉजी की क्लास में डिस्कशन डिटेल में लेंगे, ठीक है। यहाँ पर मेन चीज़ देख सकते हो इफ्रेंट लिम्फेटिक वेसल दिख रहा है एंड आफ्रेंट जहाँ से लिम्फ इसके अंदर आ रहा है, ठीक है। एंड कुछ जहाँ पे लिम्फेटिक जो लिम्फ है इट इज़ कमिंग आउट ऑफ द लिम्फ नोड। यहाँ पर देख सकते हैं जर्मिनल सेंटर दिख रहा है, ठीक है। सेंटर में, इसके सेंटर में यहाँ पर जर्मिनल सेंटर मिलेगा। एक लिम्फेटिक नोड्यूल है, उसके सेंटर में लिम्फेटिक जर्मिनल सेंटर है, ठीक है। इस तरीके की पिक्चर मिलती है जो हिस्टोलॉजी में डिस्कस करेंगे। बाहर एक कैप्सूल सी लगी होगी, ठीक है। सिमिलरली देन थाइमस की स्टोरी है। थाइमस में भी अगेन वी हैव कैप्सूल, पेरेन्काइमा एंड एपिथेलियो रेटिकुलर सेल्स, ठीक है, जो अगेन हम वहाँ पर डिस्कस करेंगे डिटेल में, इसमें कोई घबराने की बात नहीं है, ठीक है। एंड बिफोर आई जम्प टू द नेक्स्ट थाइमस, एक चीज़ और लिख लेते हैं यहाँ पर छोटा सा, दैट इज़ द क्लिनिकल, that is about lymphadenitis, ठीक है। सो इन्फ्लेमेशन ऑफ द लिम्फ नोड इज नोन एज लिम्फेडिनाइटिस, इसलिए मैंने यहाँ पर लिखा है लिम्फ नोड्स बिकम एनलार्ज ड्यू टू प्रोलिफरेशन ऑफ द लिम्फोसाइट्स, ठीक है। इन्फेक्शन हो सकता है, कैंसर हो सकता है, मेटास्टासिस, तो स्वोलन पेनफुल लिम्फ नोड्स होंगे, फीवर भी आ सकता है पेशेंट में, ठीक है। और इनफैक्ट मेटास्टासिस भी हो सकता है लिम्फ नोड्स में, ठीक है। सो दैट इज़ ऑल्सो इम्पॉर्टेंट। मेटास्टासिस हमने डिस्कस किया था फर्स्ट क्लास में, ठीक है, क्या क्या वर्ड्स होते हैं जनरल। सो कैंसर सेल्स प्राइमरी कैंसर लीजन से ट्रैप हो सकते हैं लिम्फ नोड्स में एंड मल्टीप्लाई कर सकते हैं लिम्फ नोड में, और फिर सेकेंडरी कैंसर लीजन बना सकते हैं बॉडी में कहीं और, ठीक है। सो मोस्ट कॉमन रूट ऑफ मेटास्टासिस जो होता है दैट इज ड्यू टू मतलब वाया दिस लिम्फेटिक रूट ओनली, ठीक है। सो इज बाय द लिम्फेटिक वेसल्स। तो एक ये क्लिनिकल है जो लिम्फ नोड से लिंक्ड है, वी शुड नो, ठीक है। देन थाइमस में कुछ इंपॉर्टेंट चीज़ें हैं जिसमें से सबसे कोर इंपॉर्टेंट चीज़ है जो आइडेंटिफाइंग फीचर है बेसिकली, दैट इज़ द हेसल्स कॉर्पसल्स, ठीक है, जो कि हाइलिन मटीरियल विच इज सराउंडेड बाय कंसेंट्रिकली अरेंज एपिथेलियो रेटिकुलर सेल्स, ठीक है। फिर ब्लड थाइमिक बैरियर और ये सब चीज़ें हम थाइमस में डिस्कस करेंगे हिस्टोलॉजी में, ठीक है। सो डोंट वरी राइट नाउ ये क्या क्या चीज़ें हैं। हैव अ लुक एट दिस हिस्टोलॉजिकल इमेज जिसमें कैप्सूल है, ठीक है। देन उसके बाद यू सी कॉर्टेक्स एंड देन द पार्ट यू कैन सी मेडुला, और यहाँ पर ये ढेर सारे हेसल्स कॉर्पसल्स दिख रहे हैं जिस पे फोकस किया हुआ है। ये एक हेसल्स कॉर्पसल है जो इस तरीके से दिख रहा है, अनियन शेप्ड अपीयरेंस मिलेगा सेल्स का, ठीक है। एंड दे विल बी अनियन पील शेप बेसिकली। सो दीज आर टाइप 6 एपिथेलियो रेटिकुलर सेल्स, ये हम पढ़ेंगे जब हम थाइमस डिटेल में डिस्कस करेंगे, ठीक है। हेसल्स कॉर्पसल्स और यू कैन से थाइमिक कॉर्पसल्स, ठीक है, ये एक इम्पॉर्टेंट पॉइंट है, ओके। एंड अगेन इसका क्लिनिकल रेलेवेंस बिफोर आई मूव टू द नेक्स्ट थाइमस के साथ, दैट इज लिंक टू माइस्थीनिया ग्रेविस। हमने ऑलरेडी डिस्कस कर लिया था, रेयर ऑटोइम्यून डिसऑर्डर है, लास्ट क्लास में पढ़े थे हम। इट इज एसोसिएटेड इन 70% केसेस ऑफ थाइमोमास, ठीक है। सो दिस इज एसोसिएटेड इन 70% थाइमोमा केसेस, ठीक है। दैट इज द ट्यूमर ऑफ द एपिथेलियो रेटिकुलर सेल्स जो भी हमने देखे। तो बेसिकली माइस्थीनिया ग्रेविस में आई ट्राई टू वाइंड इट अप, टारगेट तो 9 का था लेकिन अब थोड़ा सा एक्सटेंड हो रहा है। आई थिंक मैक्सिमम 10 मिनट्स, 5 to 10 मिनट्स में ख़त्म हो जाना चाहिए एज पर माई अंडरस्टैंडिंग, ठीक है। इट रिजल्ट्स इन सो माइस्थीनिया ग्रेविस में क्या होता है, एंटीबॉडीज बन जाती है विच स्लोली डिस्ट्रॉय द कोलिनर्जिक रिसेप्टर्स फ्रॉम द स्केलेटल मसल एंड दे कॉज वीकनेस ऑफ द मसल, तभी इसका नाम है माइस्थीनिया ग्रेविस। हमने लास्ट टाइम पे डिस्कस किया था लास्ट टॉपिक में। इट रिजल्ट्स इन डबल विजन, आई मसल्स की डबल विजन, ठीक है, वी विल डिस्कस दैट इन आई, एंड ड्रूपिंग ऑफ द आईलिड, डिसआर्थरिया, मसल्स ऑफ द थ्रोट, लैरिंग्स, ये सब इफेक्ट होंगी एंड सो ऑन। तो बहुत कुछ हो सकता है। सो दैट इज़ वन एंटिटी. देन वी सिमिलरली हैव द स्प्लीन, जिसमें अगेन कैप्सूल विद ट्रेबिकुले. पैरेन्काइमा में वी हैव वाइट पल्प, रेड पल्प एंड मार्जिनल जोन, जिसमें से ये दोनों क्वेश्चंस बनते हैं जो हम अगेन स्प्लीन में बाद में डिस्कस करेंगे. मैंने अभी बस फ्लो चार्ट रख दिया ताकि एक रिकैप्चुलेशन कर सको. ठीक है, सो यू कैन गो थ्रू दिस फ्लो चार्ट अगेन, लेकिन हिस्टोलॉजी में हम शिद्दत से डिटेल में पढ़ेंगे, अभी यहाँ पर नहीं पढ़ना है. ठीक है, सो जस्ट हैव अ लुक. ये एक हिस्टोलॉजिकल इमेज है जिसमें देख सकते हैं यहाँ पर ढेर सारे ट्रेबिक्यूले दिख रहे हैं. ठीक है, एंड यहाँ पर अगेन लिम्फेटिक नोड्यूल है, सेंटर में लाइटली स्टेन्ड पर्पल स्टेन पकड़ा हुआ है, दैट इज द जर्मिनल सेंटर. ठीक है, सो यहाँ पर कुछ एरिया दिख रहा है, दैट इज द रेड पल्प. ये सारा का सारा रेड पल्प है. ठीक है, जो ये पूरा का पूरा एरिया दिख रहा है, दिस इज द एंटायर रेड पल्प. और ये जो लिम्फेटिक नोड्यूल्स वाला पार्ट है, दिस इज द वाइट पल्प. ठीक है, सो ये वाइट पल्प रेड पल्प इंपॉर्टेंट है. स्प्लीन इज प्रेजेंट हेयर इन दिस रीजन. ठीक है, यहाँ पर अगर तुमने 3D में भी देखा था, इफ़ यू रिमेंबर, यहाँ पर जब मैंने प्रोजेक्ट किया था तो स्प्लीन बना हुआ आ रहा था. सॉरी, देखोगे मैंने लिम्फेटिक सिस्टम ऑन किया हुआ है तो यहाँ पर स्प्लीन पड़ा हुआ मिल रहा है. ठीक है, तो स्प्लीन को देख सकते हो. दिस इज हाउ द स्प्लीन लुक्स लाइक एंड इट इज़ प्रेजेंट हेयर. अगेन एब्डोमेन में डिटेल में स्प्लीन के बारे में पढ़ेंगे, एक सेपरेट क्लास है. ठीक है, सो यहाँ पर so spleen is the largest lymphoid organ. It is located in the upper part of the abdomen along the 9th, 10th and 11th ribs. ठीक है, so हम डिस्कस करेंगे इसके बारे में. उसका भी एक हाइलम होता है. ठीक है, which actually has the splenic vessels which enter through this हाइलम. ये हाइलम एक ओपन सेंटर प्लेस है, हाइलस कहते हैं इसे, हाइलम या हाइलस, जिसमें स्प्लिनिक वेसल्स, स्प्लिनिक आर्टरी, वेन, ये सब एक्चुअली इसमें एंटर कर रहा है, कोई स्ट्रक्चर को इसमें लीव कर रहा है. ठीक है, सम आर एंटरिंग सम आर गोइंग. और यहाँ पर स्प्लीनिक नॉचेज होती हैं जो हम स्प्लीन के क्लास में डिटेल में डिस्कस करेंगे. फंक्शन क्या है स्प्लीन का? इट एक्चुअली हेल्प्स इन एक्टिवेशन ऑफ लिम्फोसाइट्स. ठीक है, एंड बाय यूजिंग द एंटीजन प्रेजेंटिंग सेल्स एंड proliferation of B and T lymphocytes happens here. It is also known as the graveyard of RBCs, destruction of old and damaged RBCs. And whereas in embryonic life, spleen acts as a hematopoietic organ. ठीक है, stores small amount of blood also. ठीक है, सो वाइट पल्प, रेड पल्प, ये सब होगा. एंड अगेन स्प्लीन में एक कंसेप्ट आ जाता है जो कि हम अगेन हिस्ट्रो में डिस्कस करेंगे, क्लोज्ड सर्कुलेशन एंड ओपन सर्कुलेशन. ठीक है, ये स्प्लीन के केस में है, बड़ा इंपॉर्टेंट. ठीक है, जो हम डिस्कस करेंगे स्प्लीन के चैप्टर में डिटेल में अलग से. ठीक है, रिगार्डिंग द ओपन सर्कुलेशन. तो दो कंसेप्ट है स्प्लीनिक सर्कुलेशन में. ओपन सर्कुलेशन में देख सकते हैं सब लोग इस इमेज में, sheathed capillaries they open into the red pulp and blood passes through the cords of the red pulp and finally they enter into the splenic sinusoids. So that is classically open circulation. And if you compare this with closed circulation, capillaries they open directly into the splenic sinusoids. So that is the comparison. तो यहाँ पर देख सकते हैं हम लोग कैपिलरीज जो हैं वो सीधा के सीधा which are opening into the splenic sinusoids. और ओपन सर्कुलेशन में दे ओपन फर्स्ट इनटू द रेड पल्प और ब्लड फिर पास करता है कॉर्ड्स और रेड पल्प के थ्रू एंड देन फाइनली स्प्लिनिक साइनोसॉइड्स में. तो एक चैनल बना हुआ है ओपन में, क्लोज में ऐसा कुछ नहीं है. ह्यूमंस में ओनली ओपन सर्कुलेशन इज प्रेजेंट इन स्प्लीन. ठीक है, सो दैट इज द वन विच यू शुड रिमेंबर. ठीक है, जो कि खून जो जा रहा है फ्रॉम शीथ्स कैपिलरीज रेड पल्प में जा रहा है और फिर ब्लड कॉर्ड्स के थ्रू पास करके एंटर कर रहा है स्प्लिनिक साइनोसॉइड्स में. जबकि डॉग्स और कैट्स में, सॉरी डॉग्स और रैट्स में द क्लोज्ड सर्कुलेशन इज प्रेजेंट. ठीक है, सो दो सर्कुलेशन हैं. ह्यूमंस में ओपन सर्कुलेशन है, ये याद रखना है. ठीक है, ह्यूमंस, एग्जाम्पल इन ह्यूमंस. ठीक है, इन डॉग्स एंड रैट्स. ठीक है, इन डॉग्स एंड रैट्स. देन वी डिस्कस दिस एपिथेलियो लिम्फॉइड सिस्टम. बट इसके पहले एक चीज़ और है, स्प्लीन से रिलेटेड क्लिनिकल एक दो पॉइंट डिस्कस कर लेते हैं. दैट इज नंबर 1, क्लिनिकल में एक आ जाता है स्प्लीनोमेगेली. पढ़ोगे मेडिसिन प्रॉफ में डिटेल में. एंड देन स्प्लीनेक्टमी. अब इन दोनों वर्ड्स के मतलब समझ में आ रहे हैं. स्प्लीनोमेगेली मीन्स एनलार्जमेंट ऑफ द स्प्लीन. occurs because of immunological और hematological causes like abnormal RBCs, thalassemia, sickle cell anemia में splenomegaly मिल जाती है. इम्यून डिसऑर्डर्स, इन्फेक्शंस जैसे कि मलेरिया, स्प्लिनिक एप्सिस, टाइफॉइड फीवर या फिर रिमोटॉइड आर्थराइटिस, इन केसेस में मिल जाता है स्प्लिनोमेगेली. ठीक है. कैंसरस कंडीशंस लाइक ल्यूकीमियास, ब्लड सेल कैंसर्स होते हैं, ल्यूकीमिया. ऑब्स्ट्रक्शन टू वीनस ब्लड लाइक सिरोसिस ऑफ लिवर, ऑब्स्ट्रक्शन ऑफ पोर्टल वेन, इन केसेस में अगेन स्प्लिनोमेगेली मिलती है. स्प्लीनेक्टमी इज सर्जिकल रिमूवल ऑफ द स्प्लीन. सो इंडिकेशंस लाइक इंजरी टू द स्प्लीन, कैंसरस लीजन्स लाइक ल्यूकीमिया एंड सीवियर हीमोलिटिक अनीमिया एंड बहुत सारी चीज़ें. Patients after splenectomy they do not respond properly to the infections, तो infections more prominent हो जाते हैं इन cases में. ठीक है. Then have a look at this image for the epithelio lymphoid system. ठीक है, ये बड़ा इंटरेस्टिंग सिस्टम है. अगेन हेड एंड नेक में इसको हम अच्छे से डिटेल में पढ़ेंगे. सो दिस सिस्टम एक्चुअली कंसिस्ट ऑफ माल्ट. ठीक है, दैट इज द म्यूकोजा एसोसिएटेड लिम्फॉइड टिश्यू. ठीक है. सो अब इसमें यहाँ पर दो टाइप्स के टिश्यू आ जाते हैं. ठीक है. It consists of two tissues, two types. Okay, number one, the galt, that is the gut associated lymphoid tissue. Okay, then we have number two, that is the balt. Balt क्या है? Bronchus associated lymphoid tissue. ठीक है. So that is gut and that is bronchus एसोसिएटेड लिम्फॉइड टिश्यू. ठीक है. अब वेल डिफाइंड माल्ट जो है वो किस में है? थर्ड कैटेगरी माल्ट. इसको हम टाइप्स रहने देते हैं, कन्फ्यूजन होगा. ठीक है. इसमें जो टिश्यूज़ हैं बेसिकली क्या क्या चीज़ें हैं वो लिख लेते हैं. माल्ट. अब माल्ट एक्चुअली हैज़ दैट इज म्यूकोजा एसोसिएटेड लिम्फॉइड टिश्यू जो हमने डिस्कस किया था. ठीक है. माल्ट में एक्चुअली क्या है? इट हैज शोज एग्रीगेशंस इंक्लूडिंग द स्ट्रक्चर्स लाइक ट्यूबल टॉन्सिल. ठीक है, ट्यूबल टॉन्सिल. ओके. देन फेरेंजियल टॉन्सिल, देन पैलेटाइन टॉन्सिल एंड लिंगुअल टॉन्सिल. ठीक है. सो दीज आर सर्टन थिंग्स विच आर प्रेजेंट. ये दो अलग अलग इमेजेस हैं. ठीक है, जस्ट डोंट कंफ्यूज. There are two different images. ठीक है. One image is showing the sagittal section of head and neck and another is showing the tissue as a whole. ठीक है. Okay. So malt, galt, balt and malt. ठीक है. और lingual tonsil और malt, ये malt के लिए मैंने green किया हुआ है. ठीक है. So these are the malt examples. Pierce patches in ileum. ठीक है. So that is also an example जो मैंने बताया था. अब have a look at this image, that is for palatine tonsil. It is the largest tonsil. You can see this image, that is a palatine tonsil. ठीक है. लार्जेस्ट हेड एंड नेक में हम डिटेल में पढ़ेंगे इसको, बस एक सेंसिटाइजेशन है. सो दे आर लोकेटेड ऑन आइदर साइड ऑफ द ओरोफेरेंजियल इस्थमस. ये ओपनिंग है, दैट इज द ओरोफेरेंजियल इस्थमस. ठीक है, जिसे कहते हैं ओरल कैविटी और फेरिंग्स के बीच में एक इस्थमस ओपनिंग है. ठीक है. सो दैट इज द palatine tonsil which is actually characterized by the presence of non-keratinized stratified squamous epithelium. ठीक है, वो भी हम बाद में पढ़ाएंगे. ठीक है. इसका फंक्शन क्या है? दैट प्रोड्यूसेस द lymphocytes. ठीक है. Similarly we had the pharyngeal tonsil. ठीक है, that was an aggregation of lymphoid tissue deep to the mucous lining of the roof and posterior wall of pharynx only. ठीक है. Tubal tonsil भी इसे marked है, that is aggregation of lymphoid tissue around the opening of the pharyngotympanic or you can say auditory tube of the nasopharynx. ठीक है. Then lingual tonsil, that is the numerous you can say lymphoid follicles deep to the mucosa of the dorsal surface of the posterior 1/3 of the tongue. वो भी हम डिस्कस करेंगे जब टंग का चैप्टर पढ़ेंगे. ठीक है. Then there are also one more thing जो मैंने बताया, that is the Pierce patches. Pierce patches in ileum. ठीक है. ओके. ये भी एग्जाम्पल है हमारा माल्ट का. सो दे आर एग्रीगेटेड लिम्फॉइड फॉलिकल्स डीप टू द म्यूकस मेम्ब्रेन ऑफ द स्मॉल इंटेस्टाइन, स्पेसिफिकली इलियम. ठीक है. मोर न्यूमरस इन द इलियम. स्प्लेनेक्टमी के बाद एड्स वाले सिम्टम्स आते हैं, ऐसा नहीं है. इट इज नथिंग लाइक द इम्यूनिटी कमज़ोर हो जाती है ऑब्वियसली. ठीक है. ओके. तो ये हो गया हमारा. बिफोर आई जंप टू द नेक्स्ट टॉपिक, एक चीज़ और डिस्कस कर लेते हैं, क्लिनिकल. ठीक है, क्लिनिकल जहाँ जहाँ जो मुझे मिल रही है मैं डालता जा रहा हूँ, बिकॉज दैट इज़ इंपॉर्टेंट. जितना टेक्स्ट बुक्स में देखोगे यू विल फाइंड मोर क्लिनिकल एज मच एज पॉसिबल, जितना पढ़ोगे उतना अच्छा. टॉन्सिलाइटिस, ठीक है, टॉन्सिलाइटिस दैट इज इन्फ्लेमेशन ऑफ द टॉन्सिल. आइटिस आ गया इसके पीछे, तो वायरल या बैक्टीरियल इन्फेक्शन हो सकते हैं. टॉन्सिलाइटिस हमने एक्सपीरियंस किया होगा. देन देर इज एन इंटेंटेड एंटिटी नोन एज टॉन्सिलेक्टमी. ठीक है, सर्जिकल रिमूवल ऑफ पैलेटेंट टॉन्सिल इज डन इन द टॉन्सिलेक्टमी. यूजुअली चिल्ड्रन में वेयर यू हैव रिकरेंट टॉन्सिलाइटिस, रिपीटेड इन्फेक्शन हो रहे हैं उन केसेस में. ठीक है, देन यू हैव एडिनॉइड्स. नंबर 3, एडिनॉइड्स. तो दैट इज एन एनलार्ज फेरेंजियल टॉन्सिल ड्यू टू द इन्फेक्शन. एडिनॉइड्स बहुत ही ऑब्स्ट्रक्टिव होते हैं, वो नेजल रेस्पिरेशन को रोकते हैं एंड ब्रीदिंग जो है माउथ से, दैट इज़ वेरी मच मैंडेटरी इन दोज पेशेंट्स. ठीक है, सो एडिनॉइड्स अगेन वेरी इंपॉर्टेंट टू रिमूव. फिर आ जाते हैं लास्ट टॉपिक पे, दैट इज़ द इम्यूनिटी. सो एज यू नो, इम्यूनिटी का एक फ्लो चार्ट देख के वी कैन अंडरस्टैंड फ्यू थिंग्स. तो इम्यूनिटी दैट इज़ प्रोटेक्शन बाय द इम्यून सेल्स और एंटीबॉडीज, बहुत ज़रूरी है. इन्नेट और एक्वायर्ड इम्यूनिटी होती है. एक्वायर्ड कैन बी फर्दर डिवाइडेड टू एक्टिव एंड पैसिव इम्यूनिटी. ठीक है, एंड सो इम्यूनिटी इज द एबिलिटी ऑफ द ऑर्गेनिज्म टू रेजिस्ट अ पर्टिकुलर इन्फेक्शन या टॉक्सिक सब्सटेंस. ठीक है, सो इन्नेट इम्यूनिटी जो कि प्रेजेंट एट बर्थ, वेरी इंपॉर्टेंट. ठीक है, क्वेश्चन पूछा जाता है वाइवा में. innate immunity provides non-specific protection against all type of infections. ठीक है, and then we have the acquired or adaptive immunity. ठीक है, so that is what is having the acquired by the individual throughout the life. So acquired immunity के दो types हो गए. active, that is naturally acquired by the individual due to the exposure of the antigenic एजेंट्स और टॉक्सिन्स और माइक्रो ऑर्गेनिजम्स. और पैसिव इम्यूनिटी जब हम एडमिनिस्टर कर देते हैं एंटीबॉडीज़, जो कि तुम जाते हो इंजेक्शन लगवाने के लिए इम्यूनोग्लोबुलिन का, तो दैट इज़ अ पैसिव इम्यूनिटी. ठीक है, सो दैट इज़ ऑल एक्वायर्ड इम्यूनिटी. ओके, सो कुछ सेल्स हैं जो कि लिम्फॉइड सिस्टम में इंपॉर्टेंट है, दैट इज़ द टी सेल्स एंड बी सेल्स एंड नेचुरल किलर सेल्स, जो हमने स्टार्टिंग में डिस्कस किया था. फर्दर टी सेल्स में भी मेमोरी टी सेल्स, हेल्पर टी, CD4 टी सेल्स, एड्स वगैरह में इंपॉर्टेंट है. ठीक है, नाम सुना होगा. ये अगेन पैथोलॉजी प्रॉफ में डिटेल में पढ़ोगे, अभी मैं बहुत डिटेल में नहीं जाऊँगा बिकॉज ये पूरा पैथो का चैप्टर है बेसिकली. ठीक है, लिम्फॉइड सिस्टम. सप्रेसर टी सेल्स, तो ये बस नाम पता होने चाहिए भी फिलहाल के लिए, बिकॉज दैट विल बी मोर देन सफिशिएंट इस टाइम के लिए. ठीक है, बाकी डिटेल में पैथोलॉजी में, फिजियोलॉजी में यू विल रीड एवरीथिंग इन डिटेल. ठीक है, सो दैट्स इट अबाउट द टुडेज क्लास. थैंक यू सो मच. थोड़ा सा लेंदी हो गया, आई अपोलोजाइज फॉर दैट, बट आई रियली थिंक सो कि लेंदी होना इज़ अ गुड थिंग, बिकॉज आई एम कवरिंग मैक्सिमम कंटेंट जो कि यू गाइज नीड इट desperately. Okay, so thank you all.